Hey guys, happy Sunday to everyone. Sorry I am late. I had a delivery order that was supposed to be here and then wasn't, so they showed up right at 1:29. I'm like, shit, let me get this taken care of first. So I hope you guys are having a wonderful weekend. As I get my computer set up, thank you, Maylin, as always, for being here and sharing my links. I was also watching Maza. He's doing his fundraising for Kelsey Fitzsimmons. He's got a wonderful panel on right now, including Baker, Will the Glare, Turtle Boy just joined. So I was enjoying that. I just have to pull up the trial channel. So bear with me, because today we are getting into the neurosurgeon, Aizik Wolf. Who I still, in my opinion, don't understand why they went with him, being that he works on live brains, not dead ones. But his testimony is, I don't want to say amusing, but he does get to share that he, makes cappuccino for his wife every morning and doesn't get admonished by Auntie Bev the way that, was it the other doctor Wolf or Rentschler that said happy birthday and got like chewed out by the bitch. All right. So we're starting today with Aizik Wolf. Then we have the testimony of, I can't remember her name, but the MSP Crime Lab, the glass expert, that basically spends her entire testimony just saying that, nothing matched. It's kind of ridiculous testimony, which I may at some point, I may decide to skip. I didn't look at how long it was. I know it isn't long, but I couldn't remember if her testimony truly held anything important or not. And that happens a lot because it's been so long. And now haven't seen Auntie Bev. So if more people join today, I will ask if anyone remembers if her testimony is truly needs to be rewatched, because then we are going to get into Welcher from Aperture. Play with blue paint. Dr. Wolf's testimony, the neurosurgeon, Dr. Wolf's testimony is only 37 minutes or 47 minutes, something like that. And we're going to start at 1.5 speed. Hopefully that won't be too fast so we can get through it. $47 minutes. Okay, so here we go.
You solemnly swear the evidence you give in the court and jury in the case now and hearing to the truth, the whole truth, and nothing but the truth, so help you God. I do. Thank you.
Good morning, Josh.
Good morning.
All right, whenever you're ready, Mr. Brennan.
Thank you, Your Honor. Good morning, sir.
Good morning.
Could you please introduce yourself to the jury, spell your first name and last name for the court reporter?
Sure. My first name is Aizik, A-I-Z-I-K. It's phonetic. Last name is Wolf, W-O-L-F, like the real thing.
What do you do for a living?
I'm a brain surgeon.
Is there a special part of medicine that you study?
Well, my main interest in brain surgery is brain tumors,
and trigeminal neuralgia, but I also specialize in movement disorders. I do pediatrics and adults.
Are you an active working neurosurgeon?
I am very active working neurosurgeon. I get up every day at 4:30 in the morning to go to work, 5 days a week. I take call 300 days out of 365 days a year.
Did you work yesterday?
Yes, I did.
What type of work did you do yesterday?
I did 2 brain surgeries yesterday.
Are you working tomorrow?
I have 4 surgeries scheduled for tomorrow, which is why this is a little bit delayed for me, and I have 4 on Friday.
And what type of surgeries do you have tomorrow and Friday?
I have 3 brain tumors, 1 trigeminal neuralgia, and on Friday I have 4 patients with movement disorders.
You're here today as a witness. How much of your practice, how much % of your income is from being a consultant or a witness for a case?
Probably less than 1%. I don't do this for a living.
I want you to take us through some of your education and background. Could you share with us where you went to medical school and where you graduated from?
I went to Yale Medical School. I graduated summa cum laude.
Was that in 1981 that you graduated?
Correct.
After medical school, did you begin internships in medical residency?
I did an internship at Hennepin County Medical Center, which is a trauma center in Minneapolis. I then did 5 years of neurosurgical residency at the University of Minnesota.
And was that in Minnesota?
Correct, in Minneapolis.
Is there something about that hospital that has some specialty?
It was one of the #1 training centers for chairmen in neurosurgery at the time.
Did you, in your residency and in your fellowships, do any work or study in pathology?
During your residency as a neurosurgical resident, you do 6 months in neurology, you do 3 months of neuroradiology, you do 3 months in pathology, which includes autopsies on brains. And then you do rotations through a trauma center as a chief resident, through a VA hospital, and then ultimately at the university hospital for elective cases. We also do 6 months of pediatric neurosurgical residency.
Did you do a fellowship at New York University?
Yeah, at NYU, I did a fellowship before I went to the University of Maryland as a professor in brain transplantation. The interest was in using cells to create dopamine centers in rat brains with the concept of Parkinson's being curable with transplantation.
I'd like you to take us through some of your faculty positions, and so you can share with us some of the progression of your training and experience. And did you begin at the University of Maryland Hospital?
Yes. In 1987, the University of Maryland recruited me to start their epilepsy surgical program and skull-based program. And then part of our responsibilities as assistant professors was to cover shock trauma.
Could you explain for us what shock trauma means and whether the University of Maryland Hospital was a shock trauma hospital?
So the University of Maryland and shock trauma were actually 2 separate entities when I started. A man named Cowley had basically developed the concept of the golden hour. So prior to Dr. Cowley, most trauma was just taken locally. That meant as a community hospital, if a patient had been in a motor vehicle accident, they needed an orthopedic surgeon, they had to call the orthopedic surgeon in, could take 15 minutes, could take 3 hours. The same thing for a vascular surgeon, the same thing for a neurosurgeon. Dr. Cowley came up with the concept that you needed a center that was strictly for trauma, and every attending had to be in the hospital 24/7. So that was the concept of shock trauma back in the 80s. When I got there, we were transitioning from a very small center to a 125-bed hospital that was completely committed to trauma.
In that experience, in the years you worked there, did you have an opportunity to treat a number of people with brain injuries?
We treated well over 100 patients a month, basically, with brain injuries at shock trauma, along with spinal cord injuries.
Did you perform surgeries in different types of brain trauma and brain injuries?
Yes.
After Maryland in 1993, did you move to Miami Neuroscience Center?
Yes. In 1993, I left academics. I went into private practice in Miami, and I started the Miami Neuroscience Center. We were the first private community hospital to have what's called the Gamma Knife. So we were the 13th in the country, but the only one that was non-university based. And Gamma Knife radiosurgery is using radiation to operate on the brain.
Are you presently the director of the Miami Neuroscience Center at Larkin Hospital?
Yes, I am.
You conduct a number of surgeries a year there?
Correct. So I spent 19 years at Doctors Hospital, then we moved to Larkin Hospital 13 years ago, developing the new radiosurgical unit called ZAP, and also another fancy machine called high-frequency ultrasound to treat the movement disorders.
You've noted that you have a number of professional memberships. I don't want to go through all of them. I'd like to point out a few. Are you a professional member of the American Association of Neurological Surgeons?
Yes.
Are you a member, a fellow American of the College of Surgeons?
Yes.
Are you a member of North American Skull-Based Society?
Yes.
And is that brain related?
It is.
Are you a member of the Society for Neuro-Oncology?
Yes.
Are you a member of over or at least 34 different professional memberships?
Yes.
In your career, have you engaged in research?
Yes.
Has that research focused or centered on brain injury?
Yes, it has.
Is some of your research as a principal investigator for THAM treatment of brain tissue acidosis in severely head injured patients?
Yes.
Did that research and as a principal investigator help you in your diagnosis and treatment of brain injuries?
It actually was in the treatment of severe head injuries patients who are unconscious. The concept of trying to relieve the increased intracranial pressure that occurs from the injury and to increase blood flow, thereby increasing oxygen to the brain.
Did you also serve as principal investigator for research for the PEG SOD and severe head injury?
Yes.
Could you describe that very briefly?
Basically the same, one of the biggest problems in brain injury is the fact that blood flow ceases to exist as the brain swells up. And so one of the things we try to do is preserve the neurons by making sure that they have enough oxygen and blood flow to them. All these are agents that try to assist that.
I won't go through all of your research and principal investigator roles, but I want to ask you about one more. And that is, did you serve as principal investigator relative to the IRB protocol for brain pathology?
Yes.
And what did that do? What was that about?
It was about looking at what happens after a brain injury to blood vessels and tissue as the intracranial pressure increases in the brain.
Have you been part of publications of a number of different books?
Yes.
I won't list parts of all 16 books, but can I point out a few?
Sure.
Were you the author of a book chapter regarding head injury, difficult medical management?
Yes.
Were you the author of a book chapter on pediatric neurosurgical emergencies?
Yes.
Were you the author of a book chapter on complications of head injuries in adults?
Yes.
Were you an author of a book chapter, imaging of craniocerebral trauma?
Yes.
Were you an author of a book chapter in emergency room assessment of the head injury patient?
Yes.
Were you the author of a book chapter, intracranial injuries?
Yes.
I won't list or ask you about the other book chapters that you've been the author of. Have you been involved in journal articles?
Yes.
I'd like to ask you just about a few of the 70 journal articles that you have published.
Your Honor, objection.
So go ahead and ask the question about others first.
Were you an author of a journal article, intracranial pressure in non-traumatic ischemia and hypoxic cerebral insults?
Yes.
Were you the author of a journal article, post-traumatic cerebral infarction?
Yes.
Were you the author of the journal Fractures of the Clivus?
Yes.
Can you tell me a little bit about that paper?
We used thin cut CT scans to identify fractures of the skull base. Prior to CT scans, it was very difficult to actually identify radiologically a skull fracture with plain x-rays. The idea was to see if we could identify them more clearly. And so we classified them and delineate them in the paper and discuss the outcomes that were relative to those type of injuries.
In the last journal article I'll ask you about, were you the author of a journal article regarding acute traumatic midbrain hemorrhage?
Yes.
Were you the presenter in a number of presentations regarding head injury and brain injury?
Yes.
You've listed 93. I'll ask you just about a few. Were you a presenter in fractures of the clivus, clinical and radiographic features?
Yes.
Am I pronouncing that correctly?
Clivus.
Thank you. Were you the presenter in acute head injury?
Yes.
And a separate presentation, fractures of the clivus, classifications and clinical features?
Yes.
Do you lecture?
Yes.
Do you have peer-reviewed publications?
Yes. That was one of them.
And are you heavily involved in clinical research?
Right now, my research is more based on radiosurgical techniques and outcomes.
Over your career and your study and your clinical experience, have you treated different types of brain injuries?
Yes.
Are you familiar with a number of different types of brain injuries?
Yes, we still treat them.
Were you asked to review materials relative to this case?
Yes.
And do you recall the materials that you reviewed?
Yes.
Could you share with us some of the materials that you reviewed?
I reviewed the chief medical examiner's assessment of the case. I reviewed pictures that I'm assuming the medical examiner took of the autopsy. And I reviewed the report from the forensic pathologist.
And before I ask you about your review of specific materials and your opinions in this case, is there a benefit to your clinical experience in studying brain injuries as opposed to the experience you had as a fellow simply with pathology?
Well, I think that for the jury to understand, as a clinician understands the process from the time the injury occurs till the patient either leaves the hospital or dies. And it's a process. And as a neurosurgeon, I have a tremendous amount of experience with that, if that's what you're asking me.
Yes. And so, Doctor, you reviewed a number of items of information in this case. Did you have an opportunity to review photographs of a laceration to Mr. John O'Keefe's head?
Yes, I did.
With the court's permission, I'm going to ask to display Exhibit 160.
Okay.
Dr. Wolf, I'm going to ask you to take a look at this photograph. Have you seen this photograph before?
Yes.
I want you to explain to us what you're seeing here and take us through the process of your observations.
Well, what we're seeing is an approximate 1.5 inch laceration with bridging tissue and contusions and abrasions. To us, that's just a classic blunt trauma injury. There's nothing other than just vanilla about it. This is what happens when soft tissue hits a solid ground. The skin tears apart a bit, but not through and through. As you can see, there's the bridging. You can see all the bruising or contusions and just the tear, a little bit serrated along the edges.
Thank you. If you could take that down. Dr. Wolf, as a result of that wound, did you have a chance to further look at information provided to you about the actual inside the skull of Mr. John O'Keefe?
Yes, it was the pictures that I was reviewing showed a non-depressed skull fracture extending linearly through the clivus and into the frontal fossa of Mr. O'Keefe over the orbital roofs. He had fractures along the temporal fossa as well. So it was a classic linear basilar skull fracture.
Is basal skull fracture a
It's
characterization?
basically the base of your skull is what it encompasses. So the opening at the very bottom is what we call the foramen magnum. That connects your brainstem to your spinal cord. And then as your brainstem goes up, it goes into the different skull areas that, talk about what we call the cerebral cortexes, your occipital lobe, your temporal lobes over here, and then your frontal lobes.
So can you walk us through what happens when someone incurs this type of injury to the back of the head, how it happens, and what are the next steps for a person?
So what happens is, you fall backwards, and the linear acceleration starts to take you back down with gravity.
Yeah,
The skull hits the ground.
shut up, Dr. Wolf. I said this then, and I say it now: is this guy? He works on live brains. It's ridiculous that he was even allowed to testify as an expert, in my opinion. I mean, this guy, seriously, he literally admits in the very beginning that he was studying how to fix, or do transplantations for curing Parkinson's, which still to this day, there is no cure. And he wants to sit here and say things that don't matter. The person and brain they're talking about is deceased. This man works on live brains. He just has nothing that is good to offer. And in my opinion, should have never been allowed to testify as an expert in this case.
It gets, in layman's terms, smashed a little bit. And then the brain moves forward as a response to that. And it moves forward because you have cerebrospinal fluid and because you have the deceleration, acceleration again. As it does, your skull, if you were to look inside your skull, it's like mini mountains along your temporal bones and your frontal bones. So the brain is being thrust forward at a fairly good speed, and it's getting bruised. You can think of it as if you took a hammer to your thumb. It's really turning black and blue. Those are the contusions. And so the temporal poles and the frontal poles are getting contusions because of that. At the same time, you have a space called the subarachnoid space. And I'm sure they're going to hear about the subarachnoid hemorrhage. And that space is it's very clear, thin membrane that covers all of your brain and all of your spinal cord. And normally, you really don't see it unless you open up the brain and you're operating. But when you either have a traumatic event like this, where little vessels are pulling apart underneath that membrane, or for example, the classic, when you have an aneurysm burst, the space that the aneurysm bleeds to is the subarachnoid space. The other thing that occurs in trauma like this is you can get a subdural. So the dura is the membrane that covers the whole brain and also right down your spinal canal. And it's a very thin membrane that looks like very thin leather. And in that space between the brain and the dura can be a lot of veins that go towards a central vein called the sagittal sinus. And if those tear, you have a venous hemorrhage from, which is not arterial, so it's not quick, but that can develop into a subdural as well. If you tear a portion of your brain as well, and you get a little arterial bleeds, that could create a much faster subdural hematoma. And so when you look at the pathology, the autopsy of his brain, you're looking at a subarachnoid hemorrhage, you're looking at a subdural hemorrhage, neither one of them which was huge or would have required surgery, as well as the contusions that I described in his frontal poles, in his temporal poles, and then the original bang, which was in the occipital area. These are all findings that you would see on a CT scan and an MRI scan without requiring an autopsy if he had made it to the emergency room.
I want to take a step back at the beginning. You said that this laceration on the back of his head was caused by a fall. Could this be caused by a fall landing on hard ground?
Yes, and like I said, it's a classic blunt trauma laceration.
Do you have an opinion to a reasonable degree of medical certainty whether this injury, the laceration and the basal fracture, was caused by Mr. O'Keefe falling backwards on the ground?
My opinion is that that's what caused his whole injury.
And the worst, and actually, I think what the most important thing this guy says is that he sees this injury in people who fall down drunk. The fact that he couldn't say, oh yeah, I've seen this injury from people who got hit by a car, smashed their head, and still survive. Yeah, and didn't have any bruises on the rest of their body though. Yeah. He shouldn't have been on the stand. That's just my opinion. But
The pattern of the laceration, do you have an opinion whether that is consistent with hitting the cold hard ground?
So I'm sustaining the objection, so no sidebar.
Do you have an opinion, doctor, about whether that laceration on the back of his head was caused by a particular movement?
Well, the only way he could get this kind of an injury was to fall backwards, hit the back of his head, and then the resulting, energy forces going into his brain, into his base of his skull.
Would that type of laceration require Mr. O'Keefe to have hit a line type or ridge type object?
A ridge type of object?
Yes.
No, I mean, like I said, the tearing of the skin in that fashion, you could look it up, would be just a classic blunt trauma injury.
Is there anything about that injury that would suggest to you it had to have been something sharp or ridge-like to cause?
Objection, Your Honor. Begin the court's timing is on this.
All right, we can just.
So as we were discussing, Dr. Wolf, you said this is a classic fall backwards. Is there anything about the pattern of that laceration that would suggest that there was a ridge or a line type edge that caused that wound?
Not necessarily.
And have you seen, in your experience, similar types of lacerations and breaks caused by falling on hard ground?
Yes, you can see that both in the occipital region. You can see it if patients fall on the forehead. The skin tears, they're still bridging, and then they get bruises.
Some of your work was in Minnesota.
Correct.
Was it a colder part of Minnesota?
Very cold part of Minnesota. It's Minneapolis.
I'm sorry. Did you often see these type of injuries there?
Yes, I mean, we took care of a trauma center, Hennepin County. Very frequently, patients that are drunk fall down on ice sidewalks and could develop, lacerations in their head, epidurals, which are blood clots above the dura because they fracture a bone in the temporal area and they can get a bleed from a fractured artery. And it happens when people are shoveling snow and have a heart attack and fall backwards. So there are various ways that people fall, resulting in head injuries and lacerations to their forehead or to different areas of their head.
Can somebody suffer this type of injury simply by falling backwards?
Absolutely.
You had taken us through the process of falling backwards and then talked about what happens to the brain. Can I ask you a couple of detailed questions about that?
Sure.
When you explained that the brain upon impact then shifts forward and hits the front of the skull, is there a medical term for that process?
Well, the medical term is a coup counter coup injury. So the coup is when you first hit. In this case, it was the back of the head, as summarized by the laceration in the back of the head, and the contusions that the pathologist and the ME found in the back of the brain. And then the brain shifts forward, and as it's traveling at a certain velocity, because it's thrust forward on the floor of the base of the skull, it's getting bumped. And it's getting, again, you can think of it as a hammer hitting a thumb. It's getting black and blue in the areas that are sharpest.
Are there symptoms that result of the process coup counter coup?
This is clinically, it varies. I mean, you can go from anywhere from a simple concussion where you sort of are unaware of what happened, but you're still awake, you're confused, all the way to, ultimately being in a coma.
Can this type of injury, the coup counter coup, and what you see in the review of your files, could this type of injury happen from an attack by a weapon, like a bat or a hammer?
Well, he did not have a depressed skull fracture. So any focal hit like that would more likely than not have caused a depressed skull fracture. Blunt trauma, the way he had, the assumption, would cause the coup counter coup without a depressed skull fracture.
When the coup counter coup process happens with the skull fracture, does anything happen to the front of the skull?
Well, you're asking, does the rest, I mean, the forces, depending on how hard they are, can generate fracture lines all the way to the anterior fossa. So you can have fractures along the lateral temporal area. You can have fractures along the orbital roof. The orbital roof is very thin. And so those forces can go all the way to that area.
Did you see any sign of orbital fractures in Mr. O'Keefe?
Yes, he had both the ME and the pictures taken and the neuropathologist mentioned fractures of the orbital roof.
Do you have an opinion to a reasonable degree of medical certainty how those fractures occurred?
From the trauma.
Could you just explain a little bit how that would happen?
Well, as he fell backwards and he struck his head, it was clearly at a very high speed generated by the gravity. The bone, depending on the quality of his bone, the density, then generated forces. There's a certain amount of lateral give, and then you get a linear force going forward. It drives all the way up the clivus and forward into the anterior fossa where his orbital roofs lay. And this is why people like this get what they call raccoon's eyes.
Do you have an opinion whether the brain itself could have caused the orbital fractures?
No, the brain is a soft substance. You could literally put your finger through the brain. We often operate on people fully awake. the brain couldn't possibly cause a fracture. The fracture was caused by the forces generated through that clivus, that middle bone in the middle of his base of the skull.
Do you have an opinion to a reasonable degree of medical certainty whether or not the brain in any way could have caused these orbital fractures?
The answer is absolutely not.
In your study of the records and photographs and in your experience treating these types of injuries, do you have an opinion to a reasonable degree of medical certainty whether or not a person would remain conscious or would be immediately unconscious after the impact of the ground?
Well, it's impossible to know whether he became immediately unconscious, but his injuries were very substantial. And it's more probable than not that at some point he quickly became unconscious and was unable to do functional activities.
What does functional activities mean?
The ability to, get himself up and about would be one of the functional activities. The ability to call for help would be a very significant cortical function. And that's why I was talking about, that there's a variation on a theme from a simple concussion to a severe concussion like this.
If a person does not have functional abilities because they are rendered unconscious, does their body, could it still move?
Yes, this is the interesting thing about our brain. So the cortex, which is the top portion of your brain, can get separated from your brainstem functionally. And what happens then is that your body is not acting autonomically, meaning vegetative. So why does that happen? We think it's because as we were a caveman, and if a caveman became unconscious, as an animal came up to eat it, the animal would touch it. Well, you have these automatic movements. One of them is called decorticating, which is where you draw your arms like this and you throw your feet out. And then a worse neurological situation is when you decerebrate. Now you push your arms out along with your legs. And that would scare off an animal. So we think that over time, genetically, this is what happened to our brains in order to create these. But those kind of movements are not thought processes. In other words, your brain is not telling you, oh, you have pain, go ahead and decorticate or decerebrate. It's an automatic movement in response to pain.
I want you to take us back now to after the fall. Would Mr. O'Keefe, in your study and opinion, have died immediately?
No.
Can you share?
Yes, I'll tell you. There are very few things that you head injury where you would die, quote, immediately. So if I took a knife and stabbed you in the back of your neck right below your skull and I drove it through your brainstem, you would probably die immediately. If I shot you below your ear and went through and through below your ear and shot through your brainstem, you would die immediately. But traumatic head injuries, you would not die immediately. It's a process. And it's a process of a combination of things. Brain swelling, which takes a while to develop, decreased blood flow to your brain because you're getting swelling, and ultimately death of the brainstem that controls your heart and your breathing. And so this is why there's a whole big issue about brain death. When is someone brain dead? Because it's not instant and it can take a long time to be conceived. In these injuries that are very severe that we took care of, there was a high mortality rate. In the linear skull fractures, it was about 67%. But it took time for them to die. It could take days to weeks to months. And also, these people got to shock trauma. So it was a while, whether it was hours, before they were even starting to be taken care of. And yet they weren't dead yet. That's why I don't think it was immediate.
Was there any other observations you made about Mr. O'Keefe or his body that support your opinion that he didn't die immediately?
Well, the medical examiner took pictures of his periorbital area and diagnosed raccoon's eyes. So raccoon's eyes occur because there's leakage through the orbital fractures into the periorbital space. Normally, it takes about 24 to 48 hours to develop. It has been noted as early as 1 to 3 hours, which would make it not immediate.
Could we please have Exhibit 14? Dr. Wolf, could you share with us what you see here in this picture?
So right here, you can see the black and blue that sort of configures, if he had his eyes open, like what we describe as raccoon's eyes, right? And that's not caused by direct trauma to his eyelids. It's caused by what I described as the basilar skull fracture, which went to the anterior fossa, which is right over the orbit here, inside with leakage of blood products into that periorbital area.
You mentioned that starts or takes at least 1 to 3 hours to begin?
Minimally, yes.
You take that down, please. If Mr. O'Keefe had been brought to a trauma center or emergency room, what would the process be in your experience?
Well, he would have been intubated if he wasn't intubated in the field. One of the first things you need to do in a head injury is control the airway. Why? 2 reasons. One, you want to have enough oxygen going to the brain defeated. And two, you want to keep the carbon dioxide down because that causes increased intracranial pressure if it elevates. So you want to constrict the blood vessels a little bit. Then he would have had a CT scan immediately in order to assess whether he has a surgical head injury, meaning he needs to go to the operating room to evacuate something or not. During that process, he's obviously going to be getting medication to decrease the brain swelling. And from there, you make decisions based on his neurological function and what you're, capable of doing to, spare the brain from the rest of the injuries that will result. One of the things that occurs with contusions is a great medical term is they can blossom, which means they can get bigger. And if they get bigger, they might require surgical intervention to decrease the pressure as well as the volume of the blood that's destroying brain. And so you do serial CT scans in these patients over time, anywhere from every 6 to 12 hours to on a daily basis, depending on what the case-by-case, production of blossoming is occurring.
You mentioned that about 2/3 of your patients who suffer this injury pass.
Correct. What we saw is that in the patients that suffered linear clavicle fractures, 2/3 of them ultimately went on to die, and 1/3 lived.
Is there commonality on how they pass?
One of the common reasons they passed is if they trapped a major vessel in one of the fractures, they would get a significant brainstem infarct, meaning a stroke, meaning lack of blood flow to a very significant portion of the brainstem. And so that was one of the causes of death that ultimately we understood. And then the others died from the increased intracranial pressure that drove the brainstem down through the foramen magnum.
Did you review any materials that talked about or identified Mr. O'Keefe's body temperature when he was treated?
As I recall, his core temperature was 80 when he was found.
Is that significant in the process and development of his injury from the moment he fell and hit his head until his ultimate passing?
Well, hypothermia, if you define hypothermia, it starts at 95 degrees. Your core temperature is usually about 98, 98.6. 95 is very mild hypothermia. When you get to 82 degrees, you're in severe hypothermia. What happens when you're hypothermic, and I'm a neurosurgeon, but I can tell you that you get into multiple organ failure. Your heart starts to have problems. It can have arrhythmias. You're not breathing. And ultimately, at hypothermia, you also become unconscious and go into a coma-like state. Below 80 degrees, you're probably going to die. So all I can tell you, it wasn't helpful that he had a significant head injury and that he was then found hypothermic.
Is it uncommon in your experience for people that suffer this injury to pass within 5 hours?
Well, none of the patients we treated died within 5 hours, but it also didn't mean that we didn't realize that they were going to be in a potentially vegetative state. When someone's hypothermic, you have to warm them up in order to establish a clinical status, meaning you can't declare someone dead with a temperature of 80. You have to warm them up slowly, appropriately, and then reevaluate where they are clinically.
I'd ask you questions about whether you had an opinion about Mr. O'Keefe and when he died. I want to ask it in the form of a formal opinion. Do you have an opinion to a reasonable degree of medical certainty whether Mr. O'Keefe died immediately or within 15 minutes?
No, I don't think he died immediately. Neither the hypothermia nor this kind of head injury would kill you immediately in any clinical experience I have.
Dr. Wolf, thank you.
All right.
Mayor, Your Honor.
Yes.
Good morning, doctor. I don't think we've had the pleasure of meeting. Welcome.
Thank you.
Sir, can you just describe, you started to do it a little bit on direct, a typical day for you?
I wake up at 4:15 in the morning. I go to my center. I set up patients with frames for their either radiosurgical procedures or stereotactic craniotomies. I go home. I make cappuccino for my wife at 6 o'clock in the morning. And then I get back to work at 6:30 and move on. I have patients that I'm operating on, and I have patients that I'm seeing through the day.
What type of patients and what type of work? Just in a typical day. What are you doing? What type of patients and what do you do?
It varies. I see patients with brain tumors. I see patients with hydrocephalus, which is water in their brain. I see pediatric brain tumors. I see subacute and chronic subdural hematomas, post-traumatic. I see patients with strokes that are being misdiagnosed. I see patients with cancer, metastatic disease. I used to see patients with cervical problems. I stopped doing that 2 years ago. I don't know what else you want me to tell you.
No, that's great. And is that typical day, typical of the type of days you've had for the past month, past few years? Is it generally, without specifics, is it generally?
Correct.
So none of your typical days, none of the past typical months have involved forensic pathology, have they?
Exactly.
You haven't acted as a forensic pathologist.
I am, if you could have asked that question, very straightforward. I'm not a forensic pathologist. I'm a brain surgeon.
Right. And you don't perform autopsies, correct, sir? You're a brain surgeon.
Correct. In other words, I see more brains than the forensic pathologist.
Right. And
But you
is it
see
correct
them
to say
alive.
that the brains that you see are of living people?
Correct.
Okay. So what I'd like to do is to go to a different part of the head than was discussed, but sticking with the deceased.
Excuse me, I didn't hear the last
I'm
one.
sorry, with the topic is going to be Mr. O'Keefe, the deceased in this
Okay.
matter, sir. You testified about raccoon eyes. The medical term for that, sir, is ecchymosis. Right?
Correct.
And ecchymosis, raccoon eyes, does not cause a laceration to form on an eyelid, does it?
No.
Are you aware that Mr. O'Keefe had a laceration to the outside area of his right upper eyelid?
I am aware that the ME described that. Yes, sir.
Now, could, Your Honor, I'm going to, with Your Honor's permission, ask to publish what is already in evidence in a moment.
Okay.
Mr. Wolf,
What exhibit number, Mr. Alessi?
we're going to, 165, Your Honor.
Go right ahead.
Thank you. Dr. Wolf, have you seen this photo depiction before today?
I believe I have.
Is it correct that that injury on the upper right eyelid is caused by the application of force directly to that area of the front of the head, again, namely the upper eyelid?
That's possible. Yes.
Is it more than possible? Is it probable that that injury was caused by the application of force directly to that area of the front of his head?
Well, an easy answer to that would be is that that's not part of the periorbital ecchymosis.
Thank you, sir. That was exactly going to be my next question. This injury is unrelated to any of what you've been describing, the fall backwards, the force transfer inside the skull, the, as you described it, the dura, the cerebral spinal fluid, all of that dynamic that you so ably described on your direct examination. This injury has nothing to do with that, correct?
Correct.
Thank you for answering my questions, Dr. Wolf. A pleasure again. No more questions at this time, Your Honor.
Any brief follow-up on that?
No, thank you.
All right, Dr. Wolf, you're all set. So
All right. So that's
Thank you very
it.
much.
Like I said, a waste of time. Next is the MSP glass lady. Let's see. I can't remember for the life of me if she testifies, besides saying that nothing matches. If
All right, so whenever
anything,
you're ready.
so we'll get through it.
Good afternoon, ma'am.
Good afternoon.
Could you please introduce yourself to the jury, spelling your last name for the court?
Sure. I'm Christina Hanley. Hanley is Hanley.
And Ms. Hanley, what do you do for work?
I am a forensic scientist 3 at the Massachusetts State Police Crime Laboratory in the Trace Arson and Explosives Unit.
And where did you go to school?
I went to, I had received my Bachelor of Science in Chemistry with a concentration in forensics from Merrimack College.
And do you have any other degrees?
I do not.
Now, following your education, where did you first go to work?
I began working at the State Police Crime Lab in 2008 in the drug identification unit. And in 2009, I transferred into the Trace unit. And in 2017, I was promoted from a forensic scientist 2 to a forensic scientist 3 in the Trace Arson and Explosives unit.
Could I ask you please to speak up, please?
Ms. Hanley, if it helps, that microphone is adjustable, so if you could get it as close to you as possible, that would be great. Thank you. The Massachusetts State Police Crime Laboratory where you work, is that accredited?
Yes, it is.
And by whom?
We are accredited by ANAB.
And what does ANAB stand for?
ANAB stands for ANSI National Accreditation Board.
And what does ANSI stand for?
Hi, Joy.
Sorry, I can't remember exactly what ANSI stands for. I apologize.
That's okay. As part of that accreditation
Well,
process, do you
just
undergo any
missed
sort
Dr.
of
Wolf.
proficiency testing?
Yes, I do.
And can you explain to the jury what that proficiency testing process consists of?
Sure. So proficiency tests are a quality assurance measure that's used to monitor performance. And I'm required to complete at least one external proficiency test per year, where I'm authorized to do casework in multiple subdisciplines. In my unit, I typically complete more than one proficiency test per year.
His testimony was
And-
completely irrelevant. It was not
What
relevant.
areas do you specifically undergo
He
proficiency
works on
testing?
my brains. It's
Sure. So
ridiculous.
I'm authorized to do casework in multiple subdisciplines in Trace. So I complete proficiency tests in the subdisciplines of hairs, paint, fibers, glass, tape, and serial number restorations and physical match examinations.
And generally speaking, what is entailed in those proficiency testing that you're given multiple times a year?
It's provided by an external company that provides the proficiency test, and I'm required to.
Actually, Joy, I can ask you, since you're here and listening. I didn't even know if her testimony was worth going back over. I figured it's only an hour and a half, and at 1.5 speed, probably get it done in less than an hour. But I can't remember if she says anything literally relevant. Besides the fact that none of the glass matches. I mean, it's stupid. I have no, like you said, most of the testimony is irrelevant. I get it. And of course, next, because after this woman is, Dr. Welcher. He gets to spread his load everywhere. So once we get through her, we're getting to Dr. Welcher.
Successfully complete one of those proficiency tests per year.
Now, have you successfully completed each of those proficiency tests that you've taken?
Yes, I have.
What type of training or continuing education have you undergone at the State Police Crime Laboratory?
Sure. So I had internal training as well as external training. The internal training consisted of I had to complete required readings. I was required to complete some laboratory exercises, learn how to utilize the instrumentation in the lab. I observed other analysts in the unit working on casework. I was also required to complete a written exam as well as a competency test, and in addition to that, a mock trial.
Now, you mentioned earlier in the testimony you're a forensic scientist 3 currently, is that correct?
That's correct.
And what is the difference, or can you explain the difference to the jury between a forensic scientist 2 versus a forensic scientist 3?
Sure. So a forensic scientist 2 is essentially just like a bench chemist who their primary role or responsibility is casework. A forensic scientist 3 does casework, but in addition is also a unit supervisor.
Now, what does the trace unit do or examine within the Massachusetts State Police Crime Lab?
Sure. So I'm responsible for examining and comparing trace items that, for example, such as paint, glass, fibers, hairs, tape, miscellaneous items. I also perform serial number restorations on firearms and physical match examinations.
And what are your general duties and responsibilities within the trace unit within the lab?
So I am responsible for the general operation of the unit. I train other forensic scientists within the unit. I also complete technical and administrative reviews of casework. And I also complete my own casework in the trace disciplines that I previously mentioned.
Now, Ms. Hanley, you as a supervisor, you review other analysts' work within the trace unit, correct?
Yes, I do.
And who reviews your work for any sort of trace analysis that you do?
So depending on what the subdiscipline, some of the casework that I'm authorized to do work in, it needs to be technically reviewed by an external technical reviewer because I'm the only one within my unit that can do certain types of casework currently. So we have to utilize an external technical reviewer at this time.
Now, with reference to physical match analysis, can you explain to the jury first, just in general terms, how is that analysis performed?
Sure. So when I receive an item, I take that item into my custody, and I document it with photographs, and I make observations and take notes, and then I'll examine the items microscopically, and I will do any comparison work to determine if there is or is not a physical match between items.
Now, that physical match analysis within the trace unit at the state lab, is that general work supported by any sort of scientific principle or methodology that you're aware of?
Yes.
Let me ask you this. Are you familiar with something called the Lockhart exchange principle?
Yes. So the Lockhart exchange principle, it's kind of the foundation or basis of trace analysis. It is a principle that states that when two objects or two items come into contact with each other, there is an exchange of material.
Now, with reference to your workspace, what is it that you do to your bench between your examination of separately packaged items?
Sure. So the bench top as well as the tools that I'm going to use are all cleaned with a bleach solution. And once that's done, there's a clean piece of butcher paper that's put down on the bench, and that's done in between looking at different items.
And why is it that you do that in between looking at different items?
That's done to prevent any cross-contamination.
Now, you've alluded a little bit earlier in your testimony, but on what types of evidence can you perform a physical match analysis?
Sure. So physical match examination can be conducted with many different types of material. For example, plastics, glass, tape, etc.
Now, when evidence is submitted to your lab, how is it kept track of throughout its stay at the lab?
Sure. So when evidence is submitted to the laboratory, the case information is put into our LIMS system, which stands for Laboratory Information Management System.
And once it's assigned that number, how is it sort of tracked as it progresses through the different units within the lab?
Sure. So the unique case number that's assigned to the case is tracked within the system. It's referred to as the chain of custody. So items of evidence will get scanned depending on where their location is, and the LIMS system keeps track of all of that, so we know exactly where an item is.
So when you take an item or you receive an item to be tested, can you explain to the jury what you do to begin your analysis?
You are welcome here.
Sure. So when an item gets scanned into my custody, after I've prepped my area to examine the item, I scan that item into my custody, and I will document that item with photographs. I will make notes of my observations.
See you when you get back.
I will examine the item microscopically.
But
if needed, I'll proceed with sampling and
here,
possibly
sweetie.
additional microscopic examination and instrumental analysis.
Now, specifically starting with items of glass, when you take an item of glass to conduct a comparative analysis, generally speaking, what is the process for conducting such an examination of glass?
So it'd be the same process that I just mentioned. I would take that item, take photos, make any observations.
Nefarious, this is happening to you too. What is going on in other people's chats? Okay, I'm only going to address this. I have no idea what's happened. I don't seek out drama and BS that happens in other people's chats. All I can tell you is I'm sorry if you're dealing with a-holes. And here, you're not going to get that here. You guys are welcome here. I love you guys always. So, yeah, what goes on in other people's chats, I don't bring that here. So, and I have no problems with any of you whatsoever, because I love all of you. So, that being said, you are all welcome here, and I love you. So, yeah, please feel free to chat away if you'd like. If you don't want to, I understand, but none of that drama from over there is coming here.
I would proceed with, first I would check to see if there's any physical match comparisons, and then if needed, I would take any samples to examine it microscopically and or instrumentally.
And that general process that you've just described is the items that you tested in reference to this case or analyzed in reference to this case. Is that the process that you followed in this case?
Yes.
Now, what kind of instruments do you use? Starting off with items of glass, what kind of instruments do you use to conduct that analysis?
Sure. So I'll use a stereo zoom microscope to initially examine it microscopically. If I take samples to do additional microscopic examination, I'll examine it under a polarized light microscope. And then if I need to take samples to do instrumental analysis, that would be using our, it's referred to as a GRIM, which stands for Glass Refractive Index Measurement. It's an instrument that measures the refractive index of glass.
And if you could please explain to the jury, what is a refractive index?
Sure. A refractive index is a measure of how light bends when it passes from one medium to another.
And how are you viewing that utilizing the GRIM device when it comes to glass?
So a sample is prepped on a slide, and it is placed on a hot stage of the microscope of the instrument. And the oil that the sample is in it goes through a cooling and a heating phase. And as it's going through a cooling and a heating phase, it passes through what we refer to as a match point. So you can make that observation as the sample is running. And then when the sample is done running, it takes an average and it calculates the refractive index of the sample through the calibration data of the instrument.
Joy.
What is an FTIR?
So an FTIR is a Fourier transform infrared spectrometer, and it is an analytical tool that we use to analyze certain types of samples. Essentially, a sample is exposed to infrared light, and your sample reacts in a certain way to it, and it produces a spectrum or a graph of peaks and valleys, and it is representative of your sample.
And how is that FTIR instrument, how is that used in this type of physical match analysis?
So actually, the FTIR was not used for physical match examination.
Now, you mentioned it a little bit earlier in your testimony. What is a polarized light microscope?
So polarized light microscope it's a microscope that just has a couple of filters in it that we use to look at samples at higher magnification and make observations of certain optical properties of samples.
And how are you utilizing that instrument in your analysis in the lab?
So it's used to examine various different types of samples, paint, fiber. We can also look at glass.
Now, do you document your work as you perform your analysis in the lab?
Yes, I do.
Now, Ms. Hanley, at some point, were you assigned to perform some work on a lab case number 22-02184 pertaining to this defendant, Karen Reed?
Yes, I was.
And what type of work were you assigned to do in this case?
So I was given items for physical match comparison of some glass items, as well as some instrumental analysis of the glass. And I was also given items for some items of plastic for comparison.
Now, starting with glass pieces, do you recall what item numbers you analyzed pertaining to the glass pieces?
Yes, so I examined items 3-2, which was a clear glass cup with broken irregular edges. I was also given item 3-3, which was 5 pieces of clear glass with broken irregular edges from the bumper of the vehicle. And then I was also given item 7-12, which were clear and glass pieces recovered from the road. And I was given also 7-14, which was a clear piece of glass recovered from the road.
And now if we could, Ms. Hanley, just break those down sort of one by one. So starting with item 3-2, what was provided to you in reference to a description of what that item was?
Sure. So item 3-2 was a clear glass cup with broken irregular edges, and there was dirt debris on the exterior and interior of the cup.
Now, did you measure that item?
I did.
And what measurements did you obtain from that item, the drinking glass?
I just would need to refer to my report for measurements.
Okay, you can do that. You have your report right there. Go right ahead.
Thank you, Your Honor.
So the diameter of the bottom of the glass cup was 2 3/4 inches, and it measured approximately 2.5 inches in height.
You mentioned that there was debris on both the interior and exterior of the drinking glass. Is that correct?
Yes.
Now, turning your attention to item 3-3, what was provided to you as a description of item 3-3?
Sure. So item 3-3 consisted of 5 pieces of clear glass, all with broken irregular edges.
And was there anything provided in the description of where those 5 pieces of broken glass were located?
Yes, they were recovered from the bumper of the vehicle.
And was there any identifying information provided to you as far as in reference to that vehicle?
The only other description of the item is the license plate of the vehicle.
What was the license plate that was provided?
So it was MA3GC684.
And did you measure each of those respective items?
Yes, I did.
Now, as far
That's
as
what
reported
I
measurements,
remember,
Ms. Hanley, when
Joy.
it comes to
So I think
the
I
lab
don't
item number, say
she
3-3,
says
that has
anything of
multiple pieces too, and how are each of those
substance
individual
besides
pieces
that, which
then
doesn't help
subsequently labeled?
State's case.
So sometimes we'll subsequently label them with the lettering system.
And as far as these particular pieces contained within item 3-3, the pieces of glass from the bumper of the defendant's vehicle, how were they labeled?
So these were labeled A through E.
And with reference to the measurements, what measurements did you obtain from the pieces within item 3-3?
Sure. So I measured the largest and the smallest, and the largest measured approximately 7/8 of an inch by 5/16 of an inch, and the smallest measured approximately 3/16 of an inch by 1/8 of an inch.
Now, with reference to the drinking glass, you examined that microscopically, is that correct?
I did, yes.
And with reference to these items from item 3-3 from the bumper, you examined those microscopically as well, is that correct?
Correct.
And was there a particular piece from the pieces from the bumper that you did any additional examination of?
Yes, I did.
And what instruments did you use in which piece?
Sure. So there was one piece I sampled, piece E, that I labeled as piece E. And I took a sample for examination under the polarized light microscope and a sample
And it got all
to
confusing.
analyze it instrumentally.
I'm gonna pause there for a second because it gets all confusing because instead of just saying like bar glass, blah blah blah, she constantly uses the label, the PPE 1, 2, 4, 5, 11, 172. I mean, seriously, it's all fucking numbers, and you can't keep track of anything she's fucking saying. Yeah, I worked in bars too. I bartended all through college, and then after my divorce, I went back to bartending or after my separation. And trust me, they're not made the same, and you can tell the difference between bar glasses and regular houseware glasses, which I don't think they made a big enough point about that. If it didn't match the bar glass and was thinner like a house glass, where do you think it came from? Inside the fucking house.
And the Grim instrument.
Now, turning your attention to item 7-12, what was provided to you as a description for item 7-12?
Sure. So item 7-12, that consisted of 5 pieces of clear apparent plastic and 9 pieces of clear apparent glass. with broken irregular edges.
Now, the 9 apparent pieces, well, let me ask you this first. As far as the description that you were provided, was there any description as far as where those items were recovered from?
Yes. Those items were recovered from 34 Fairview Road.
And is it your understanding they were recovered from the street or the roadway outside of that residence?
It just says recovered from 34 Fairview Road.
Now, as far as the 9 pieces of clear apparent glass from item 7-12, were those similarly sub-labeled as the previous item 3-3?
Yes, I received those labeled with the lettering system. They were labeled A, B, C, D, E, F, I, K, and L.
And with reference to those 9 pieces of glass, did you examine those microscopically as well?
I did, yes.
Now, turning your attention to item 7-14, what were you provided with as far as a description of that item 7-14?
So this item consisted of 1 piece of clear glass with broken irregular edges.
And similarly, was there any description provided as to where that item was recovered from?
Yes, it was recovered from 34 Fairview Road as well.
And again, how many pieces were contained within that item 7-14?
7-14 was just 1 piece of glass.
And did you measure that item as well?
That item, I do not have the measurement of. It was examined by a previous analyst within the unit, so that measurement was taken at that time.
And that other analyst would be Mick Falier, is that correct?
Yes.
And as far as your examination of that item 7-14, what type of instruments did you use to examine 7-14?
So I sampled 7-14 to examine it under the polarized light microscope, as well as to analyze it instrumentally using the Grim instrument.
Are you familiar with a term called a class characteristic?
Yes.
Can you explain to the jury what that is?
Sure. So a class characteristic is when a material can be associated with a group of items that share characteristics.
And what is an individual characteristic?
An individual characteristic is when a material can be related to a single source, such as a physical match.
And so what is the difference between a class characteristic versus an individual characteristic?
So class characteristic is that it can be associated with a group of items that share characteristics. Versus the
oh my God,
individual characteristics, more individualizing it. It can be related to a single source.
I talked about this a while back. Because my mom used to do that, and that's why when I was talking about it, when people eat on camera on their lives and stuff, it drives me nuts, especially if they're doing the lip smacking or chewing with their mouth open. It drives me fucking crazy. Oh my God, it's so funny that you said that, because I've never heard anyone else say that, just even the lip smacking. My mom, she would do that because her mouth would get so dry from some of her medications, and she would constantly do that, especially when she ate. And she never ate with her mouth open or anything, and the chewing never bothered me. It was when she was smacking her lips I just did it. How funny. I just did it. How funny. But seriously, she would do it on a regular basis just because of medication. So when she ate, she constantly had to do that she's like, I can't help it. My mouth's dry and I'm trying to, wet her lips or whatever. And it's like, ugh. And it was nothing against my mom or even against this lady from, doing it if you need to, but it's something that innate within me that it just fucking drives me crazy. Yeah, the eating on camera is gross. To me, I'm sorry. If you're not the one talking, I don't mind. There's people I watched when you have a couple people or several people on panel, and one of the person that
isn't talking, is like snacking, that doesn't bother me. I'm talking about a person, it's there, and I'm obviously not going to name someone, but I went into a live once and they were the only person on camera and they were the one doing all the talking and all they were doing was eating. Like, I'm like, I can't watch this. It's driving me crazy. Ugh. What you cooking, Baker's favorite suitcase? And sorry, I'm eating a Tums. I'm not eating because I've had heartburn for the last couple days. I don't know what the fuck problem is, but I can't take it. There's a popular YouTube person, name I will not mention, but I cannot watch his channel because of the lip smacking. I get it. There's a popular one that's why I said I'm not naming names, because there's also a popular one that eats on camera that I can't watch. It drives me nutso. Well, Joy, see, you get me. We're like kindred souls, I'm telling you.
Just in the case of like a physical match.
And what is a physical match?
So a physical match is
If I didn't already hate her enough,
if an item
Joy says,
is
I know
broken
who.
and
I bet you do.
those pieces are compared to each other and they're broken irregular edges fit back together and they have
Ooh, grilled cheese. I wish I was having lunch at your house. I love grilled cheese.
a jigsaw fit, that would be considered a physical match.
Now, can you please explain to the jury the steps and the process that you undertook in your comparative analysis of items, specifically of glass in this case?
Sure. So I first did a comparison of all of the glass pieces and the glass cup that were recovered from the road. So those were items 3-2, 7-12, and 7-14. So I examined all of those to determine if there was a physical match between any of those items first. There were, I believe, 6 pieces of glass from item 7-12 that fit mechanically to the cup that was also recovered from the road, item 3-2.
That's all you're going to see now.
That examination, I then did a comparison to see if there was a physical match to some of the 2 of the glass pieces from the bumper, and there were 5 total from the bumper. 2 of them I used for physical match comparison, and there was no physical match comparison between those 2 pieces from the bumper, item 3-3, compared to the glass pieces and the cup that were recovered from the road. And then I sampled, as I had mentioned earlier, one of the pieces from the bumper to do further microscopic and analytical analysis on, and did a comparison with one of the pieces from the road.
I just talked about this. I don't eat condiments.
All right, Mr. Whaley, whenever you're ready.
Thank you, Your Honor. And Ms. Hanley, given the break, if you could, if I could just ask you a few questions just to reorient as far as the items that we were
Steve
speaking
Baker's
about
my kind.
yesterday in your
Baker's
testimony.
favorite suitcase.
First, starting with
I don't do condiments though.
analyzing this
Not
case.
just mustard.
The first of those items was an item 3-2. Is that correct?
That's correct.
And if again, if you could, please describe to the jury, or please provide the jury with the description for that item that you received.
Sure. So item 3-2 was a clear glass cup with broken irregular edges, and there was some dirt debris material that was noted on the exterior and interior surfaces.
Your Honor, may I approach?
Yes.
Show me the photograph. Ms. Hanley, do you recognize that?
Yes, I do.
And what do you recognize that?
So this is a photograph that I took. It's item 3-2, but it's also, I would have to double check on my notes, but I believe it has item 7-12, one of the pieces that I'm holding, that's showing a physical match between those 2 items.
Your Honor, public seeks to introduce and then and Your Honor, may I publish?
Yes.
Ms. Gilman, if I could have photograph 9490. Ms. Hanley, what's up on the screen? Is that the photograph that I just presented to you?
Yes, it is.
And if you could, please describe to the jury what we're looking at here.
So that is a photograph that I took upon examination. It is the clear glass cup, item 3-2.
Yes.
And I'm holding another piece, which I believe it's one of the pieces from item 7-12. I would need to confirm in my file, but I'm I'm showing that one of the
Does that
pieces
mean you do not
physically
like
fits with
I don't.
item 3-2.
Nope. I can't eat anything that has mayonnaise, mustard, Italian dressing, nothing. I will not eat any of that crap. Blah. Yeah, that is a house glass. It's too thin. The bottom part where that thick base could be, good for a bar glass, but if you notice, most bars do not have those bases at the bottom. The entire glass is just thick. You like mayo on potato salad? See, I can't eat that shit. Anything that has mayo, mustard, anything, bleh, can't do it. If you're gonna do that, I say just leave some empty, blank plain pasta, whatever you want to call it, and I'll add some melted butter and some garlic on it and eat that shit. Some Parmesan cheese. Hook me up to mayo and call me oh man. Yes, rock glasses. Like, even if you at bars, if you get like, you have your the short glasses, what are they called? Your rock glasses, but the taller ones, I can't remember the name for them. I used to remember all the names for all the glasses, but and then your highball glasses, even the ones in the bars are thicker than highball glasses that you would buy for your home. It's just, if you've ever worked in a restaurant or a bar, the glasses are just not made the same. And it's for a reason, because they don't want to break. They don't want as many broken glasses as you would have. You ever seen someone drop a tray full of glasses at a bar, and not all of them break because they're stronger than normal glasses? Collins glasses, yes. The tall, skinny ones. But if you've ever seen a waitress or, a bartender drop a tray full of glasses and wonder how they didn't all break, that's why, because they're meant to, hold up against some friction and, what's the word I'm looking for? Damn it. Impact. They're meant to survive some impact to them if they drop or clink together. You ever break two glasses that you were washing in the sink and be like, God, they barely touched each other? That's because they're not made of the same type of glass. They're not as thick. I've done that more times than I can count.
Thank you, ma'am. Ms. Gilman, you can take that down. May I approach again, Your Honor?
Yes.
I'm showing you two other photographs. Can you take those up when you're finished? Do you recognize those?
Yes, I do.
What do you recognize those?
So these are photographs that I took of item 7-12.
Your Honor, I'm also introducing the minutes. Next exhibit A and B.
Is there any objection?
Okay.
Thank you.
So it's 196A and 196B.
And Ms. Hanley, if you could just remind the jury as far as the physical description that you received in regard to item 7-12.
See, the problem
So
with the
item
Collins glass,
7-12 consisted of
hold on.
some.
The problem with the Collins glass is, I'm going to show you this. So, like, if you look up a Collins glass, you can see the base. Like, some of these, the bases are that thick, but they're not that wide. Collins glasses are tall and skinny, and that glass they showed there is more of a of a rock glass. So if you compare a rock glass, see the base? They still have some bases, but they're wider. So something like this right here. But if you were to have a rock glass like this from a restaurant, they're going to be more like this. They're going to be nice and thick. They're not going to be this thin, puny crap that they had in that picture. Like this. These are ones that restaurants normally have, rock glasses. The restaurant I worked in for years, these were the exact glasses they had. Right here. The way they're designed and built and the thickness of the glass is different than what you're going to buy at a store and buy for your home. Anyway, that's the glass lesson for today. Colin Albert's glass. Oh, I get it. Maybe it was Colin. That's too funny. I was thinking you were misspelled Collins because it's Colin. Oh my God. That's too funny. Maybe it was Colin's glass from inside the house. I get it now. Sorry, it just registered. Yeah, exactly. 100%. That's too funny. I never thought of it like that. I just figured it was a glass they tossed out to make it look like, because they knew we came in the house with one. So they had to have them outside the house with one. So they just tossed it. Ooh, what are those? Oh, sunglasses. Ah. It takes me a while to sometimes see these. I have to squint or get my glasses to see some of these emojis. Yeah, you did it on purpose. I got it. I figured it out. It took me a minute, but I got it. I got there. Yeah, I mean, definitely easily could have been. And like I said, it could have just been one they tossed out there because they were like, shit, he came in the house with the glass and they couldn't find it. So they just, or didn't know what happened to it, or something, or they had someone else's blood on it. We're like, we can't throw that one out there. So let's just throw any glass out there because it doesn't really matter. It just needs to look like a glass so that it looks like that one. That's all that matters. Because they knew the police wouldn't investigate it.
Some clear plastic pieces, as well as 9 pieces of glass with broken irregular edges.
And may I publish on?
Yeah, we're a little slow today, but then again, I wrote this short bus.
And Ms. Hanley, what are we looking at in this photo?
So this is the photo that I took of item 7-12 as I received
I'm
it.
slow every day.
So there's the several pieces of clear glass with broken irregular edges.
And Ms. Gilman, if I could have 9477.
Hold on.
If you can enlarge that just a bit.
Because I have lots to say about this picture too, because it shows the glasses, how thin the glass is. But what the fuck? She says, Joy, did you see where the girl came forward and said where Chloe was buried? Where? Where did I miss this? On the twit? There's so many all those documents that came out. I haven't been able to keep up. Was that something that just came out? Because now I'm all like, I gotta look for it. I'm like, I better go search for it. Shit. It was hidden? I'm surprised they let it come out. Was this in the FOIA dump that Kyle Sharkey's been doing? Oh my God, I'm trying to find stuff. I have no idea because there's so much that's come out in the last couple of days. Like I said, I brought up the one the other night, but we were trying to keep our stream nice and fun instead of getting into too much serious shit. But I couldn't believe when I saw that Proctor wasn't even scheduled to be on call. It was like, what? In the FOIA docs. Sweet. Okay, good. I can tell me where to find it. I've tried to download save as much as I can. But there's so much out there right now. I just can't keep up.
And again, Ms. Hanley, what are we looking at in this photograph?
Those are the same pieces of glass as in the previous photo, just a little bit more up close of the clear glass that was recovered and is item 7-12.
Ms. Hanley, as far as a comparative analysis between items in 3-2, the glass cup, and 7-12 regarding the glass pieces, what, if any, conclusions did you make in reference to your comparison between those two items?
Sure. So upon comparing those items, I did note that 6 of the 9 pieces of clear apparent glass had a physical match to item 3-2, the clear glass cup.
And if you could just remind the jury, as far as a physical match, what does that mean?
So a physical match is basically if an item breaks and those items have broken irregular edges, if those pieces come back together like a jigsaw fit, then it's a physical match and they were at one time together as one larger unit.
Now, as far as each of those items within 7-12 had a letter associated with them, correct?
Yes.
And do you recall which of the 6 were a physical match for item 3-2, the glass?
I would just need to refer to my notes for the exact letters.
Sure, you can take your report out.
The 6 pieces of glass from item 7-12 that physically fit to item 3-2 were A, B, C, D, F, and K.
May I approach, Ron?
Yes.
Well, let me ask you this first. I'm sorry. So, Ms. Hanley, during the course of this physical match analysis that you're conducting, are you memorializing that process with photographs as well?
Yes, I am.
May I approach, Ron?
Yes.
And I'm presenting you with 4 photographs. If you could review those and look up on the bench. Do you recognize those? Then?
Yes, I do.
What do you recognize?
Those are photographs that I took upon my examination of items 7-12 and item 3-2.
Karen, one of those things you introduced in the next exhibit, ACD.
Thank you.
Oh,
And Ms. Hanley, what's up on the screen? Can you please describe to the jury what you're looking at?
Holy shit.
So this is one of the photos that I took
So
of one of the...
we're going to pause this BS testimony for a second. In case you're listening right now and briefly saw what Joy put, that some girl came forward and said where Chloe was buried. So apparently Brian Albert, oh, here it is. Okay, she sent me a picture. Hold on. Says Tim Albert's girlfriend's daughter. So Tim Albert is what? Brian Albert's nephew, I'm assuming. So his girlfriend's daughter, Delaney Chrysaleo Minton, told someone that Chloe was dead and buried in her backyard at 1473 Washington Street in Canton. This is Brian Albert's parents' house where they had a pool that was mysteriously filled in, as we all did know. An email is in the document FOIA dump that says, a girl I recently spent time with, Delaney Minton, who I picked up at 1473 Washington Street, Canton, Massachusetts, told me that the dog involved in the Karen Reed case was dead and buried in her yard. She also said her house had been burned down and she just recently moved back in. She claimed her uncle was the main Canton police officer involved in the case. I have dash cam recordings, but it appears to have been overwritten. I would be willing to turn in the SD card anonymously if forensic investigators think it's worth looking at. You can contact me at, and then there's an email address. Holy shit. Holy, look at the date of the email. Oh, that's right. May 15th, 2025. Holy fuck. This This email is from a year ago. And no one ever mentioned it? They obviously didn't give it to the defense because they would have brought this shit out in a heartbeat. This is what I'm saying. Yes, exactly. During the second trial. Holy fucking shit. You know, for all the haters out there who want to pretend that there was no corruption, that ridiculous statement by the foreskin saying there was absolutely no corruption. Dude, what do you got to say about this, huh? What are they going to say? I bet you $100 they will say, oh, it must have been an accident. That's not corruption. It was just an oopsie. Fuck off. How many oopsies can you have in one fucking case? Exactly, Joy. This is ridiculous. Hi, Moni G. So she says, apparently the girl's house burned down, so she moved back with grandma and grandpa for a short time. Yeah, that's what it says. That her house it didn't say, it's weird how it is stated though, because it says, she also said her house had been burned down and she just recently moved back in. How does the house get burned down and then you move back in? You don't move back into the same house if it burned down. It could have burned and then been remodeled, but it burned down. That means you built a whole new house. You don't move back into the same house if it was burnt down, but it could just be a poor choice of words, right? Finally sitting down and don't have my glasses. Oh, sound like me. It is strange how it's stated. I had to reread that. Yeah. I mean, I hate to say it because it does almost sound hypocritical to say that it could have been an oopsie. But there's a difference between something being semi-misstated in an email by an informant than there is for 237,000 oopsies in one death case. If you get what I'm saying. So yeah, her house burned. That's why that's what I'm saying. But it's just funny that the way that's worded. But yeah, I would assume that it had a fire, had to be like remodeled, maybe windows put back in or new windows put in or something. So is this because I see on here there's listed, who is this Jennifer Weeks McCabe? I just happened to see it. Right. Well, obviously she couldn't live in the house while it was being remodeled or whatever. From the fire. And everyone's been talking about that pool being filled in since we found out about it. Since Dr. Twitter Boy, reported on it. And who fills in a pool out of nowhere? And that's what I'm talking about. When all these supposed coincidences all happen at the same time during a murder trial, you got them selling their house, moving, filling in pools, supposedly rehoming their dog. Just if you listed every single thing that the antis want to throw off as a coincidence, I'm sorry. if that were you, would you want your life on the line based on a shitload of coincidences? I don't think so. I don't know how they fucking thought people would believe this shit. And the people that do, man, they can't think for themselves, obviously. So, which goes into why I even wanted to start this channel, to get into all that, which is why we're going through and suffering this ridiculous testimony again, so I can have it fresh in my mind after watching the first trial. And it's true. It's funny because I've heard now, just in the last couple days, I've heard Will the Glare, Turtle Boy, and Nurse Kim all say that they have, revisiting, if they go back and revisit trial 1, how it's almost necessary to revisit, to compare the two. And here I'm doing this back to back. I wish that if there were more people out there that wanted to do so, have been able to join me. Yeah, who fills in an in-ground pool? But then again, who rips up a basement floor when they did a remodel 3 years previously? And why would you sell a generational family home for a loss of $50K? Exactly. This is what I'm saying. If you start listing all of this bullshit, it's insane. All the phone stuff things are the shadiest. Yep. I mean, and that's the thing. Each of these, if it had been one of these things, just one, maybe it could be overlooked. Have John had bruises and actually looked like he'd been hit by a car? Maybe a couple of them could have been overlooked. But at this point, I don't care if he had 10 broken bones and 1 million bruises. When you have this many so-called coincidences and bullshit happening behind the scenes, I'm sorry. Something is going on. Yeah, one day before the subpoena. I mean, I reposted, Joy, if you can find my twit, my handle is at Miss Scarlet 77. I just reposted a video. Actually, I'll show it to you guys. Hold on. Because I reposted this video I saw this morning. And it's of a cop talking about what they would do if they were ordered to a scene. Oh my God, look at Will's picture. Oh my God, this is hysterical. At one time, Randall comforted Cry Fart when they realized I was right about the shoe. Hysterical. Hold on, let's see. Okay, here we go. Oh shit. Volume, please.
But
here we go.
I will say, 20. Hey, I don't know how many of y'all been watching this Karen Reed trial, but I will say, 25-year veteran, we find a dead guy in your front yard, we're stringing up crime scene tape, we knocking on your front door, and I don't give a damn if it is a house full of cops. We're going to have questions. And one of the main questions we're going to have is, can we have consent to search the interior side of this house? And if you deny that,
Welcome back.
I don't care. We got to call the man upstairs down here to get it. We get a search warrant on that house. That being said, always back to Brothers in Blue. Told the truth. You was within Florida state statute. You was within policy, and you felt like you was right doing what you did. Back you all the way to the end, 100%. You did some dumb shit. You got caught. You lied about it. Deuces. That's on you, man. You messed up. Have a nice life. I'm a pretty good read of body language. And I ain't saying them cops are lying when they're sitting up there, but they dang sure ain't being forthcoming with the information that they know. And by a long shot, I ended up finding myself in that situation. I can tell you one thing. They asked me for my phone. I hand it to them. Because I got 12,000 pictures of my friends and family and outings and my baby girl on this thing. And I ain't destroying it for nothing. I ain't pulling out SIM cards and putting it in 2 different locations, one on an army base and all that BS. I hand it to them. Now, I may have some marketplace purchases that were a little bit questionable. Some of my Snapchats may be a little bit personal. But at the end of the day, there ain't nothing on my phone that I'm scared of anybody seeing. And I'll tell you what, when she's acquitted at the end of this thing, there's a prosecutor somewhere needs to be handing out some perjury charges, like popsicles on a hot summer day. That stuff corrupt all the way to the top, in my humble opinion.
I just thought that was perfect. A perfect statement regarding how other cops would have seen that. Not only coming on a scene with a dead guy on the lawn and not caring that it's another police officer that owns that home, but then saying, like, I back the blue, but if you're lying and saying, doing shady shit, sorry, not going to back you. And he's not the only one. I know that there's been others, cops doing videos like that. So it's just crazy. Walk 2.5 miles. Way to go. Going to Disney in 8 weeks. So trying to get in shape and lose a few pounds. Well, congrats on the 2.5 miles. And Disney sounds like a lot of fun. Oh, you guys get to go once per year? How fun. I've never been to Florida, let alone Disney. But that's okay. I've been other places. I've always wanted to go, though. You can take my phone. Nothing to see there. Hey, Mary B. Mary B is going live today at 4:30 in case you want to check her out. I left you a little comment that says, hi, stop by and like, so that, because I didn't know if I'd be able to make it, because I don't know how long I'm streaming today. So what topic are you doing today, Mary B? You gotta love the afternoon naps, though. They're wonderful things. Good. Yes. Check out Mary B. And we are, after we're done with this ridiculous testimony, we will begin Dr. Welcher, the ridiculously blue paint dude. I don't know if you saw my thumbnail, but I did. I made one of my, here, in case you didn't get to see the actual thumbnail, I made one of my famous Wanda cartoons of our witness. And this is what I got. Aw, good. I'm glad you saw it. Simone says, I'm not cool with nobody taking my phone now without a warrant. Well, me too, but if they have a warrant, whatever. If you were a cop, though, like, I have a whole thing with that. Moni G and I have talked about this before. Because I don't really have anything in my phone either. It's not, I mean, to be honest, I don't have anything in my phone that I wouldn't, whatever. There's nothing, like, bad in there. I would just be disappointed, like, not even disappointed. I'd be so sad if I lost the stuff that's in my phone.
Mary B is winging it today. If I have a short guided meditation and then Q&A. That sounds cool. If you end up doing the tarot cards thing, Mary B, please let me know. I don't know how much I believe in the tarot cards themselves, but I always believe that things happen for a reason. So if you believe in that, you have to believe something about tarot cards, right? And I've always wanted to learn. My mom gave me a set of tarot cards when I was a teenager, like 16, 17. And she was never a tarot card reader either, but she had a set. She wanted to learn one day and she never did. And I always wanted to too. And then I never did. So when I saw your post, I'm like, yes, please, I want to learn. I would definitely be interested. Yes, exactly, Joy. Clearly a warrant, but if you have nothing to hide, the fact they both destroyed phones 1 to 2 days before, exactly. Yeah, and the fact I don't trust authority. Yeah, and see, this is the problem. People want to talk, and this is the problem with the ridiculous antis, that they sit here and say, well, there's his personal phone. No, the minute he started discussing work on that phone, made it a work phone. It was no longer a personal phone the minute he discussed work and shared work information. So, no, that argument is ridiculous. Yeah, I agree with you there. Kristen says I would be more afraid they would somehow set me up with fake messages and searches. Yeah, exactly. Ooh, Kristen's interested. Mary B too in the tarot cards. Yay. Hi, Aaron. Go Brog. Sorry if I totally blew that one. Wow. Welcome. Oh yeah, maybe I'll pull cards for the upcoming week. Yay! Oh, 4:20. I always say 4:30, and yet I should know that it's 4:20. Hello. And Mary B, you need to come on and tell me what night you're free so that we can discuss the CBD, CBN, CBC, BBC, whatever. I got to learn all the things so I can see if I can find something that will work for me. Moni G says, okay, bra. Okay, gotcha. Aaron, go bra. I'd be cool. I mean, Moni says, I'd be cool with them searching my house before I'd give them my phone. Yeah, I'd rather them search my phone. Well, no, I guess not. I guess it depends on how you look at it. I don't know. I'd have to really think that one through. Means Ireland forever. Cool. Oh, speaking of, I got our word of the day because we forgot. We were going to start doing words of the day. And the word today that came in my email was this. Hold on. I pulled it up and forgot. In case you didn't see my comic before I take it down, this is a Welcher who we're going to be listening to after the glass lady. Says, yep, I scammed this Commonwealth. Got paid $500,000 to play in blue paint. Wanda just gets me. Ooh, Mary B says, sure, I'm always around. Let me know what works for you. Well, every time I ask you, then Danny goes live. And I'm like, shit. So, because you were going to come on last week. And then Danny went live, which I understand. Totally nothing against. I totally get it.
but we got to pick a time and day where maybe we know he's not gonna, or a time that is going to be after you guys stream or something. We'll figure it out, but I can't wait. But let me remove my Welcher cartoon real quick. And then share this. So I get if you weren't here earlier this week, someday, I don't remember what day it was, I get word of the day to my email every day. And I asked if people were interested because I love learning new things. And some people were interested. So I said, we'll do our word. I'll bring up my word of the day that comes in my email every day. So if you want to learn new words, we can do that. So this word is, I got a heteroglossia. So here, oops, wrong one. So this is how you say it. Come on. Now my computer is being a shit.
Heteroglossia.
Heteroglossia. A diversity of voices, styles of discourse, or points of view in a literary work, and especially a novel. Example sentences. His podcast embraces heteroglossia, featuring guests with completely different perspectives. And the novel's heteroglossia makes it feel like multiple worlds are colliding. The last one is, you can hear the heteroglossia in any big city with languages and styles blending everywhere. There you go. That is our word of the day. Now I gotta just get back to YouTube. Okay. Now let me catch up on the chat. Sorry, guys. When I go to, I have to deal with all these different screens. Oh, it says, I know Danny is an issue. Let's do Wednesday. Okay, Wednesday sounds good. Wednesday it is. Trying to do Wednesdays off. Okay, gotcha. Because he's been going live every day lately. So it's like, it's hard to catch a day when you guys aren't going live. See, Joy, you're 68. I knew this. I was having this discussion with James yesterday where I said, I swear Joy is 68. And you look amazing for your age. And he was like, no, I think she's 53. And so you should give James credit for this, because then he's like, no, I think maybe she's 58, not 68. He was literally, I'm like, hey, I could be wrong. Because trust me, you know me, I get things wrong all the time. I'm not going to argue if you tell me I'm wrong. I'm pretty much going to say, unless I know for a fact, I'm not going to argue with you. I'm just going to say, okay, I could be wrong. But I swore 68 came to mind. And he swore you were 58. So either way, you look amazing. Moni G says, I'm 70. Shut up. Oh, you guys like word of the days? Yay. So we're going to do this every day. I've had this come to my email for years, the word of the day. Can't remember them all, but I try. Heterosexual with lip gloss. I'd say any YouTube chat is heteroglossia. That's a good one. You guys are going to have to, we do word of the day now. That's going to be your assignment. You got to make one chat with the new word of the day. Joy says, could you imagine how was your day? It was great. I was involved in the best heteroglossia conversations. It was fascinating. You're not 68? I was born in 68. Okay, so see, I swore. Okay, so James was right. You were 58. And I took 68 as your age. Either way, you look fucking amazing for your age. It doesn't matter. Like, it doesn't matter. You're born in 68. You are 68. It doesn't matter. Age is just a number. So, but I appreciate. So, like I said, I got it. You guys know I'm always behind in the chat. Sorry. She's 2 years older than me, she says. Now I get why you said I'm 70. I'm like, yeah, right, Monique, you're not 70. She says she was born in 1970. I get it now. I get it now. Okay. I'm such a moron. I got it. I got it. Aaron was 9/12/69. Oh, I need Baker here. He would make a 69 joke. And I was born 10 years later in 79. 3/7/79. That does not. And I didn't say you look great. You look amazing. I said you look amazing. And you know what? Take it as a compliment. Not that. No. No. Because it truly is. Because I'm telling you, not to mention, like I said, age is just a number. And you and me, like I said, I called us, what did I say? We were kindred spirits, man. And I'm 47, okay? I'm an old lady too. I get it. I'm not a youngin' anymore. Even though some people call me one. I'm not. But people tell me that all the time. I'm 47 and people tell me I look like I'm in my 20s. When I was in my 20s, trust me, I looked like I was in my teens, okay? So, that being said, people tell me all the time now I look great for my age. And I just take it as, now that I'm in my upper 40s, I just take it as, oh, great, thank you. Don't ever take that the wrong way, because you look great no matter what your age is, like I said. So, and it doesn't mean, I think when you, I'm trying to say this the right way. I don't want it to come out like another backhanded comment or compliment, because it's not at all what I mean. But would you rather be told that you look younger? Would you rather just be told you look younger than your age, or would you rather be told that you look great for your age? That's what I want to ask. Because I'm never told I look great for my age. I am just always told, you look so young. And I hate that. I'd rather be told that I look great for my age. Just curious. Moni G, I just saw your comment. Are we going to go touch grass today? It is already 3:30-ish. Hold on one second. Let me look at something. Moni G, if I were to say, because tomorrow it's supposed to be actually warmer, but not sunny. So that's actually better for me. Do you think you would be available tomorrow? Let me know before I make my decision. Aw, Fridge Breaker was born in 79 as well. My best friend was born in 69. See? I know you're picking. Kristen 7-7. I know there's a lot of Pisces like me around in this community, I find. A lot of Geminis too. Oh, Kristen, 81. So we're 2 years apart. Joy says, let me tell you, when you live in South and someone says, bless your pea-picking heart, it is not a compliment. Oh, gotcha. 79 was a great year because, I was born that year. Just kidding. Because I don't remember shit from it. That's all I can tell you. See, great for my age is nice. I like it too. I've never been told that because like Joy just says, you do look young. I get told you look so young. You look so young. That's what I get told. I don't get even partial compliment. It's just you look so young. So no one tells me, oh, you look beautiful or awesome or great for your age. I just get, you look so young. So if you're going to mention my looks, I'd at least like a little bit of a compliment in there. So please tell me I look great for my age or awesome for my age instead of just telling me I look young, which apparently is a fact. So, yeah, that's how I look at it. Moni says, Joy, I know my mom doesn't believe me that bless your little heart or bless your soul isn't nice. Oh, 83 is Mary B. See, I'm a poet and didn't know it. My mom used to say that all the time. She's like, I'm a poet and didn't know it. My toes show it. It's the dumbest the dumbest line, but my mom would always say it and it would make me giggle. It means you're stupid. Oh, the bless your little heart. I get that. It's like, oh, I understand. You're just young and you don't get it kind of thing. I totally get that. It is a huge compliment to just say you look young or you look so young. Like, I don't know. I don't take it as that. Like I said, I would much rather have an actual like positive adjective in that supposed compliment. You look great for being that, looking so young. You look great for your, I don't know. Aaron says, I act younger than I look. So do I. I think we all do. Especially the older we get, the younger we act, I think. As long as no one calls me ma'am. I hate that. Oh, especially like I've had people that are like, I'm 47. I know that I don't look in my 40s at least. Most people guess I'm in my 30s. Sometimes people will guess I'm in my 20s. And if someone calls me ma'am, oh my God. My heart just wants to break. Moni says, I was going to do yard work because it wasn't so sunny, but maybe we can hang tomorrow even. I think I'm going to go hike and at the park today then. Oh, okay. Moni G, I'm sorry. I blew it. But will you still forgive me and be my friend? We can do tomorrow evening, whatever works for you. Let's call me tonight when you're done with your hike and everything, and we'll get a time set and everything. I feel like an asshole now. I'm so sorry. Like ignorant, stupid, yes. You have the power to take anything as a compliment. That's what I do. I like that, Mary B. You have the power to take anything as a compliment. I really like that. It's going to be my new motto. Wait, what? Wait, what? Do they even know who I am? You saw them on a short talking about a Scarlet. Maybe not this Scarlet. Okay, someone needs to email me this shit right now. Too funny. They seriously, like, I mean, I talked about them when I first started my channel, but I barely talk about them now. And yes, I made a short about them the other day, which is if maybe that's when. Did you turn on TV? No. Oh my God. Don't tell me they're starting fucking rumors. Oh, it's not you then. Okay. Like, seriously? I was like, wow, they found my channel already? I'm surprised. That's too funny. Because I did just make new shorts. Speaking of, real quick, you want to see this? Hold on. Because I caught this James Jackson's short ended up in my algorithm. And it was a short from right before TB did the Wilbur. And I thought it was extremely hilarious that in this short that I saw of James Jackson, that they predicted their own future behavior. So these two right here, I made off a short from the other day. So here's.
Look what happened. She turned on TB and he did all that for nothing. I wonder how he feels about her guilt that they're going to try to change the narrative. And that's what usually happens when things go to shit. People change the narrative of what really happened.
TB talked to Karen before the verdict, and she said she would give TB the first interview, and then she changed her mind. TB has every right to feel how he does. Sad how this all ends up.
Look what happened. She turned on TB.
This one.
The same people that are there for TB are the same people that would be there for her.
Right.
So by not going out to even take the temperature of the room to see what it's like, to get a feel of it, that right there, honestly, on a business level, Karen, you're fucking up. You should go out there and check the temperature and see what it's like. See if you like it. And then you can figure out if you want to do one yourself. But if you don't show up, hey, don't show up. Don't worry about it. JFK will have a show the next day talking about it. Whatever, which way you want to be. You know what I mean? The same.
So, yeah. That's what I did the other day based on the short that came up in my algorithm. Them going on and on about how they about TB calling Karen a cunt and saying bad things about Karen or whatever one time because he was upset. And then they said, and how they're the ones that are now always trying to change the narrative and saying that TB he's not the one that brought all this to the forefront. He's not the one that, you know all the shit they spew. And I thought, how funny that these words came out of their mouth when they supported Aiden. Mary B says, I started talking the C word as a compliment, or taking the C word as a compliment. Drove my ex crazy when he was attempting to verbally abuse me. God, I wish I would have learned that. Seriously, I wish I would have learned that a long time ago. I really need to take that in. I truly do. I just wrote it down so I would tell myself it. People from the South tend to address someone with the title Miss, Ma'am, Sir. It's a form of respect, so don't get offended or try not to. I understand, but we don't live in the South, Mooney G. We live in Michigan. So, Kristen says, I actually love that word. I love saying, see you next Tuesday when I have plans with someone on that date. That's awesome. Does anyone ever watch them? Not anymore. Hi, Zach. Hey, my favorite C word. That's what you get for being late. You missed word of the day. You did. Heteroglossia was the word of the day. Aw, Zach, be nice. Suppo, what's up, guys? Sorry, I'm way back. I'm way behind on the chat again, as always. Moni G says, Mary B, bravo. Some women lose their minds when they hear the C word. I dated a guy from Ireland, and they use it like bitch or ass. You know, cunt never bothered me. You want to know the word that truly bothered me was twat. And ever since I started watching Aiden call it the twat, now I can even say it. Prior to ever hearing Aiden call Twitter twat, I couldn't even say the word twat. And that word pissed me off way more than cunt ever did. Now, I don't, it doesn't even bother me. None of them do. Especially the older I get. Who cares? They're just words. Zach, your word of the day is benevolence. Very colorful vernacular. Yeah, some people are raised that way. I know that. Nefarious, welcome back. You guys are killing me. Social diversity? Bah humbug. Whatever. But yes, that was our word of the day. Heteroglossia. There's one word I will never say. I think it is the most disgusting word ever. What does it start with? Since you obviously won't say it. Twat never bothered me any. And Frozen song tune. Oh, trust me, you don't want me to sing, but I can hear it in my head. Okay, so those were old shorts. Yeah, the shorts that I showed you, I just made, but it was made based off an old short of James that ended up in my algorithm. It was on when I first signed into YouTube. It was the second short in my algorithm. It was on the top right. And I was like, what the hell is this? I'm like, first of all, why is James Jackson in my algorithm? So I was like, what did he have to say? And then I listened to it, and that's the shit I hear. I'm like, oh, wow. It's interesting to go back and listen to what they say prior to them turning on Aiden. Seppo moist. I don't know why people hate that word. That's another word I know a lot of people hate. I said it on my live one day, and they were like, I can't believe you used that word. I'm like, what's wrong with moist? I guess the way it sounds. I don't know the meaning. I don't know what what that word, I'm not going to keep saying it because I don't want to piss someone off. But that word doesn't bother me. What do you call a truck full of dildos? Oh, yes, twat never bothered me anyway. Yeah, I can't sing. Trust me, I'm tone deaf. So I will never be singing. Joy says it's actually 2 words. First rhymes with sock. Second word, you can figure it out. Oh! I got you. I'm not going to say it because I don't want to piss you off. I think we can figure it out there, Joy. Blockbuster. Toys for Twats. Crockpot. You guys are awesome. Look at Clock Watcher. Crockpot. Flock of Seagulls. Oh my God. I love you guys. Yes, that one. Oh, that's I was already forgetting about the joke that you had put, Toys for Twats. That's hilarious. The punchline too. What do you call a truckload of dildos? Toys for Twats. Hi, Cat Randall. Welcome back. What do you call a chick wearing braces? Dude, Zach, keep them up. I'm gonna keep. Oh my God, I totally forgot. I was working on that video, that short of all the puns for Ian Whippen, and I gotta finish it. It's almost done. I'm gonna try and finish it today. Since I was an asshole to Moni G and invited her over to go walk outside and touch some grass and get off the interwebs, and then I didn't know she'd be free. And I was like, let me see how long I'm going to stream. And then I'm like, oh, let's wait till tomorrow. And I'm just an asshole. So I'm sorry, Moni G. I love you. Hey, Shelly. She says, why was there never a pregnant Barbie doll? I know this one. I told this joke. The answer is because Ken came in another box. Chicken lollipop. Keep them coming, Zach. Yeah, see? Because Ken came in another box. Organ grinder. Oh my God. Keep them coming. I swear to God, this is hysterical. I'm going to make another short with all of these. This is awesome. A Black and Decker picker wrecker. I'm sorry. I can't even talk. A smock ripper. You guys are killing me. Oh my God. Throckmorton. Nefarious says, oh yeah, I remember when you just said that joke and I still didn't remember the punchline. A TikTok flip-flopper. I know this one too. What's long, hard, and full of semen?
It's a submarine, right? I don't know what the punchline, but see, whoever. Oh yeah, see, submarine. I thought so. Suppo said battleship. Close enough. Yes, Ken came in another box. Hi, Genuine. Aaron says, see you all later on Mayor B. Have a good one, Aaron. Yes, Mayor B is going to be live at 4:20. Of course. I don't know why I keep forgetting that. Every time I say it, I'm like, God, I'm not going to forget it next time. And then I did it anyway. What did the termite say when he went to the bar? Ooh, suppo. What's the definition of a Barbie? The box Ken came in? Giggity. You guys are cracking me up today. I swear. I love you guys. It's a shame they never sold a Tantric Ken and Barbie box set. They definitely would come out together. Well, I guess at least Moni's still my friend after being an asshole because she's still telling jokes in my chat. I love you, Moni G. The termite said, where's the bartender? I love the corny jokes like that. They just make me giggle. Yeah. God, my stomach hurts now already from laughing. And apparently, if you watch Joy, me and Hippie Chick and Maylin this past Friday, we had a blast. We are going to be doing it again this Friday and every Friday that we can. And Joy apparently has a great idea for this Friday. She hasn't told me yet, so I obviously can't tell you. But be here, be square at 10 o'clock this Friday coming up. We are going to have so much fun. Again. You just came up with that one? She says I'm here all week. These are saying the improvs are the best. When you come up with something just like those are always the funniest things, in my opinion. What do you call a bra that you can't take off? I think I've heard this one before, but I don't know. I think when I hear the answer, I'll know if it's one I have or not. Suppo says, what do you get when you cross a hooker with a dwarf? A little fucker, 2 feet tall. I love it. Yes, we are going to laugh our asses up. Oh, yeah. That's the whole point. A booby trap. Yes, I've heard that one. I told that one before. Now, all of a sudden, I forgot it. That was the same, because that's in the same little, I have like little pages in a notebook of jokes that I hear or see and I write them down. And that's literally on the same page as the one that says, what did one booby say to the other booby? And it says, if we don't get some support soon, we're going to go nuts. We're going to be nuts. Now I said it wrong and I screwed it up, but it's hysterical. And you told that one the other day too, Shelley, because great minds, think alike. I'm a middle-aged white girl. I can't afford to lose any ass, Dwight. Moni G's on a roll today. I love it. Well, guys, we will never get to Welcher blowing his load, spreading his load if I read jokes all day. So we are going to get into this. Let's see how much we got left. I'm thinking we're going to skip this shit. So let's get back into Welcher. We're going to get to Welcher because this glass thing is ridiculous. The whole point is the glass doesn't match. It's not a bar glass. There you go. So we're going to get into Judson Welcher.
And then I have 3 other engineers and 1 case viewer. I guess it's 6 people. I have a case manager as well.
Is there any,
and I,
do you work
hold on.
interchangeably at the different branches around the country, or do you have your own team?
Shut up! I bypassed his whole CV and shit. We're just going to get into the thick of it. So here we go.
California that you work with?
99% of the time, it's my own team. Occasionally, we'll get a case from another office. I've worked on a couple cases out of the Texas office and maybe a couple out of the Nevada office.
Were you asked to look at any data or information relative to this case?
Yes.
In looking at data and information.
Okay, one last joke because it's hysterical. If you didn't read it, Moni G says, what did one burp say to the other burp? Let's both be stinkers and go out the back door. I haven't heard that one before. Oh no, Bruins are getting clobbered. 4-0 after 1 period. I swear to God, the Red Wings better get their shit together. Every year lately, they give us hope that they'll at least make the playoffs and then they blow it. Which is what they did this year. Stops. Hey, James.
Do you try to look at a narrow or broad range of information?
So I definitely cast a very broad range. We try and get as much information as possible. And then, weed it down to what is important, weed it down to what is consistent with the data. So start off very big and then get down to sort of the meat and potatoes of it, the important information.
Do you necessarily rely on everything you look at?
No, I certainly consider everything I look at, but I frequently don't rely on everything because sometimes it's not reliable or it's irrelevant.
In this case, can you share with us materials generally that you looked at in your review?
Sure. You're going to read from my report.
No, I love it. I love chatting with you guys, and I would do it all day, honestly. Truly, I love it. I love telling jokes, having conversations with you wonderful people, and we'll stop as much as we need to. But yeah, I do want to get through it. That's the whole point. But that's just become my show. We go through some of the trial and we have, a couple hours of chit chat. I love it. And lots of laughing if possible.
So, Mr. Porter, I apologize for the lengthy list. Slow. So I have police reports, including the Canton PD incident report, and I have 8 other reports, also the 34 Fairview Road Rams final report or cars report. I have the ring video from Mr. O'Keefe's residence. I believe that's One Meadows. I have the cruiser cameras, which are the police vehicles, onboard cameras, both front and rear cameras from 1, 2, 3, 4, 5, 6, I believe 10 different videos. I have photos and videos of the scene from the sergeant. I have photos of the vehicles, 140 photographs of the vehicles lined up together. I have 25 additional photographs of the scene, 18 separate photographs of the scene, 2 photographs of the scene, one group of 92 of the scene, one group of 50 of the scene, another video showing the cars lined up bumper to bumper, 4 videos of the scene. I have a video showing Miss O'Keefe's, Miss Reed's vehicle being pulled into the Sally Port at the Canton Police Department. I have a 360 diagram, surveillance video files from McCarthy's, surveillance video files from Waterfall Bar, Canton Police Port, Sally Port videos from Dighton. I have the Lexus Connect Verizon records. I have the alarm.com videos. I have a video of the tow truck arriving at the Canton Police Department. One titled Native Location, John O'Keefe's phone. House witness statements. A report of examination from the coroner. Jennifer McCabe's Cellbrite data. Something called Lexus Infotainment. Different past summary, testimony of numerous witnesses. An earlier summary testimony of numerous witnesses. The Boston interview, Boston Magazine interview with Miss Reed. A Dateline interview with Miss Reed. A 2020 interview with Miss Reed. Lab reports from BODE, Crime Scene Response Unit, Crime Scene Response Unit Boston, Crime Scene Service Section, Maynard, Crime Scene Service Section, Southeast, the Criminalist File Folder, Trace File Folder, UC Davis Veterinary Report. I have Verizon records, GPS location records, John O'Keefe GPS points, Axiom cache location, weather reports, medical records, including the Canton Fire Department run report for both Mr. O'Keefe and Miss Reed, medical records for both Mr. O'Keefe and Miss Reed from Good Samaritan. I have 2 retrograde extrapolation reports, one, and a serum plasma conversion report relative to Miss Reed. I have the neuropathology report. I have the Orange County Medical Examiner's report, the diagrams, the postmortem toxicology report, and a second same autopsy report, more pages.
In addition to the information that you reviewed, did you on your own go out and obtain information that you thought might be helpful for your review?
I did. So first what happened is I asked for all the information on the case. So I received some information, and then what we do is we start doing our homework. So we start doing the groundwork. So once I received some of the information, what I did was, modern cars have what's called a VIN number or vehicle identification number. It's a unique 17-digit number. So what we'll do is we'll decode that VIN number, and that gives us information about the vehicles. So I did that for Miss Reed's 2021 Lexus, as well as Mr. O'Keefe's 2019 Chevy Traverse. So ran the VIN numbers, use the VIN numbers. It tells us year, make, model, safety equipment, things like that. I then got dimensional data from a program called Expert Autostats. And then I have complete parts diagrams for the vehicles. So I have literally bumper-to-bumper parts diagrams from something called the Mitchell Collision Estimating Guide. And what that is, it shows parts involved in the vehicle. So for example, Miss Reed's vehicle, have bumper-to-bumper. I certainly have all the parts around the rear bumper and tail light of her vehicle. And then, of course, I started additional work on top of that.
After you began your study, sir, did you have an opportunity to personally look at items that were involved in this case?
Yes, I did.
And what did that include?
That included looking at Miss Reed's vehicle, looking at Mr. O'Keefe's vehicle, going to the scene of the incident. I ultimately purchased a 2021 LX 570, exact year, make, and model of Miss Reed's vehicle, and conducted testing with that vehicle, as well as doing a whole bunch of research and compiling data for my report and slides.
You mentioned slides. When you went through your investigation analysis and ultimately led to whatever conclusions you have, did you provide and create a PowerPoint presentation that could assist you?
I did. I provided a PowerPoint presentation on January 30th.
Can I approach you on it?
Yes.
Yeah.
Yes.
So I'm handing you a binder. Finally take a look at it.
Okay.
So does that appear to be a copy of the PowerPoint presentation?
It appeared like 141 pages. Look at every page, but it looks right.
All right. Now to mark this for identification.
Okay.
With the court's permission, I'd like to have Dr. Welcher use his PowerPoint presentation to walk us through some of the information he'd like to share today.
Okay. No objections to us, right?
No objection, Your Honor. Thank you.
Your Honor, I'm looking at the paper version in front of me.
Okay. Is the paper version the same as what we're going to see up here?
It is.
Okay, that's fine.
Thank you. And Dr. Welcher is going to manage the PowerPoint presentation. So you mentioned that you wanted to look at the area and look at the scene. Your office is in California?
It is.
Why was it important to come all the way out to this area to see the scene firsthand?
Hold on a minute.
I'll let you set up before I start asking you more questions.
So that's me. That's my first slide. Again,
I have a couple questions for you, Dr. Welcher.
Please.
The first is your office is in California?
Oh, yes, sir.
Why was it important to come all the way out here and view the scene firsthand?
And you want to have as much information as possible. So I wanted to, physically look at all the things so I can actually see with my own hands, my own eyes, lay hands upon it, look at it as best I can. You try to inspect and look at as many things as you possibly can. Sometimes they don't exist anymore. Sometimes they're gone. And you have to make the best approximation if you can't do that. In this case, I was able to look at the scene in both vehicles.
Was that an important part of your study, Doctor?
I think so. Again, it's always good if you're going to talk about what happened to the cars or what happened to the people to look at what happened to the cars, meaning to actually look at the cars, not just look at photographs when possible. So I have physically looked at the cars. For example, on the Lexus, I climbed in it, over it, underneath it. I downloaded data from it. I did a whole bunch of things looking at Ms. Reed's Lexus to assist in my analysis to try and add some further objective data to what we're doing here. So same thing with Mr. O'Keefe's vehicle. Looked at the rear bumper, took some pieces off the rear bumper to see what was behind the cover, to see what kind of damage we did or didn't have. So went to the scene, looked at the measurements of the curb, looked at where some of the lines are on the road because you can see them in some of the photographs. Again, it's always good when possible to inspect everything you can inspect.
If you could now begin and tell us how you started your investigation.
Sure. So on September 23rd, I had an opportunity to come out. Mr. Brandon, was the first time I ever met you on that day, I believe. And I had to receive material before that. And what you see here is my inspection of Ms. Reed's vehicle. In the upper left photograph, you'll see, oh, this doesn't work very well. Upper left photograph, that's Ms. Reed's vehicle. That's Mr. O'Keefe's vehicle, the Chevy Traverse. And then what you see here is a laser scanner. You can see it on the ground here. Laser scanner is creating a 3D model of the vehicles. So I use that to create a 3D model of the vehicles. You can see me in the upper right photograph. That watch is this watch right here, my Garmin watch. And what I'm doing is looking at the construction composition of that right rear corner of the bumper. I'm looking at things such as the dimensions, where various lights and components are, and how does the geometry of that bumper relate to things that would be hit when backed into.
Dr. Welcher notes this is 9/23/94. Is that an accurate date of when you came and first started looking at the vehicles in the area?
You said 24, correct?
I did.
You said 9/23/24, correct. And then on the slide, what I tried to do is underline what I'm doing. So this is inspection of the Reed Lexus. And as noted, I'm only showing you a couple. I actually took 400.
Yes, Joy, I've seen it. I've seen trial 2. I haven't seen trial 1, but now have seen trial 1, and now watching trial 2 right after having seen trial 1. And I'm seeing it in a totally different light. But yes, I know Welcher spreads his load.
45 photographs.
Do you remember when you began this case? The month or the date?
No, it was obviously before this. I had material before I came out to look at the vehicles.
You think it was months before this?
I don't think it was months. No, it was maybe 8
Wearing
months.
So you began your work in
same
fall of
shirt,
2024?
same
Correct.
clothes and shoes.
And I just want to ask you about the pictures in the middle.
insane.
You see the right taillight housing is missing. Did you
Correct.
understand that had been removed prior to you looking at the car?
It was, yes.
Thank you.
You're welcome. However, some of the evidence stickers, these white stickers here, were still on the vehicle.
You did not place those. Did you place those stickers on yourself?
I did not.
Were they there when you first saw the car?
Correct. They match what I'd seen in other photos.
Thank you.
So just continuing on. So what you see is, again, I mentioned looking underneath the bumper. So we wanted to see what, if anything, was damaged on the corner. So I'm putting my hand to show where the frame rail ends. This is me looking up underneath to the back side of this taillight. If you can see, this red taillight actually sticks out. And so I'm checking the front here for damage. I'm checking the back for damage.
1 second, please. Okay, Doctor, when you were looking for damage on the previous slide, did you find any damage to that lower right red taillight?
No, there was no damage to the taillight.
The middle picture is from the inside, looking at the inside of that taillight. Was there any damage to the inside of that taillight?
There was not.
Thank you.
You're welcome. So again, look at the height of it. I mentioned this lower taillight. Notice how the structure of the bumper protrudes out. You can see one of the marks, which is consistent with the contact in Mr. O'Keefe's vehicle. Here, this scratch mark, scuff mark. Notice how close it is to this light. Again, some of the evidence, stickers. Just a better view of those, then going down the side of the vehicle. So with all that information, I mentioned a laser scan. So you move this laser scanner, and each minute, 51 second scan is collecting about 50 million data points. And so you scan all the way around, and then what you do is you merge all that data together. So even though this looks like a poor photograph, what you're seeing is hundreds of millions of photographs, hundreds of millions of points. And so you literally can figure out, if you want to know the distance from this lug nut to where the lighter is on the ashtray, you could probably do that to an accuracy of about 2 to 3 millimeters. So really, taking tons and tons of data. So it knows the exact position of every one of these millions of data points, and it knows the color associated with those data points.
Why is that data imaging so important in accident reconstruction?
You want to have an accurate model of the car. So, you probably don't need literally that many points to get an accurate model, but that's just the nature of the way the science is going. Computers are getting better and faster. Scanners are getting faster. So you get an enormous amount of data when you use these scanners nowadays. So then, as indicated on the underline here, I did a CDR. That's a little different than what you heard me say before. CDR is crash data retrieval. So that's the hardware and software that you use to download or actually copy or take an image of, because you're just taking an image off what's on the vehicle, the EDR, which is the event data recorder. So you use the crash data retrieval hardware to download the event data recorder, otherwise commonly known as the black box. So I downloaded the black box from this vehicle, and although you can hardly read it here, again, I mentioned there are two systems on this vehicle. This is the CDR system or EDR system. There's also the tech stream. The EDR system, this system is primarily to manage the safety components, protect the occupants of the Lexus. So things like fire the airbag, fire what's called a pretensioner, keep track of the severity of the crash to decide whether we need to fire the airbag. So it's not really designed for pedestrian impacts. So when we downloaded this vehicle, we got what's called a none file. A none file simply means that there's no data there. The system's working properly. We had no fault codes, but for a car hitting a pedestrian to cause a file here, this is really more designed for car-to-car impacts, something that's going to have a significant impact on the occupant of the Lexus. And again, the Lexus is a 6,000-pound vehicle. Mr. O'Keefe's only 216 pounds. So it's not going to register from hitting a pedestrian.
Yeah, exactly.
Were you surprised that there was
How
no
do you get
information
no
about
bruises?
collision in the EDR?
No, exactly what I expected. Okay, I mentioned the second system. So as underlined up here, this is the tech stream. So this is from Toyota tech stream data. You can see the screens here. There's generally two types of files, what's called a vehicle control history and a PCS file. The PCS file is the protection system. So I also looked at Mr. O'Keefe's vehicle. PCS is pre-collision system. Looked at Mr. O'Keefe's vehicle, same thing, took a series of photographs, laser scanned it, looked in it, underneath it, behind it. I mentioned taking some of the bumper parts off. So I took this rear cover off here to look at the damage behind the bumper cover. Most cars have what's referred to as a face bar. That's that piece of metal that you see here. And there's a piece of energy absorber here. That's your face bar. So I'm looking to see if there's any damage to that. There was no damage to that.
Before you go forward, I want you to take a couple steps back because I want to ask you some questions to explain tech stream data. Could you go back a couple slides, please?
Sure.
You mentioned that in the EDR, which is similar to a black box, there was no information found. And then you mentioned a different system, the tech stream. Can you make it clear for us how these systems are different and where they're stored on a motor vehicle?
Sure. I mean, a lot of data is stored in a similar location. The tech stream system was originally designed, according to Toyota, for maintenance issues. It seemed to come about around the same time Toyota was having problems with sudden accelerations or allegations of sudden accelerations. So the tech stream data or vehicle control history will give you information when there's, for example, excessive acceleration or rapid shifting of the vehicles or rapid steering of the steering wheel. So the statements are that that's designed to help the maintenance people, if you come in with a problem with your vehicle, to diagnose what that problem is. It has a lot of utility in accident reconstruction because if you jam on the brakes before a crash, frequently the tech stream data will record the crash.
You mentioned Toyota a number of times. Could you share with us the relationship between Toyota and Lexus?
Sorry, in my mind, they're the same thing. Toyota and Lexus, obviously a little different, but Lexus is basically made by Toyota. So Toyota and Lexus has the Lexus safety system. Toyota has the Toyota safety systems, which you both read with the tech stream data.
The tech stream data, in this case, does it play an important role in your analysis?
I think so, yes.
The tech stream data, did you independently download that data yourself?
So I independently downloaded it, and then I also ran a test with Mr. Reed's vehicle, and I created a new tech stream file so that I had a stamp in the ignition cycles of what the current ignition cycle was. So I did a sudden acceleration test of the vehicle.
On the Lexus or on the exemplar vehicle?
On her Lexus.
When you did the downloading, why did you do it yourself?
Again, you, whenever possible, want to be the one that does it, make sure it's done correctly, and be able to say, hey, how do I know that's from that vehicle? Well, I know because I was the one who did it. And so if I get it from someone else, then they frequently have to bring that person into court to say the other ones that did it, so then I can use it. So if I do it myself, it eliminates that problem, and then I have no concerns over where it's coming from. So then I know hey, I did it. This is the right car. This is the right program.
You left us at slide 10 when you were inspecting Mr. O'Keefe's car?
Correct. So again, simply a blue arrow indicating that I looked down behind all this stuff, took measurements of it, and then similarly, I have a 3D point cloud of Mr. O'Keefe's vehicle. So part of the reason we're making these 3D point clouds, and we'll touch on this further, in addition to the scene, you can then basically put all these things back together in the computer. So instead of having to drive the cars to the scene, for example, or to Mr. O'Keefe's residence, you can take these computer models and additional data and put it back in the computer and reconstruct everything on the computer. So before we had the exact angle of impact, again, this is for looking at when Ms. Reed contacted Mr. O'Keefe's vehicle, backing out of Mr. O'Keefe's garage at One Meadows. I lined them up just to generally show the approximate location. A couple things. You notice how, again, this lower portion of the Lexus bumper sticks out. Notice how the side of the Chevrolet slopes in as you get higher up. So this portion sticks out more than this portion. And this is where you would expect any contact damage to occur, assuming there was an impact. So again, looking at the measurements of the height of the vehicle, of course, as you indicated, Mr. Brown, the taillight's gone. And then went to the scene. So same thing, went to the scene, took, again, 297 photographs of the scene, had our people scan it to create a computer model of the scene. So, literally, if you want to know the distance from this window to, say, some manhole cover on the road, we have the data to figure that out, down to a couple millimeters.
In addition to going to the scene and doing the digital mapping, you mentioned other review materials. Did you have an opportunity to review dash cam footage from Canton Police Department police vehicles to see the general location of where Mr. O'Keefe was when first responders were assisting him?
Objection, Your Honor.
So that's just a yes or no?
Yes.
Thank you.
So the text stream download. So this is a screenshot from the text stream download. Keep in mind, this is kind of maintenance software. So we're looking at a number of things in the maintenance software. What we see is, and this is noted in the report too, that when the vehicle gets into the Canton Police Department after this event, you can see the mileage is 12,665 miles. So that shows up in Trooper Paul's report. It shows up in the photographs, and it shows up as matching the mileage in the text stream data, both at triggers 1164 and triggers 1167.
I ask you if you can enlarge the data on the right and break down what it actually means, the different columns and the...
My fingers are too fat.
Thank you.
Okay. So what you're looking at is what I call event 1162. If you see anything in blue on these charts, that's information that I added. I typically put my initial, JBW, Judson Welcher, that's me. And so this is referred to as the key cycle trip. So key cycle is simply you turn it on, not necessarily turn the ignition on, turn on, turn off. That's one key cycle. So I labeled this one 1162-2 because there's also one that's on the same key cycle that I'm calling 1162-1. The system also records the mileage. So again, this is a maintenance system generally. So what you see is the T here is the trigger, and there's a point. So this time in the text stream data, you can think of it as like a stopwatch. It's when it starts when the car turns on and stops when the car turns off. And then if it sees a triggering event, a T, it records that information. So this is when the trigger happened. So that's 1,142.2 seconds. And so I've converted that to minutes and seconds, because most people don't think in seconds. And so what it also does is once it sees a trigger, it's constantly circulating data through the computer. So when it says, okay, we have a trigger, it saves 5 seconds before the trigger and then 5 seconds after the trigger. So the trigger's in the middle, and you have 5 seconds of data before and 5 seconds of data after.
I have a couple of questions for you, Mr. Welcher. First, starting with the clock, the time in seconds on the left. You mentioned that begins when the car is turned on. What type of clock is that called?
It's just a continuous clock, meaning it's not a clock like a time clock. It's more like a stopwatch kind of clock.
Has it ever been referred to as a running clock?
The same thing. You start the stopwatch as running.
Based on the text stream data alone, found in that one spot, can you tell from the data in the text stream alone what time the power was turned on?
No, not alone. It simply tells you how long it's been on. It doesn't necessarily immediately tie it back to a clock time. You need additional information.
And so this in and of itself, the text stream data doesn't give you a certain time on a clock, like 1 o'clock or 2:30, anything like that.
No, it simply tells you in this case when the trigger occurred, it's been on for 19 minutes and 2 seconds.
You also mentioned that there's a 10-second window of information that's captured. There's 5 seconds before the T and 5 seconds after the T, the triggering event?
Correct.
Sustained.
That window of 10 seconds, what happens if that doesn't capture the entire event? What if there's something before or after? What does the text stream data do?
So it depends on what the something is. So if there's another trigger, then it will record more data. So you can have 2 triggers that are recording things on the same time window as well, or very close to the same time window. So you need another trigger to keep it going. But in essence, what it does is when it sees a trigger, it saves that 10-second window and then just keeps monitoring things until it sees another trigger.
If the data captures a trigger, it has a 10-second window, and an event continues past that 10 seconds, so past the 5 seconds on either side, and there's no further trigger, do you get any other information from the text stream data?
No. For example, in the trigger event, and say 5 seconds later the vehicle's still moving, well, the data just ends. And it says it's going 17 miles an hour, for example. It doesn't continue on. We just know that when the trigger ended, it was going 17 miles an hour.
Thank you very much.
Okay. So we have mileage recorded in the system. So what we're trying to do is use the available data to see if we can determine what event this is, or is this the event, or is this something that could have occurred outside 34th Fairview on the evening of this event. And so one of the things we're utilizing is the mileage. Okay, so
That sounds like
12629 is at the end of event number 2 on the 1162 ignition cycle. When the vehicle ultimately comes into the impound yard, and this is actually before that, comes into the impound yard, it has 12,665 miles. That's a difference, did the math for you here, of 36 miles. Okay, let's consider where that could come from. So we looked at the various paths and descriptions of where Ms. Reed's Lexus was driven after leaving 34 Fairview on the night of this event, up until the time when
I go
the vehicle ended
Buffalo
up
in the
at the Canton Police
third,
Department.
in case anyone's wondering.
So
Thanks,
we
James.
used Google Maps. We adjusted for the correct date and time of the year. And then what you also see is we adjusted for the correct time of day. So although you can't really see that, let me see if I can blow it up. So you can see that's looking at the mileage and time. Again, really didn't use the time, just use the mileage on Saturday, January 29th, around 12 a.m. And of course, does not take into account the weather.
And what are the addresses? It's hard to see on the top from where to where.
So this is from 34 Fairview to 1 Meadows Avenue, which is Mr. O'Keefe's residence.
And there are other mileage that you have there?
Correct. So we basically ran through the entire path as we understood it. Again, we didn't have complete information. We didn't know the exact roads. We didn't know if turned around, stuff like that. So you're seeing the suggested available paths, and we end up with a range of data. So we go through all the paths, and you can see that this is what we end up at the bottom here, which is very hard to see. So the minimum suggested route is 36 miles, 36.1 technically. We have a range of 37.9 and 39.7. Again, that's right in the range of the 36 miles. So that's a data point that's starting to build our confidence in what is in the text stream data being related to our event.
This is all an effort to match whether or not the 1162 data is relevant to a particular event?
Objection, Your Honor.
Let me ask it this way. Matching all the distances by miles, is this the only way you're trying to determine whether 1162 is the event in front of 34 Fairview Road?
No. So again, these things are all tools. You can't take necessarily one data point in a vacuum. You need to consider the totality of the data, which is what I did. So we mentioned the continuous clock that was in there, or the running clock that was in the vehicle. So what you see over here.
Could you remind that for us, Doctor?
I am doing that right now. You can see we have the time. And again, I've converted it in blue to minutes and seconds. This is the first trigger on that key cycle. So on key cycle 1162, there were 2 separate events. The vehicle keeps a continuously running clock. So we're able to see the time each event occurred relative to when the vehicle was started and the difference between the 2 events. Okay. So at trigger event 1162-1, we know that the ignition has been on between 10 minutes and 57.4 seconds. Or that's in the trigger, sorry, 10 minutes, 57.4 seconds. Again, the trigger has plus or minus. So that's from 10 minutes, 52.8 plus 10 seconds, which gets you to 11 minutes, 2.8 seconds. Or as I wrote here, 10 seconds total. So again, the text stream data indicates at the time this event was written, the trigger occurred, again, at 10 minutes. You see we have the T, 10 minutes, 57.4 seconds.
Dr. Welcher, if I could ask you a couple of background questions. This block of time that you're reviewing that mentions 2 triggers, can you tell whether those triggers are immediately related or 2 separate events?
So you can tell they're separate events because there's a separate amount of time between them. There's about 8 minutes between the events. And so they're on the same ignition cycle, meaning the vehicle hasn't been turned off in between. And we have this continuously running clock that records when these things occurred. So it tells us when event 1 occurred, when event 2 occurred. We know it's on the same ignition cycle. So if we have some idea when the car was turned on, we can then tie that back to clock time or real world time. Okay. So lots going on here, right? A lot to digest. This is trigger event 1162.1. I was provided with data and a report from Mr. Burgess that indicated the infotainment system was turned on at 12:36. That corresponded to a GPS location that looked like it was outside the Waterfall Grill on Washington Street. So additional cell phone data that we had is that we knew there was a 3-point turn made when the Lexus passed Fairview on Cedar Crest, pulled into a driveway and made a 3-point turn. So what you see over here is GPS data from Mr. O'Keefe's phone. And with that information and knowing when the system turned on, we're able to now tie the text stream data to a real clock, meaning what time of day did that text stream trigger occur. So we're going from the running clock to a real world clock. So if you take when it was turned on from Mr. Burgess's report, you can see that the Lexus was turned on at 12:12:36. You add in the text stream information, you get it at 12:23:38. And now we have a cell phone data point at 1:54. So at the time my report was written in these slides back in January, that was all we had in terms of data point 154. That was the one that was closest in time to it. So we had since received additional information.
Dr. Welcher, let me ask you a couple questions, and if you can zoom in a little, we might be able to see it a little better from here.
Where would you like it?
If we can start at the top when you explain in text. You told us that the text stream data does not have an actual clock, it has a running clock, like a stopwatch.
Correct.
And then you mentioned that after you receive information from Mr. Burgess, you could put an actual time onto it. How do you do that?
Just stand.
You shared with us that the text stream data runs on a running clock.
Correct.
And then you received further information so that you could actually identify a time. Where did you receive that information from?
I'm going to allow that.
That was from Mr. Burgess's report.
And do you know where that information came from?
That came off the SD card, I believe, in the infotainment system.
Do you know when Mr. Burgess found the SD card on the infotainment system?
No, I'd have to go back to his report, but it was in it. This information was in his original report.
Based on the SD card information about when the car was turned on and off, how do you match that with the text stream data to get a time?
So when the car is turned on, that's approximately when the running clock starts in it. There may be as much as a 3-second delay in it, but that's approximately when the clock turns on. So this shows us when the stopwatch was started for the text stream data. So knowing that infotainment system has date and timestamps on it, so that ties it to a real world clock from GPS information. And so now we can, when that infotainment system turned on, it's very close in time to when the text stream data started recording data, that allows us to tie the two together.
The times that you're showing on this slide, does that relate to the first or second event on the text stream data, the first or second triggering event?
The first event.
Do you characterize the first event in any way?
I call it the 3-point turn.
In addition to the data you analyzed, was there any other information you saw that evidenced or supported that a 3-point turn occurred at the area depicted in your slide?
Right. We have a whole series of GPS data with heading angles, as well as a description that Ms. Reed gave in an interview.
The time that you have after you consider the SD card ignition on and the running time, what clock is that based on?
It's my understanding that's a clock in the infotainment system. And then we are ultimately trying to also tie it back to the clock on his cell phone.
Mr. O'Keefe's cell phone?
Correct.
Do you have any understanding whether all devices have the exact same clock?
So it's my understanding they do not. In my discussions with Mr. Burgess, reading reports, that they can have, there can be as much as 30 seconds to a minute of variation.
Sustained.
Have you ever heard?
Sure. Just disregard that answer.
Have you ever heard the term variance before?
I have.
What do you understand that to be?
That means differences from the answer,
I'm sorry, differences from what?
from typically the correct answer. Like meaning that a given data point has variance in terms of how it's measured, when it's measured. So different measurement device can have a different variance around the actual true number.
You mentioned on the slide a time of 12:23:38.
Correct.
In O'Keefe's cell phone data at point 154, approximately 12:23:58.
Correct.
Is there a difference between the clock on the Lexus text stream data and that of Mr. O'Keefe's iPhone?
There is.
When you developed the slide, did you have the benefit of more detailed information about data point 154?
I did not receive that until May 8th.
Did you later learn more information, more specific information?
Yes.
Okay. So I'd like to show an exhibit to Mr. Welcher that's already been admitted. It's 192A. Just going to start with 192B. Dr. Welcher?
Yes, we'll call it.
Dr. Welcher, if you could take us back to slide 30. And so we understand you mentioned there are two triggering events. Is this the first one or the second one?
The first one.
Is that the one you've labeled the 3-point turn?
Correct.
And where did that happen? What street?
Cedar Crest.
At this 3-point turn triggering event, there is a time in red, 12:23:38.
Correct.
Where is that time taken from?
That's coming from the cell phone of Mr. O'Keefe at point 154.
Okay. And is there another time on there?
I mean, I do the math between those two.
Yeah. Could you make that a little larger? Could you zoom in so we can see it better?
So there's an infotainment time of 12:36. I guess another time to answer your question. Then we have
the 12:36. What does that indicate? What's that relevant to?
That's when the text stream data basically turned on, plus or minus a little bit.
When you say the text stream, is that relative to when the car turned on?
Correct.
Okay.
So when the car turned on, then we add the time for the trigger. So what we have is we have data in the text stream that shows the speed, the position, the steering of the vehicle on that trigger. And so we're trying to match the timing and the description of what the vehicle was doing with the text stream, the infotainment, and the cell phone data.
Is the data you analyzed regarding the speed, the direction, and the timing to determine whether this was consistent with the three-point turn?
So
Yes.
Okay.
extremely boring and
And if you can enlarge that,
ridiculously
it's hard to see that.
overpaid.
That sure is. Okay, so again, we are looking at event 1162.1. The information in blue is speed. It comes out of the text stream in kilometers an hour, converted to miles per hour, feet per second.
I'll show
Look
it
at the total
again.
distance
James.
traveled.
I'll pull it up right now.
Shift
Hold on.
position. So in the text stream
Ouch.
data, a shift position of 1 indicates you're in drive. A shift position of 2 indicates you're in reverse.
There's no zeros. What would a zero indicate?
0 is using neutral, and I believe 3 is park. So there's also data on the acceleration of the vehicle. So basically, what is the effect of whatever you do in terms of stepping on the gas or not stepping on the gas? And there's also information on the steering of the vehicle. So again, there's trigger 5 seconds before, 5 seconds after. So over here, a positive number equals a leftward steer. So you can see we have in the forward velocity or forward motion in drive, goes forward with leftward steer, stops, shifts into reverse, and then continues with a rightward steer back.
Could you take us over to the left of that data? When you look at the number 1162-1 as an event, can a key cycle, or when a car is turned on, power ignition on until the point is turned off, whatever amount of time, can it have more than one triggering event?
Yes, you can have lots of triggering events. In this case, it has 2. On a key cycle 1164, there's 11. On 1167, there's 10.
If you could move a little bit to the right on this, is there something you can see on here that caused the triggering event, some of the data?
Okay, hold on. I'm pulling up my Dropbox now, guys, so I can show that thing about Chloe. In case you weren't here earlier, Joy sent me part of the document dump that shows an email sorry guys, hold on. This shows an email from somebody who was picking up what was it? Tim Albert girlfriend from Brian Albert's parents' house where the pool was cemented in or filled in. And she apparently claimed that's where Chloe is buried. Okay. So, hold on, let me catch up to the chat. So I'm reading this here. Okay, let me take this down real quick. I see James is here. So this is, if you're still here, that was, a minute ago. Okay, good. That was only a minute ago. Okay, so apparently this was in, it looks like Facebook or Twitter. I'm sorry. Yeah, Twitter. It says, Tim Albert's girlfriend's daughter, Delaney Crisilio Minton, told someone that Chloe was dead and buried in her backyard at 1473 Washington Street in Canton. This is Brian Albert's parents' house, where they had a pool that was mysteriously filled in. And obviously done after Aiden reported on it. So this part says, see if I can get it. It's about as big as I can make it without it going off screen. This part says, this is the email right here. And it says, a girl I recently spent time with, Delaney Minton, who I picked up at 1473 Washington Street, Canton, Massachusetts, told me that the dog involved in the Karen Reed case was dead and buried in her yard. She also said her house had been burned down and she just recently moved back in. She claimed her uncle was the main Canton police officer involved in the case. I have dash cam recordings, but it appears to have been overwritten. I would be willing to turn in the SD card anonymously if forensic investigators think it's worth looking at. You can contact me at, and it gives an email. And when you look at the date this email was sent is May 15th, 2025 at 10:02 p.m. So this email was sent during the Karen Reed trial, during trial 2, while it was happening. And yet, defense didn't get this as far as we know. This stuff is insane, I'm telling you. James says that house is directly across the street from Canton PD. Are you serious? You mean where Higgins went that night? Oh, I have more questions. I need to make a map. Like, I need to make a map and a timeline. Like, map. I have it in my head. I can visually see it. So I think since, yeah, I'm going to work on that tonight with the other few things I want to work on. Because I need to visually see this. But that's insane. There was also a fire in the attic of Albert's father's house just last year. Oh, nice. How many people have house fires there? We're 2 people in the same immediate family. That's crazy. All right, let me get back to this real quick. And if you guys didn't notice, I'm watching the chat, and I will stop if I need to, but if I will, like kind of like yesterday, so we can get through some of this, I will chat in the chat as well. Plus, I'm going to get some lunch again right now. So I am going to mute myself. I will unmute if necessary, and we'll chat in the chat for a little bit with you guys. Here we go.
Data?
Yes. So if you look at the triggering, the indication of what this trigger was, what you see is accelerator opening ratio, which is basically, you can think of how much you're stepping on the gas pedal. And so if it exceeds, in this case, 30% quick in time after shipping into reverse, that tells the system, hey, we might need to start recording this data. So what you can see, went into reverse, and then within a very short amount of time, accelerator pedal went above that 30%. That's what caused the T or the trigger in the PET stream data.
The row next to the 31.5, engine RPM data. Can you explain to us what that is?
Sure, that's how many evolutions per minute the engine's turning.
Really quick, I have several people, listen to the trial while they're working or, doing chores, all those good things. So I just appreciate you listening. If you're not chatting, that's totally okay. As I get something to eat, I won't be doing either. So we will get through some of this trial. But I always appreciate you just being here.
The more gas, is it generally the higher the RPM?
Correct. There's going to be a little lag. Your car doesn't move instantaneously. You have to step on the gas, then the RPMs go up, and then it starts going faster.
If you could explain to us the total distance and distance travel columns, how do you read that?
Sure. So we know the speed at various times. We know from this data that there is you can see half a second between each one of these timestamps. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 data points at half a second. That's the 5 seconds of pre-crash data. So if you know you're going so many miles per hour, again, I converted it to feet per second. Feet per second, you're going so many feet per second for half a second, for example. You just multiply those two together and it tells you how far you went. So what I'm doing is looking at speed traveling during the interval. That's during this short time period. And then I add it all together here for total distance traveled.
You mentioned that when the data is captured, it's limited to 10 seconds. When we look at the top row of JBW vehicle speed MPH, it's 9.94. Is that 9.94 miles per hour?
It is.
Can we tell whether it was going faster or slower before this data?
We generally cannot. I mean, you might have some, it looks like it's slowing down. And then you see right here, this brake switch application. So you have two things relative to braking. You have a brake switch, which is simply whether the brake is on or off, just enough pressure to make the brake light come on. And then you have brake oil pressure, which gives you some idea of how much pressure is in the system, which is a rough indication for the braking. But then what you see here is the longitudinal acceleration or deceleration. This gives you some idea of how much the vehicle is speeding up or slowing down. So generally a minus sign is a slowing or accelerating in reverse.
And for the bottom of those columns, I'd ask you whether or not at the beginning of the window, if you had any other information, is it the same situation for the end of that window that's captured?
Correct. So at the end of this window, you can see it's still going about 8.7 miles an hour when the trigger stopped. So after that trigger plus 5 seconds, the system said we no longer need to monitor it. Things have returned to an okay state. And so then it stops monitoring the system.
Based on your analysis and review and looking at this data, did you come to a conclusion to a reasonable degree of engineering certainty whether or when this event occurred as it is portrayed in the data?
Yes, I did.
And did you share with the jury to a reasonable degree of engineering certainty when did this occur?
So this, you want time-wise or location or both?
Start with location, then time.
So it happened on Cedar Crest. It happened between cell phone data points 154 and 155. And it's a 3-point turn on Cedar Crest. And it occurred, according to the text stream data, about 12 minutes, 23 seconds after the vehicle was turned on. So,
and do you have an understanding of the variance between the Lexus clock and Mr. O'Keefe's cell phone?
Yes.
And what is that variance time?
21 to 29 seconds.
And so the Lexus clock at 21, 23, 38, what time would that put Mr. O'Keefe's cell phone?
Objection, Your Honor.
I'm going to see counsel at sidebar for just a minute, please.
Well, the session will be seated.
All right, so Mr. Brennan, you can continue. The objection's overruled.
Dr. Welcher, could you take us to slide 30? Could you zoom in a little bit on the right photograph and under the right? You were explaining to us the time relevant to 12:23:38. And could you tell us again, remind us, what is 12:23:38 referring to?
The 12:23:38 is syncing the text stream time to real world time. So we know how long the text stream is on. We know when the vehicle was turned on. So we're adding those two together. So if you add the 12:12:36 to, for example, 11 minutes, 2.8 seconds, or when the end of the trigger is, that gives you 12:23:38. So the end of the trigger in real world time, no longer in the running clock, is now 12:23:38.
Based on the infotainment clock?
Based on the infotainment clock.
And that's from the Lexus?
From the Lexus.
Sustained.
And where's that from?
The Lexus.
The 12:23:58 number, what's the significance of that?
So that is Mr. Keefe's cell phone data at point 154. Again, from the original data we had, just at 154 and 155, not the in-between points. So,
and at the bottom in parentheses, explain to us what that means.
Sure. If you look at where the text stream math works out to be, 12:23:38.8, and compare that to 12:23:58, the difference between those two is 19.2 seconds.
The difference between which clocks?
Between what the text stream infotainment system would show compared to what point 154 on Mr. O'Keefe's cell phone is.
And based on new data, do you now have information about what the variance, the difference is between the clock on the Lexus infotainment and the clock on Mr. O'Keefe's cell phone?
Yes.
And what is that?
I'm going to allow that.
It's, you need to advance the text stream clock 21 to 29 seconds.
You need to advance it 21 to 29 seconds for why? Why do you need to do that?
Because the cell phone is ahead 21 to 29 seconds.
After you advance the text stream ahead 21 to 29 seconds, can you then compare the information, the time that's coming from the infotainment system Lexus to Mr. O'Keefe's cell phone from his iPhone?
Correct. That's what you need to have an apples to apples comparison. You need to get them on the same time clock.
Thank you. You can proceed.
So I think we left off here. So that's 1162-1. So what we have is we have the cell phone data, the original cell phone data on the right-hand side. And then from that text stream data, we have whether it's going forward, we have the speeds, we have the steering angles. So from that information, we ran a simulation to show you what the tech stream data means. This is what the 10 seconds of data is. Again, just because the simulation stopped, that's just where the tech stream data ends. Again, as we showed you earlier, the car's still moving. That's just the last data point we have. So what that tech stream data shows is matching a 3-point turn on that Cedar Crest Street. So we have the vehicle motion, the timing data consistent with the interview statements about making a turn, 3-point turn.
Can you take us back to the data chart and show the 2 points that you just mentioned, the turning? Where's that reflected in the data?
Sure. So you can see
You have to enlarge that. I'm sorry, Doctor.
column N, that's the shift position. So that's looking, we start off going forward right here. And you can see at the start of the simulation, we're going about 9.94 miles an hour. And then as you start a 3-point turn, you generally start, in this case, if you're going to the left, with the left turn. So you can see we have this steering angle here. Then the transmission, so again, we have the brake application. So you're coming in, but you're slowing down. And you get down to a speed of approximately 0. 0, shift into reverse, back up, and then start to turn the other direction as you're backing up. So again, you want the rear to go to the right, you turn the steering wheel to the right. Right is negative. And then as you start to pull around and pull forward, you turn back to correct for the steering. And so that's what this shows. So again, if you put it all into a simulation program, the speeds, the shifting, the distance, you might only have that 10-second window of data and the steering angle for that Lexus. That's what it indicates.
Can you enlarge the photograph on the right with the data points and explain to us the significance of that?
Sure. So again, what we're trying to do is we have the infotainment, we have a text stream. We're now trying to see how that correlates to Mr. O'Keefe's cell phone. So we had originally very coarse data points, 154 and 155. There's additional data points between here. So we're looking at how well does ARC's predicted time compare to those two. So with the cell phone correction, you end up with the text stream data at 12:23:59 to 12:24:07. So that's actually right in between these two data points. And so we know 154 was closest, but it's on the right-hand side of the road. 155 is when it's turned around and heading back in a southerly direction. So the cell phone data corroborates the text stream timing data in conjunction with the infotainment system data.
Thank you. Please continue.
Okay, so we talked about 1162-1. That's the first trigger on the text stream. So we're going to go to 1162-2. So I've highlighted that in yellow. So we're now talking about the second trigger. So this is on the same ignition cycle. So ignition cycle 1162. We have that same continuous running clock, but we've now synced it to real world clocks. So instead of the running clock, we now have some information on the real world clock. So at this time, we know the ignition has been on for 19 minutes and 2 seconds. So at the trigger, 19 minutes and 2 seconds. And again, we have 5 seconds either side of that. So between 18 minutes, 57.6 seconds, and 19 minutes, 7.5 seconds.
Could you enlarge that, please?
Which part?
That part where your arrow is. You were speaking about the clock. Could you explain that so the jury can see?
Sure. So again, this is continuous from when the time comes on. I just converted it to minutes and seconds here, so you can see how long it's been on. This is the mileage. These are the speeds over here. And this is some information on how far it traveled. Again, we have the plus minus on the steering. That gives us some information on the steering. Really, there's very little steering going on at this point. Slight leftward steer.
Dr. Welcher, did you determine how long after the first trigger, that 3-point turn, that this second trigger occurred?
Yes. 3-point turn occurred about 8 minutes after.
You said the 3-point turn occurred after?
Sorry, this event, I misspoke. 11.2 occurred about 8 minutes after.
After the 3-point turn?
Correct.
Okay. Can you walk us through this data?
Sure. Okay. So we have the accelerometer data here. I've highlighted a shift from drive to neutral to reverse.
I'm sorry, let me zoom that in so we can see it.
Absolutely. We have information on the brake switch, brake oil pressure. We have the acceleration data here. And then from that information and using the acceleration data, calculating the speed at which it's backing up. The reason we have slightly different calculations here is we have some evidence of the wheels slipping on the ground. So we need to use the accelerometer because the wheel speed is simply telling you the speed of the wheel. Like if you're stationary burning rubber, the speedometer reads a certain speed, but you're not going anywhere. But the accelerometer tells you how much the vehicle's moving. So from all that information, we get information on how far the vehicle's traveled. We've done it in terms of total travel distance. We've done it relative to the start position.
I'm going to ask you to start on the columns on the left and take us through the information that you have regarding this second triggering event. So if you can scroll all the way to the left.
All the way to the left?
So the first column regarding time, can you remind us again what that is?
So again, that's the continuous running clock.
And the second column in blue.
That's where I take that time and convert it to what we more commonly use, minutes and seconds.
And now we have a key cycle event, different than the 3-point term. What's the number?
So this is now 1162-2. So again, it's technically in the system the same key cycle. I called it 1162-2.
And the red number next to it to the right?
That's the mileage. So it's actually at the same mileage as 1162-1. So we know they're within the same mile.
If you can scroll over a couple of columns. From your data, can you tell during that event how far the Lexus traveled during that event?
Yeah.
And how do you do that?
So we have accelerometer data. We have velocity data or speed data back here. I corrected for what you see down here is, and I go through this on the later slide, but right here you can see a significant increase in RPMs, but yet the acceleration is dropping. So what that means is if your RPMs are going up and the speed's going up, that means you should be accelerating more. But what happens because the acceleration is dropping, that means what's actually happened is the wheel's slipping. So what I've done is I've used the accelerometer data to calculate the speed once the vehicle is put into reverse. And once we know the speed, again, feet per second, we know every data point is half a second. So speed times time tells you how far you moved. Feet per second, feet divided by seconds times seconds gives you feet. That's how far you went. So you get how far you went in each interval. Then you get the total distance traveled. And so this is relative to the start. So 0 is the start. The vehicle goes forward about 34 feet. Then you see it basically stops in this area here, then begins to back up and ends up backing a total of 53 back from where it originally started. So if you add 53 to 34, you get 87. So the total motion, 34 forward, 53 back, the Lexus moved 87 feet total.
Dr. Welcher, when you say the Lexus moved 80 feet total, is that according to the data or is that the entirety of the movement of that Lexus?
No, that's just from when the data starts to when the data ends. So if you look at when the data starts, you can see that the vehicle is actually going 13.67 miles an hour. When the data stops, the vehicle is still going 23 miles an hour. And you can see, you can still see that it's still at 74% throttle. So, this is 3/4 of full throttle in reverse.
So to start with the distance travel, that you can go to the top, we see that the speed is 13.67. Is that where the data gets picked up?
That's where the first data point is. Again, the trigger is here. This is 5 seconds before the trigger.
Are you able to tell how fast or slow the vehicle is traveling before that data point, in 5 seconds before the trigger?
No.
And likewise, on the bottom, the speed. At the end of the 10-second data point, it's at 23.61. Can you tell whether or not that speed stayed the same, increased, or decreased?
I mean, considering you're at 74% throttle, it likely increased. How much, I don't know. And you can see that up here, she's on the brake. Down here, she's not on the brake. And so she's not on the brake and at 74% throttle.
And what is the percentage of throttle that has to be initiated to cause a triggering event?
For a shift into rear and a rapid throttle application, it's 30%.
If you look at the next column over, if you can go to the top heading for the jury to see the engine RPM data, could you explain that?
Sure. Again, that's the engine RPMs. And so, as I mentioned, you have this jump in engine RPMs and a very dramatic jump in the reported speed of the vehicle. But when you look at the acceleration is actually dropping. So again, that's a telltale sign that the tire's spinning because the vehicle is not being accelerated. And so I've used the accelerometer data. Again, if you just, it's a process called integration. You integrate the accelerometer data, it will give you the velocity. So what I've done is it's called piecewise integration to get the speed data that takes into account the tire slippage, and from there calculate the speed or the position at each interval going across the top here.
If I could stop you at your column that says JBW speed at each time step.
Yep.
You go to the bottom, please. So does your data indicate that the speed is changing at the end of the 10-second event?
Yes, Your Honor. Same.
Is the speed changing at the end of this event?
Yes.
How so?
Well, again, you can see it's increased about 2.7 miles per hour. And again, we know from what I already stated that last time step, you're still at 74% throttle and you have 0 brake application.
Is it possible from the data to tell how far the Lexus went forward before it went in reverse in total as far as speed?
Not in total, no. We just have this 10-second window. I can tell you what it did during this 10-second window.
Is it possible to tell how far it continued after the data?
No.
The shift position changes from 1 to 0 to 2. Can you again explain to us what that means?
Sure. 1 is drive, 0 is neutral, 2 is reverse. And then brake switch status, again, a 1 is you're on the brake pedal, enough to activate the brake lights. 0 is you're off the brake pedal.
Each one of those indicated 1, 0, 2. How much time is for each of those?
0.5 seconds.
So can you tell how long the Lexus was in neutral for?
So again, it only occurs at one time step. And again, there's a little timing issue. Like we only have data every half second. You don't know exactly where in that time it was.
Okay, you can continue, Dr. Welcher.
Next slide or continue on the slide?
Unless there's something else you want to point out to the jury on this slide. You can move to the next.
So similarly, using this information to then try to tie it back to the cell phone data to make sure we have the real-time information. Again, this was written back in January. Additional information. So what you can see is, I'll zoom in. Again, we're now talking about trigger 11:62:2. We know that that's 18 minutes that the vehicle has been on, 18 minutes, 57 seconds, 19 minutes, 2 seconds. This is the range. Again, the plus or minus 5 seconds. The 19 minutes, 2 seconds is when the trigger occurred. Infotainment system, adding those two together, 12:12:36, plus the 19:7.5 indicates the end of 11:62:2 is at 12:31:43.
That 12:31:43, is it based on the Lexus clock from the infotainment system?
It is. It would need to be corrected to the O'Keefe cell phone data.
When you reconcile that variance of 21.9 seconds, what is the time?
You end up with 12:32:04. So if you simply take this and add 21 seconds to it and add 29 seconds to it, so you get between 12:32:04 and 12:32:12.
When you reconcile the two clocks and you have that range of 12:32:04 to 12:32:14.
12:32:12.
I'm sorry, 12:32:12. Does that simply accommodate the window of data, but not before and after?
Correct. So, again, even on John's O'Keefe cell phone, even within his cell phone, there's somewhere between 21 to 29 seconds difference on his cell phone. So even that one piece of instrumentation has some variance to it. So we know it's between 21 to 29 seconds at this approximate time. So this is taking into account that variance.
So the only time window that you have is based on the data, and that's reflected in the 12:32:04 to 12:32:12?
Sustained.
Is there any other window you can accommodate with the data you have other than that 10-second window?
Yes.
What's that?
So I was given information about a final lock event on the phone.
Let's stick with this window if we can.
Okay.
Since you only have 10 seconds of data, is it possible from the Lexus clock data to have a larger window than the 10-second window?
No, the Lexus, or excuse me, the touchscreen will only give you a 10-second window, but it doesn't tell the whole story because the vehicle's still moving.
Understood. Okay, continue, please.
So I have this other event, a lock event, and the information I was given that's at 12:32:09. And so we have the text stream data ending at somewhere between 12:32:04 and 12:32:12, which puts this number right in the middle of that, more or less.
Continue.
Is this a good place to take a lunch and break?
Certainly, yes.
Okay, so why don't we do that here? So we'll take 45 minutes for lunch. And again,
Thank you, Your Honor. Thank you very much.
You are muted.
Well, normally these cut right through these breaks, but hold on.
This court is in session. Please be seated.
There you go. Dr. Welcher, when we left off, you had given us your opinion on this slide. Could we proceed to slide 35, please?
Slide 35.
I believe the next slide is 35. Okay. Now, when we look at this slide, I'm going to ask you to zoom in. If we can start from left to right, and we can identify each category as you discuss it and explain to us the importance of the columns.
So we already touched on this from left to right. The first column is the continuous running clock. Second column is where I converted it to minutes and seconds. You can see we're on trigger 11:62:2. This is the second trigger. The particular boxes that are highlighted are where there's change. For example, in the upper right, when you're transitioning from drive to neutral to reverse. And then I already discussed this a little bit, but where the wheel's slipping, you can see you have high acceleration pedal application, increase in the RPMs. But when you look at the effects on the vehicle, you can see that it's accelerating less. So that's indicative of slippage of the wheels. And then I simply show at the bottom the math I use to derive all that. So again, we touched on most of this. It's the same slide you saw before, just to show how corrected for the speed.
If you could zoom in for a second, I want to ask you a question about the RPM column.
RPM column, go ahead.
You could zoom in.
Oops.
You see in the last line, the last piece of data captured, the RPMs changed from 3,200 to 3,300.
Correct.
And the accelerators is, it's fair to say, is that depressed? What's the way you characterize that?
Sustained.
How would you characterize 74? What does that mean?
I mean, it's 3/4 of full throttle. It's 74% of full throttle.
If above it's 74.5, it drops to 73.5 and then back to 74, why is the RPM higher than above?
So there's, again, this data is referred to.
I'm going to say this just one more time. I've talked about this a couple times with this bullshit when they talk about 75% down on the acceleration pedal. Okay, we all saw the video of the tires spinning in the fucking snow. What do most of us who drive in snow do immediately upon the car getting stuck in the snow? We know better, but we do it anyway. We push the gas pedal down and try to get ourselves out. Just saying.
Being asynchronous. You're recording it at particular times, but the computer's scanning the network for the data. So it's not all on exactly the same time step. Not only that, but there's frequently,
Sorry.
There frequently is a delay from when you step on the accelerator pedal to when that translates to increased RPM at the engine. It takes a little time to build it up or take it down.
Okay, thank you.
You're welcome. So similar to what we did on the first one, basically what we did is we took all the tech stream data that we had, which includes the shifting, the forward, the reverse, and the steering. Again, there's a tiny bit of leftward steer, and put that into a simulation program where we're simulating what the Lexus will do. So we take into account the mechanical characteristics, the steering response of the Lexus. So this is to show what it represents on the left-hand side. So each one of these little hash marks, a different color, represents 10 feet. The red lines show the extent of motion. Remember what I said, initially pulled forward, then backed up past its initial spot, and then went backwards further distance. So what this shows is where we simulated this in a program called HDE. So that's the vehicle, the Lexus pulling forward. And then it accelerated in reverse past its initial starting position and came to rest right there.
Doctor, when you say it came to rest there, do you have data that the defendant's Lexus stopped there?
No, it did not come to rest. I misspoke. That's where the tech stream data ends. As you can see here, it's still going. It's still going approximately 23 miles an hour when that ends.
You'll have to zoom in on that so the jury can see what you're referring to. Please.
So again, as I mentioned, the tech stream's taking a window of data. It doesn't take anything outside the window. You can see that when we account for the wheel slippage, that the vehicle at the time of the last data point, again, is at 74% throttle, 3,300 revolutions per minute, and is going backwards approximately 23.9 miles per hour. And you can see it's traveled a total distance backwards of 53 feet back from where it initially started. Or if you consider where it pulled forward 34 feet and then backed up 53 feet, add those two together from the point it pulled all the way forward. So this is 10, 20, 35 forward. And then it'll go 10, 20, 30, 40, 53 back for a total of 87 feet. So from the maximum point it pulled forward to where it backed up, again, that was.
I'm going to pull something up, guys. Before I even started streaming, I clipped this 6 months ago from a clip I saw of trial 1, which is what really made me want to watch trial 1, of Higgins almost saying where he was parked. He talks about where he was parked, and he almost says garage. Listen. The back end of the Jeep
Did you hear that? Listen. One more time. The back end of the he was about to say garage. Oh, you guys aren't seeing it. I just realized it. Sorry. Hold on. Here we go. My bad. What the hell? Why isn't it working? Here we go. Jeez, oh Pete, StreamYard, get your shit together. Okay, listen to this, guys. Ready?
Parked in relation to the house.
I do.
Yeah, we know. The mailbox.
The mailbox. So the back end of the Jeep would have.
The back end of the garage Jeep. Did you hear that?
No, the mailbox.
The mailbox. So the back end of the Jeep would.
The back end of the Jeep. So he's recalling where his Jeep was, right? And he literally almost says garage. Like the back end of the garage, like his Jeep was in the garage. No joke. One more time. Here.
Yeah, we know. The mailbox.
The mailbox. So the back end of the Jeep would have.
The back end of the Jeep. Just saying. Yeah, it's funny. I catch a lot of little things like that because I pay attention to their face. And then when I hear them stumble, because I know that they have to repeat their script, but there's leakage. The truth wants to come out. So when I hear things like that, I go back and I truly listen. What are they trying to say? Jen McCabe, I caught Jen McCabe several times. That's how I heard her whispering to herself. Can't still for the life of me figure out what she said. Of course he's lying about the Jeep. We all know that. The Jeep, it's so dumb because I don't even get the whole lying about it unless they're covering up the fact that it was in the garage and that it was in the garage maybe because that's how they moved his body. I don't know. But the Jeep couldn't have been there. We know because the guys driving the truck, the people in the truck never saw it. Karen, as far as I know, never saw it, or at least didn't say she saw it anyways. And then they all talk about how they see the Karen's tire marks in the snow. How could they see her tire marks in the snow if the Jeep is there? And then last but not least, their whole theory blows up the minute you park that Jeep there, that she could have backed up at that speed, hit John, and not hit the fucking Jeep.
"34 feet forward, then a total of 53 back, total travel distance of 87 feet. So went all the way forward where it stopped, it then backed up 87 feet. When the text stream data stopped, it's still moving. It's still moving about 23 miles an hour, and you're still 74% throttle and 3,300 revolutions per minute on the tachometer, RPM gauge."
You could turn the light on for a moment. Dr. Welcher, in your analysis of the data and the information you acquired and the evidence that you relied upon, did you come to some conclusions and opinions regarding the defendant's Lexus that evening?
I did.
As part of that opinion, you mentioned that you considered mileage to map distances as one way of mapping the location of the vehicle. Do you remember that?
I do.
If you could provide us with slide. believe it's slide 25. And can you widen the left-hand box a little bit? And you mentioned you measured or you ran information about distances between different routes.
Correct.
Specifically regarding Fairview to Meadows, the first box. Do you see that?
I do.
There are 3 different mileage numbers.
Yes.
And then there's streets to the left. Can you explain what's set out in that box?
Sure. There's basically 3 different routes you can go: Sherman Street, Pleasant Street, Washington, and Sherman Street.
When you considered the shortest route, 2.3 miles on Sherman Street, did you attempt to determine how long it would take to travel 2.3 miles? How fast the car would have to be moving, or how slowly it would have to be moving to travel 2.3 miles in 4 minutes and 15 seconds?
Yes.
And what did you determine?
So to go 2.3 miles in 4 minutes and 15 seconds, you need an average speed of 32.47 miles an hour.
What if you took the longest route, 2.8 miles, and you considered 2.8 miles in 4 minutes and 15 seconds? Did you make a determination?
I did.
Could you share that with the jury?
It's 39.5 miles per hour.
Is that what the average speed of the Lexus would need to be to travel that distance in that
Correct.
time?
You know, I'm going to be honest. The cat says the snow really never had any impact on my thoughts about the story. After watching the first trial, it didn't. But having now seen after watching the second trial first, you know, I never thought much of it until I watched the first trial. Having seen how much Lally tried to impact in literally, like, what's the word? Just the impact on the jury he did with that false impression of how much snow was on the ground, trying to unfairly prejudice the jury when, you know, when they testify about how much snow was technically on the ground that morning, but yet hearing Carrie Roberts saying, "Oh, I had to dig him out of this huge pile of snow." So what they wanted to do was knock the credibility of Karen saying that she saw him out the window, because they wanted their narrative to stand out saying, "I don't know how she saw him. She must have known he was there." It was absolute bullshit. But that picture that Lally kept putting up for the jury to see, that was not a realistic portrayal at first of how much snow was on the ground that morning, but also an unrealistic view of how big, let me rephrase that, of how small that yard really is. The angle of that picture of that yard was totally done on purpose, because that picture makes that yard look so big, and it is not. It is tiny. So they want to make it, they wanted something to keep showing the jury that, oh, look how big the yard is. Look how much snow there was. So how else could have Karen known he was there unless she knew it? That's what they wanted their jurors to think. Oh, look how much snow was on the ground. All the people leaving 34 Fairview that night couldn't have possibly seen him on the lawn, because look how far away it is. Not. Because as much as I truly do agree with people calling Lally a moron, he's a moron, but he was really smart in some ways, because, I mean, how many times he showed that picture, it doesn't matter what the people in the jury box says. You see that picture over and over and over. That's all you're going to see. Is you're going to feel like that yard is big. You're going to feel like all that snow was on the ground when when John was found. And that's just not the case. Visuals have a bigger impact than testimony, in my opinion.
Now, turning to your study of these tech stream events, do you have an opinion, to a reasonable degree of engineering certainty, how many triggering events occurred? How many triggering events occurred in that ignition cycle 1162?
Objection, Your Honor.
I'm going to allow that.
In 1162, the tech stream recorded 2 triggering events.
And do you have an opinion as to
the
type of triggering event, the type of movement of the defendant's Lexus in those 2 triggering events?
I do.
regarding the first triggering event, 1162-1, do you have an opinion to a reasonable degree of engineering certainty what type of event the first triggering event was?
I'm going to allow that.
The actual trigger was excessive rearward acceleration. The event was during the course of a 3-point turn.
And do you have an opinion to a reasonable degree of engineering certainty the time between triggering event 1?
I definitely remember that. I saw the video of that. If you guys haven't seen the video, yeah, Alan, they went to the house. Alan Jackson could be heard just whistling from that bedroom. You have to, and that's another reason, too, about the disproportionate picture making you think that yard is bigger than it is. Like, these people want you to believe that 20 feet out their window are a bunch of ambulances, cop cars, a woman screaming hysterically. Remember, they had to constantly say that. She was hysterical. I told her to shut the fuck up. All these things are happening outside, and you supposedly have a dog in the house and you don't wake up? Fuck off.
In triggering event 2 in that cycle 1162.
Yes.
And could you share with the jury your opinion to a reasonable degree of engineering certainty the time between those two triggering events?
Yummy, yep.
Approximately 8 minutes and 5 seconds.
And do you have an opinion to a reasonable degree of engineering certainty as to
Spread
the
his load.
type and triggering event of the second event, 1162-2?
I do.
And could you share with the jury your opinion to a reasonable degree of engineering certainty the type of event of that second triggering event?
That's what I'm saying.
Yeah.
Because Kat says one of the witnesses said they saw the tracks of a 3-point turn after midnight after Karen left. And this is the point. Not only did they change their story about the 3-point turn, so now the 3-point turn tracks make no sense. You also have a witness saying they're seeing tire tracks where there's supposedly a Jeep parked and on a road where there's barely any snow, enough to track a cat. So that on a road like a side road or, a side street where cars are driving, how is it going to be enough for you to completely see the tracks, the tire tracks, especially if a Jeep is parked there? I don't fucking think so.
The trigger event itself was a transition into reverse and then high throttle application. It's a forward motion followed by a lengthy high-speed rear impact or rear motion.
I'm going to move to strike that portion of the answer.
Yes, I'm not going to highlight it. So get the answer again.
Let me ask the question again, Your Honor?
Yes, Mr. Leslie, yes, right. I'll strike the previous answer. Go ahead and ask the question again.
Okay. Do you have an opinion to a reasonable degree of engineering certainty as to the nature of the second triggering event, 1162-2?
Yes.
Could you share your opinion with the jury?
The triggering event was high throttle opening and a transition to reverse. It's a forward motion followed by a higher speed rear motion. And at the end of the trigger event, you're still at 74% throttle.
Do you have an opinion to a reasonable degree of engineering certainty the entire distance captured in that 10-second window during the back maneuver or 1162-2?
Do you have an opinion about it?
Do you have an opinion to a reasonable degree of engineering certainty of
Yes.
the entire distance that is captured in that 10-second window of the second triggering event, 1162-2?
So it obviously only captures what's going on during the trigger. It doesn't capture before or after the trigger.
Understood. Do you have an opinion as to just what is captured as far as the distance?
Yes.
And what is your opinion?
That it's 87 feet. So again, the initial forward motion is 34 feet, followed by crossing the initial point, and then backing up an additional 53 feet.
And finally, regarding this part of your analysis, do you have an opinion to a reasonable degree of engineering certainty as to whether the defendant's Lexus was decelerating, accelerating, or remaining the same at the end of that data captured at the triggering event 1162-2?
It was accelerating at 74% throttle.
In addition to your analysis of the text stream data, one final question. Do you have an opinion to a reasonable degree of engineering certainty the relative time this backing maneuver occurred with the defendant's Lexus that you just spoke about?
Yes.
And could you share with the jury your opinion to a reasonable degree of engineering certainty?
Sure. It matches the window of the cell phone data for Mr. O'Keefe that puts it in front of 34 Fairview. So the backing event occurred somewhere between 12:32:04 and 12:32:12.
Yes,
So I now want to turn to a different part of your study of this case.
Okay.
At some point did you try to determine whether there was an intervening event that could have caused damage to the defendant's right rear taillight separate from a collision at Fairview?
I did.
So the form of the question is to Vernon.
At some point, when you looked at the data and analyzed this case, did you consider including or excluding evidence, or did you analyze evidence to reach a conclusion, including or excluding whether there was an intervening event that caused damage to the defendant's Lexus right rear taillight?
Yes, I did.
When you started your analysis, what information or claim or evidence did you become aware of that you wanted to analyze to include or exclude as the cause of that damage?
Sure. So my approach to this case is three prongs. I'm looking at the download detective information. I'm looking at this backing incident, and then I'm looking at Mr. O'Keefe's injuries and how they relate to the events, potentially. So the second prong, which is looking at this data. So I had a Ring doorbell video showing Miss Reed backing the Lexus out of Mr. O'Keefe's residence at approximately 5 o'clock in the morning. And so we wanted to look at the backing activity and whether that contacting Mr. O'Keefe's vehicle, whether that was sufficient to cause, or what damage it could cause, and particularly was it sufficient to cause damage to the right rear taillight of the Lexus.
When you were asked to engage in the study, were you ever asked to reach a certain conclusion?
Never.
Was there ever any influence other than the data and facts on your analysis?
There's never been influence. The influence, again, it's whatever the data shows.
When you engage in whatever studies you undertook that you'll explain to the jury.
Yes, Joy, that was what he was referring to when he said that. They had mentioned the press coming, and they said, just make sure to tell him the guy never went in the house. And that was Matt McCabe. Yep.
Were you given any direction or limitations on what you could or should do?
No.
When you received the information, did you understand, regardless of the result, it would be provided to everybody?
I guess, generally, yes. I mean, I go through the data, I give you the results, you do with them whatever you see fit.
Okay. And in this case, when you decided to engage in that study, had you had an opportunity to review the Ring video footage from Mr. O'Keefe's home on the morning of January 29th, 2022?
Yes.
Tell us how you went through your study, how you began, and the steps you took forward.
Sure. Probably best on the slides. So one of the things we first did was to get an exemplar Lexus. What does exemplar mean? It just means I got the same exact year, make, and model vehicle as Miss Reed. So Miss Reed's vehicle is on the left-hand side, taken during my inspection. And then I found this exact same year, make, model, manufactured at the same plant, everything Lexus in Texas. So even though it looks like a European plate, it's a Texas plate.
It doesn't look like a European plate. I don't even remember him saying that. What a fucking moron. European plates are long and skinny. Kat says the biggest part about the 911 call, if Jen said officer down, it would not have gone down to Canton. It would have triggered a whole home hornet's nest response. Others don't make a big deal. Exactly. That's why she didn't mention the fact that he was a cop. She didn't even mention his name. She didn't even act like she knew the person when she called 911. There's a man in the snow, passed out in the snow. It's absolutely ridiculous. And then they talk about how much they loved him, how much he was such a good friend. Bullshit. For people who are just witnesses, why go to so many lengths to lie? Good question, Joy. Then, yeah, Joy says, Kat, exactly. Then take it a step further. If it were your friend, would you not be screaming, my friend, oh my God, running into your sister's house? Exactly. See? Great minds think alike. James says she knew she could probably control Canton PD because she knows them. Exactly, you guys. Yep, we're all on the same wavelength here. They didn't even go to his funeral. I know, it's so sick. You know, it's this whole thing just makes you sick.
Purchased the vehicle, had it shipped out to California. So I verified that the Lexus is in fact the one I got, the same exact one as Miss Reed's. These are all the standard equipment. Miss Reed's is on the left.
Because he had to have the same exact everything, including
Lexus
clothes.
TIS, that's Toyota Information Services, the Toyota Information System. So I ran it through TIS, which is the umbrella program under which TechStream runs. I also ran it through My Lexus, which is the Lexus website. And then started about doing what's referred to as a photogrammetric analysis of the video.
Can you explain to us what a photogrammetric, help me with the word, photogrammetric?
Photogrammetric. Doing photogrammetry is a photogrammetric analysis.
What does that mean?
It's just a big fancy word to saying you're looking at data and photographs. And what we're trying to do is take two-dimensional images, say you get from video or photographs, and knowing some information about the photographs and some of the dimensions of things in the image, get or convert it to a three-dimensional space. In other words, be able to get exact three-dimensional measurements out of that two-dimensional image. So I had the video, just to show the provided video that I was given. So Mr. O'Keefe's vehicle. I don't know if you noticed, but there actually is contact between the vehicles. So one of the first things we wanted to do is determine the frame rate, which is how many video frames are played per second. Vehicles. Mr. O'Keefe's vehicle. I don't know if you noticed, but there actually is contact between the vehicles.
If you notice, there actually is contact between the vehicles. Did he seriously just say that as if he never noticed it before? That's how did you guys take that statement the same way I did? Holy crap.
I don't know if you noticed, but there actually is contact between the vehicles.
There actually is contact between the vehicles. Like he thought, oh, I never noticed that before.
So one of the first things we wanted to do is determine the frame rate, which is how many video frames are played per second. Your normal kind of video camera has about 30 frames per second. Your standard movie is 25 frames a second. You know, a modern IMAX is like 60 frames a second. The frame rate of the camera, how many images it shows per second, because video and films are just single images played really fast, so it looks like motion. And so determining the time between each frame tells you how much time occurred. So if we know the time between each frame, and then we can figure out how far the vehicle moved, distance divided by time is speed. So we put it through a couple different programs. This is called AMP5. We got 19 frames a second. This is a specific forensic program called Axon Investigate, 19.8 frames a second. This is a publicly available program called FFMS. Same thing, 19.8 frames a second. Another program, Media Info, 19.8 frames a second. Anyways, 5 different sources,
Well,
getting 19.8 frames a second. So then what we've done is add information now. So now we know how many seconds each frame represents. We now put a clock back in to tie that into time.
I
So
mean,
it's the same exact video, so we have a frame counter now, and we have a time.
It was just a party opportunity for them. Freaking ridiculous. Hey, 420, welcome back.
So we have some information now on the time between each frame. So here's frame 0. This is frame 265. We're 13 seconds into it. Here's frame 305. Notice you see brake lights on the back wall here. Notice how they're not super red because you still have reverse lights on.
Be careful.
Now they all go off.
On the road.
So the Lexus brake lights have been turned off at frame 353. 356. As your brake lights begin to come on. 357, they're back on. Lexus comes to a complete stop at frame 369. 384, the reverse lights turn off. And now look how red this is because we no longer have the white reverse lights in it. And you can see the Lexus starts to drive forward. So frame 825, this is after the Lexus has left the scene. But notice the tracks in the snow. So we have very definitive locations for the wheels of the Lexus. We lay over a grid on the various frames. So we then took the images and did what's called clarification, which is where you overlay images from multiple versions or multiple views of the same vehicle, and it helps sharpen the image, but it slightly dulls the color. So you get a little cleaner, crisper image.
Yes, relax.
So here's Mr. O'Keefe's vehicle before clarification, after clarification. Absolutely. Okay, I'll make an effort. So slide 76. You're welcome. Going to slide 77. We're going to focus in on this area here. So what we will actually show is where the snow was displaced in these 2 spots. Spots right across from here and right across from here. You can focus your attention on those. Slide 77. So slide 78. To bring us all together, we went out to Mr. O'Keefe's residence and took a scan, a laser scan. So you see the laser scanner over here. Laser scanner is right here. Pens hasn't changed position. The camera's changed slight position. We can account for that. So here's the subject video. We have the correct resolution. There's a new camera. It's going slightly faster frame rate. That just means we have different times between frames on the new camera, or we're simply using it for calibration to the old camera. It's the same container for the MP4, and it's using the same video codec. Video codec is how the computer encodes the video. Oh, yes, thank you, Your Honor. Slide 79. Slide 79, part 2. So really, we care most about is the resolution. So slide 80, you can see these are what are called control points. So from the laser scan, we locate these various points. So the 3D scanner knows the exact position of all these points on slide 80 in the image. And so what we can do is use this information in conjunction with the video to create a scaled version of the video. So when we have three-dimensional images or three-dimensional measurements, we can then use that to give us some three-dimensional information from our 2D video. So there's the points on slide 81. Slide 82, excuse me, slide 81, second part, we're basically just fading in. So what you see now, if I go back to the beginning of slide 81, this is the picture from the video camera. And then what you see here is, which is barely any difference, and that's because what we've done is we've now overlaid the points from the laser scan. So now each one of these little speckly points, we know the exact 3D coordinates of those. So we can now know the exact position of all these fence posts, all the positions on the driveway, and we can use that to calibrate on the slide 82. So using that information, it's called solving for the camera. We verify that we have appropriate residuals, meaning we don't have too much error. Slide 83. Okay, subject video.
Have a great night, Kristen. Enjoy
And this is the new, let's see, the subject video with the control points overlaid on it. That's the subject video where we're phasing in the laser scans of the scene, 84. So this is both on slide 84. I'm just toggling between the point cloud and the video. And what I'm trying to illustrate is how well we were able to overlay the point cloud onto the video data. So for example, if you say watch one of these fence post points up here while I toggle between the video, there's a laser scan, there's the video. So we've done a good job. Again, the residuals show that we've done an adequate job of matching the data. Slide 85.
He likes to pat his own back, doesn't he? We did a good job.
So what I'm doing here is toggling between, this is the video of the car. Remember I told you I went out and I inspected Mr. O'Keefe's vehicle and did a laser scan of it? So we're now taking that laser scan of the video, or excuse me, of the vehicle, and overlaying it onto the car in the video. So this is the video image. That's the laser scan laid on top of it. So we know all the dimensions in the laser scan. We know all the dimensions in the scene of this. We have the tire tracks. We can create and take data points along the tire tracks. Create a map of those. So green is the right rear, again, the vehicle's backing out,
just like
coming, slide 87, coming out this direction, backing here, stopping,
horrible.
pulling.
Especially when you realize how
forward.
much money got paid for this
Towards the bottom of the screen.
kindergarten
Backing out here, pulling forward like here. Slide 88.
finger painting project, whatever you
So
want to call
this
it.
is the Lexus lined up. This is when the Lexus has come to a complete stop. This will be maximum engagement. Again, this is just toggling frame 88, showing we have the time and the frame number. 369 on the same slide. We've now overlaid the Lexus laser scans on top of the image of the Lexus. So there's the video image, a still image we took from the video. And here's where we overlay the laser scan of the Lexus. So we've overlaid the laser scan of the Lexus onto the Lexus. We've overlaid the laser scan of the Chevrolet onto the Chevrolet. And we've overlaid the laser scan of the scene onto the scene. So now what that allows us to do, we now know the position of everything in there. And we've also tracked the position of the tire tracks. So that's what it looks like if you overlay the computer model of Mr. Reed's vehicle on the tire tracks.
I have
Oh, my
no
apologies, Your Honor.
idea, Yummy, what he did with
Slide 89,
this.
and then I'm just toggling slide
Spending that
89 where I
much
turn
money
the vehicle off so you can see how the tire positions match up.
to get the
Then
exact.
toggle slide
it's
89,
ridiculous.
how
This
the
whole,
tire
this whole thing is a farce.
positions line up with where the end of the snow was. From all that information, again, we lined it up in the video, we lined it up in the scene, we have the two vehicles, we can get the exact position of the vehicles when that Lexus stopped. So when that Lexus stopped, that's going to be the maximum engagement. So from that information, we can get the angle of the vehicle, we can get the degree of overlap, the impact configuration. And it's hard to see because of the angles and because these vehicles are not at right angles to each other, the exact contact. Now, I mentioned, and we're on slide 94 now, that contact on the rear of the Chevy Traverse. So you can see we actually, and you can't see. So we took a whole bunch of data points within those two areas where the snow got dislodged, and we're looking at where that is. So if you look at that on the vehicle, So this is where it is on the rear of Mr. O'Keefe's Chevrolet. You can see it's about 25 and a half inches above ground, 32 and a half inches above ground. Here's Mr. O'Keefe's vehicle. So these marks are kind of, this is the Chevy Traverse words, are approximately right here. Again, I had the opportunity to inspect Mr. O'Keefe's vehicle. There's no damage where these marks are. So sure, it knocked the snow off, but it wasn't sufficient to cause damage to his vehicle. We then mapped that data onto Miss Reed's vehicle to look at where that height is. So you can see the only contact marks are down at the bumper level. I mentioned how that bumper sticks out. This is exactly where you'd expect it. So the only evidence of contact is nowhere near the upper taillight. I emphasize the word upper taillight because it is right in line with the lower taillight. But yet the lower taillight also was not broken. So again, 25 and a half, that's 24.
Lexus is finally getting auctioned
right here,
next month.
25 and a half. That's 24 right here, 25, 25 and a half. That's right where that scuff mark was. It's also right at, again, the level at the top of that light. This light is not broken. I've looked at the front of it. I've looked at the back of it. I've looked all around it. It's not broken, and it sticks out further than the light above it. So using those positions, matching the overlay of the vehicles, we can get the speeds from that. We know where the Lexus is. We know how much time it is between each frame. So we know how far it moved. And so what we know is that when it first came to a stop, right before that, it was going about 0.7 miles per hour. So realistically, somewhere between a half to 1 mile an hour, just to account for some variations, but definitely going 1 mile an hour or less at impact.
Slide over, please.
Oh, thank you. Slide 99. That's the dimensions. Slide.
Did he just testify that the Lexus was going less than 1 mile an hour when it hit John's car? Do you know how difficult it is to go 1 mile, less than one? Do you know how difficult it is to go 5 miles an hour? And yes, I understand she was backing out. But I hate to tell you, I believe, in my own opinion, so it's my own opinion, that car had to have been going over 1 mile an hour. I just find that hard to believe. Less than 1 mile. Does anyone else feel that way? I just think I don't think that's right. But that's just my opinion. Yeah, I was just gonna say that, Yummy. Yeah, someone donated their time and everything to fix it up. So it's probably like brand new now. But yeah, I mean, whoever buys it's gonna buy it because of, what it was, what it, the popularity of this case is gonna cause someone to buy it. For sure. Well, I think we'll get more about it, not because of the car itself, but what it represents, to be honest with you. I could be wrong, but there are people out there who will spend lots of money for the strangest stuff. And I think the fact that it was Karen's car, it was the focus of this investigation and crazy trials. People will pay for it. This is what I'm saying, James. Some rich collector type will probably buy it. Yep. It's a trophy car now. Yep, exactly. I get that. Joy. I totally get where you're coming from. But people out there they collect some of the weirdest shit. They don't care about the money. They have people out there that have more money than they know what to do with. that buy this kind of stuff. Yeah, I get it. James said he saw a post on Facebook about the auction is coming up. So I don't know. I knew it was going to be auctioned. I hadn't seen anything. I don't really look for it, whether it had been auctioned or not. But James just mentioned he saw a post on Facebook that it's going to be auctioned off next month.
102. Similar to what I said, no damage to that light, no damage to Mr. O'Keefe's traverse in that area. And then if I could, I would like to go back because I realized I skipped over something. So this is slide 85. So this is Mr. O'Keefe's vehicle before contact. I don't know what I'm missing. This slide shows that there was snow here, now there's no snow there.
Dr. Welcher, did you look on the driveway after the touching between the two cars to see if you could see anything on the snow at the back?
Right, Joy?
So referring to this slide,
I'll be your
this is after the Lexus was pulled away.
Can be my internet.
Looking in the snow, I see nothing in the snow.
Sugar
Were you looking
daddy.
for anything in particular?
Of course I was. I was looking for taillight fragments.
We can be
In any of the videos that you have that show
Just send me money.
Mr. O'Keefe's vehicle after the defendant's Lexus touches it, do you ever see any remnants or shards or fragments of taillight on the ground?
I do not.
When you did your analysis and study, trying to include or exclude this touching as the source of damage to the defendant's Lexus rear right taillight, did you consider speed as part of that analysis?
I did.
Did
I
you
consider speed, and then again, knowing we have the positions of the vehicle, we looked at the degree of overlap, and there's only about 2 to 3 millimeters of overlap between the vehicles, which is insufficient to cause the tail light that's recessed in from the edge on the right rear of the Lexus to contact the rear of the Chevrolet.
Considering all the data and analysis that you did you come to a conclusion to a reasonable degree of engineering certainty whether the right rear taillight of Ms. Lee's Lexus was broken or damaged during the contact with Mr. O'Keefe's car at around 5:07 a.m. on January 29, 2022?
That impact did not break or crack that taillight.
Is that your opinion?
That's my opinion.
Is that to a reasonable
X-ray
degree of
thing
engineering
is just
certainty?
That's to a high degree of engineering
absolutely
certainty.
insanity.
You mentioned there were 3 areas of study, and we've been through 2.
Correct.
Could you tell us what you focused on your 3rd area of study?
Sorry, shut up, Spanky. Because yeah, the fact that they kept saying they didn't have X-rays, I thought, who the fuck does an autopsy without X-rays to see if there are bones broken, especially knowing that they were looking at this possibly being a homicide and possibly someone being hit by a car. Don't tell me they didn't do X-rays. I remember hearing that the first time and I was like, what the fuck? And then finding out all this time they did have the fucking X-rays. Bullshit. Right? I said that too. I've said that a million times, Kat, where when they showed that when they showed the dash cam, I can't remember which cop car it was from, of them pulling up at Mr. and Mrs. Reed's home to get the car, and I said exactly that. Like, how do you not take pictures of supposed evidence before you put it on a record and send it off on a tow truck to be driven how far in a snowstorm where there could be an accident and more damage to that car? I mean, even if there wasn't snow on the ground and dangerous driving conditions, who doesn't take crime scene photos or evidence photos before taking it anywhere else? The stupidest shit in the world. Yeah, Jane says it's scheduled to be auctioned next month. Joy, it's already 87 degrees here and it's not even May. Oh, I just had to turn my air on. It was getting too hot in here. And it's only I think it's 69 degrees here. Oh, I just saw this. Sorry. James says Bruins lost 6-1. Oh. You know, I asked the same question, Kat. I would love to hear from the tow truck driver for sure. No, I can't get this to start playing. Hold on, sorry.
Regarding this case.
So the third area of study, I'm now focusing in on the injuries, the at scene, physical evidence, taillight fragments, broken glass, things of that nature.
Okay. And when you conducted your studies and reached conclusions, did you, in your PowerPoint, provide slides to help explain your process and inevitably your conclusions?
Yes, sir.
You can take us through the third section of your efforts regarding this case, specifically your efforts to identify the different pieces of evidence and your conclusions about a collision in this case.
Absolutely. Slide 104.
Please.
So this is a...
Is this 105, Dr. Welcher?
I'm sorry, 105. Yes, sorry. Slide 105. This is a picture of Mr. O'Keefe's right arm, forearm, hand, and wrist. In anatomy, your arm is defined from your shoulder to your elbow, and then from your elbow to your wrist is your forearm, and then this is your hand. So technically, when you say arm, it really means from your elbow to your shoulder. Most people call this whole thing arm. It's actually the upper extremity. Arm is from shoulder to elbow to wrist is forearm and hand. So you can see I wrote arm and forearm. So arm, elbow to shoulder, elbow to wrist is forearm. So looking at the injuries to Mr. O'Keefe's arm, forearm, as well as his hand. So this is me. I'm actually 6 feet, half an inch tall. What you see in the upper right is the coroner's examination report for Mr. O'Keefe. He's 73 inches tall. That's 6 feet, 1 inch tall. At this time, I was 220 pounds. Mr. O'Keefe, at the time of this incident, was 216 pounds. So I took measurements of myself. I'm actually wearing the same make and size shoes as Mr. O'Keefe, the same brand of jeans as Mr. O'Keefe, the same brand and size shirt of Mr. O'Keefe. You see the Lexus in the background. We have matched the height to the Lexus. What I'm showing here is both my height, and then keep in mind where the height of this wing is relative to my right eye. So now I'm wearing, in addition, same shirt and shoes, same type of sweatshirt, and actually the same kind of baseball hat. We tried to determine the exact glass from the Waterfall Grill. Found out they were getting different ones at different times, but I ordered my glass from the same distributor that Waterfall Grill ordered their glasses from. So you can see in my right hand here, I have a glass. Here's a glass. It looks similar. It's from the same location. And then in the lower right photograph, what I've done is I've rolled up my sleeve, taken the sweatshirt off, and I'm going to look at how this contact pattern lines up. So the first set of slides, I'm simply standing next to the Lexus. We know we have a broken taillight. We know how to have scratches on Mr. O'Keefe's arm. I'm seeing how those may or may not relate to the height and position of the taillight.
Dr. Welcher, if you could back up one slide, I have a question for you. In the middle photograph, at the top of the Lexus, there's like a rim. What do you call that?
I call it a wind wing. I mean, it could be a wing.
Okay, thank you.
Air dam.
It's a boiler, you moron. Or according to Tuesday,
So,
it's a boiler.
like I said, about to do a little bit of testing with Lexus. The first test you're going to see is me just walking backwards or actually sideways into the Lexus. What I've done is I've painted the Lexus right rear taillight with what's called grease paint, and sort of like paint, but it doesn't dry. And then I have backed up sideways, side shuffled into the Lexus with my arm out, see what the damage pattern looks like, or basically where someone of Mr. O'Keefe's height's arm would contact the rear taillight. So then what you see is I've shown the photographs again. I show the paint transfer onto my arm. The yellow grease paint on my hand goes to show where my hand will hit the taillight. And so just kind of me walking slowly sideways into it, the approximate location of the taillight, and I'll line it up with the broken taillight in a second, lines up with the approximate location of the lacerations on Mr. O'Keefe's arm.
Dr. Welcher, let me ask you a question. When you're engaging in these demonstrations, are you attempting to try to show exactly how Mr. O'Keefe was struck?
No. So we don't know exactly how he was struck. And pedestrian impacts are extremely sensitive to exact angles. And so where exactly your foot is, whether your foot's off the ground, can have an effect on where you end up after that. We just don't have enough information in this case to determine all that information. We know the taillight was broken. We know the glass was broken. We know we have damage to the rear of the Lexus. We know we have lacerations in Mr. O'Keefe's arm. So I'm trying to see if there's any correlation between all those.
Well, can body posture on a clip or side slight collision change the trajectory or the injury?
Of course.
Can the way somebody moves or reacts before impact change it? What are other things that can change the trajectory of the person and the injuries?
So for example, if you get hit and knocked off balance or clipped and knocked off balance, you can take additional steps that will affect how far your body travels. If you have one foot on the ground versus the other foot on the ground, affects how the body rotates. If your arm is at 90 degrees or 85 degrees, will affect the kinematics. We attempted to model different possibilities, and we're getting results that were all over the map. Small changes in the pedestrian position give you huge change in the output. And so from the tech stream data, we don't know exactly when in the tech stream data he was hit. So we don't even know the exact impact speed. In most pedestrian reconstructions, you typically have a point where the impact occurred, like where the person was, like in the crosswalk, for example, and they get hit and entirely a rubber spot. That's called area of impact or point of impact. You then can look at how far they were thrown and using some laws of physics, calculate how fast the car had to be going. Well, we don't have that in this case. We don't know exactly where Mr. O'Keefe was on the roadway when this happened. Sorry, I'm about to go to the next slide.
Without having an exact point of impact or an exact speed or an exact body position, are you able to specifically replicate the actual collision in the way Mr. O'Keefe's body would move?
Exactly replicate? No. And again, in terms of how he would move, again, we don't know where exactly on the roadway he started. So in terms of how he moved, that's a function of where he started. We don't know if when he was clipped, he took an additional step before falling backwards. So that will change how far you are off the roadway. So the impact, which you'll see in a second, even at 2 miles an hour, will induce rotation of the body. So depending on the speed, the higher the speed, the more rotation. So if I may, so slide 111, this is simply showing where I walk sideways, how this lines up with the location of lacerations on Mr. O'Keefe's arm.
400.
Here's the post-contact scuffing on the taillight. Here's a picture of Miss Reed's vehicle on the right-hand side. So now I said, okay, that was me walking into the car. Let's have the car drive into me. I did this at very low speeds, and you'll see, and we'll show this from 2 different angles. That's me showing I'm doing test 2. This is from a camera that we have pointing down at it. This is the speed. The speed's only about a 2 mile an hour impact. But even a 2 mile an hour impact redirects me back and causes me to rotate and take a step.
He was a ballet dancer doing pirouettes and shit.
And what slide is this? I think I just can't see it. What slide is this?
114.
Thank you.
You're welcome. One moment, Dr. Welcher. When you were showing us this video, you walked to the side of the passenger side of the car, didn't you?
I did.
And why did you do that?
I was discussing with them what to do.
You were discussing with who what to do?
The driver.
But in no way were you trying to imitate or give a demonstration of what you believed Mr. O'Keefe's movements to be.
Oh, no. This speed's just 2 miles an hour. I was having a discussion with the driver about what we need to do to conduct the test.
Then
So when you walked up to the passenger side, it wasn't to replicate a study or movement.
No, that walking had nothing to do with this case except for me instructing the driver what to do.
Thank you for that clarification.
Sorry about that.
No apology necessary. Could you go back to the beginning when you were explaining this so we can go through it?
So this is the dynamic test 2. So again, this is the
absolute
view from behind.
insanity.
Just to avoid the confusion, I will start it here.
What speed is the car traveling?
This is what I'm saying.
You can
There's
see it.
$400,000 for a
About 2
kindergarten
miles an hour.
experiment.
Excuse me, Your Honor, that is the objection that we spoke about.
Oh, okay. All right, so that's noted, Mr. Lessing.
So similar to the other tests, this is the post-contact image of the transfers onto my arm. Actually, the yellow paint you can see from my hand is here. This is from the arm and forearm. Here's the paint transfer pattern.
And that slide number,
I'm
Dr.
sorry,
Welcher?
I'm terrible with that.
That's
Slide
okay.
116 now. It was 115.
Thank you.
Slide 116.
Older
What
man.
I've done is I've taken these yellow lines to show the
The new one.
extension of the components on the rear of the exemplar Lexus. Then I've done this extension of those same components on the rear of Miss Reed's Lexus and shown how the approximate location of the fractures in the taillight match up with the approximate location of the contact of the arm onto the taillight.
Dr. Welcher, do you have any
Third trial.
indication of how Mr. O'Keefe's arm was bent, what angle it was bent at?
Not exactly, but for these to be taillight shard fragments, they would need to be in the area of the taillight, but it could be further up. We know from the police photographs that there was a damage to the rear body panel in the area I'm searching here. So it's possible his arm was a little higher up and the glass hit the rear of the Lexus and caused that damage.
In the bottom right,
Excuse me, Your Honor, objection.
I will strike that last part about the glass.
Thank you, Your Honor.
the purpose of the circle is for what, Dr. Welcher?
To show, in this case, primarily the location of the lacerations up on the arm, the upper part of the arm, and that they match up with the locations of at least the one remaining shard in the rear taillight of Miss Reed's Lexus.
Looking at the picture of the Lexus bottom right middle,
Oh, they
are
match.
there any marks on the Lexus itself that you took note of?
Yes, it's on the next slide.
Thank you.
Actually, it's
Because you
two slides.
forced it there. You
So there,
moron.
again, this is the evidence marker. There was a horizontal scuff. We know Mr. O'Keefe had blue jean type pants on. There's a scuff in the area that would approximately correspond to hip level for Mr. O'Keefe.
And next slide, please.
Yes, ma'am, 118.
We all love humor here, right, Joy?
Did you describe what you saw on the bottom right-hand corner photo as well?
I believe, yes, I did. That's the scuff that lines up with the approximate height of Mr. O'Keefe's right hip. So then I included previous image that you've seen, slide 119, with the reconstructed photograph of the rear taillight, showing where some of the fragments are. You can see where those fragments are relative to the curvature of the taillight. They'd be in the area somewhat centered within the region of the two yellow lines on slide 119.
Is there anything about the photograph in the top right-hand corner that's important? If so, could you zoom in and show us?
So again, it's showing that this is when it's, I believe, in the Sally Port at the police station, showing that scuff on the right rear body panel.
Did you see any similar stuffs in the middle back of the car?
Objection, Your Honor.
Sustained.
Did you see anything notable as far as damage to the middle back of this Lexus?
The middle,
Yes,
like back where the doors are,
but with the middle of the back of the car, did you see any similar damage to the middle? or
there
the
were
left?
scuff marks that ran along the bumper.
Okay, continue, please.
So this is showing his jacket he was wearing, that the puncture marks coincide to the marks on his arm. This is from the autopsy report. A couple things it notes: a 0.5 centimeter abrasion on his right lateral knee. He's got a laceration on his right eyelid. That corresponds to the height of that thin rear wind wing on the back of the Lexus.
No, I'm going to object.
Sustained.
Thank you.
How tall was Mr. O'Keefe?
73 inches tall, 6'1".
And how high was that wing from the ground on the back of the Lexus?
It was about it's about 5 feet 11 inches, maybe 5 feet 10 and a half.
Thank you.
You're welcome.
Did you notice anything about Mr. O'Keefe's right knee?
I noticed there was a 0.5 centimeter abrasion on the right lateral knee.
Did you note how high from his foot that bruise was on his knee?
We don't know the exact length of his knee. The abrasion appears to be right here at knee level. If you go back and look at where my knee is, that would be at the approximate level of the bumper.
And could you focus in on the bumper to show it relative to the height of your knee?
Sure. Oops. So my knee is approximately right here. This is where the bumper is. To the side of Mr. O'Keefe's knee would be in this general area.
Okay, thank you.
You're welcome.
Sir, do you have an opinion to a reasonable degree of engineering certainty about the lacerations on Mr. O'Keefe's right arm and forearm regarding its orientation relative to the broken taillight on the defendant's Lexus.
Yes, no, may I read my report, my opinion? Okay. The location and orientation of the laceration on John O'Keefe's right forearm and arm are consistent with the geometry and orientation of the right taillight of the Reed 2021 Lexus LX 570.
After considering these three different subjects that we discussed, the tech stream data, analyzing the touching between the defendant's Lexus and Mr. O'Keefe's car, and then your demonstrations regarding the injury to Mr. O'Keefe's right arm, did you consider further evidence in reaching any conclusions as an accident reconstructionist
I'm going through the papers
and a
right next to the
biomechanical
microphone.
engineer?
Yes, I did.
Could you turn us to slide 124, please?
So this is some of the location of the physical evidence. Red plastic, clear plastic.
Oh,
there-
okay, hold
This point of
on.
rest was indicated to be
Speaking of that, I forgot to send Malin my phone number. But Malin, if you can Discord DM me your phone number, I can send you all, you, Joy, and Hippie Chick, a group text that we can start for Friday. Because I can't wait to hear Joy's idea. Nefarious. How are you?
7 feet off the roadway. There was a sneaker that was found near the curb. There were various fragments of the taillight
Have a good dinner.
found in the snow on the morning of the incident, actually the afternoon of the incident.
Could you zoom in on those photos so that we can see the dates?
The date?
Yes.
Oh, sure. So January 29th at 5:46 p.m. This one's at 5:52. One's at 5:59. This one down here is at 5:46. So there were various fragments of the taillight that were ultimately pieced back together and determined to be from Miss Reed's right rear taillight. Additional evidence was found. This is taken on the afternoon of the accident, again around 5:50 p.m.
Could you zoom in, please, for us?
Sure. So what you see here was later identified as Mr. O'Keefe's right shoe.
And the slide number, Dr. Welcher?
Yes, ma'am. 127.
Oh, Jeannie Lynn, you in trouble?
January 29th at 5:50 p.m.
You come here
So
and
a
put that thing
series
in
of
my head
photographs.
again.
Again, you can see on the
Take your butt.
right-hand photograph that this is the roadway. This is the curb. The grass will be up towards the top of the right image on slide 127. The shoe was found, up against in the roadway, up against the edge of the curb.
Okay,
Baseball
thanks,
hat.
Malin. I'll send you a text after
Again,
I'm done
acquired
streaming.
a
All of you
same
guys.
baseball hat. Baseball hat was also found in the snow. You can see.
I want you, before you move ahead, the baseball hat, could you give us a close-up view and also the date
Jeannie
and time?
Lynn.
So that's where it's buried in the snow.
Ass whooped.
These were taken on February 3rd. I'm not sure what time it was.
If that song is stuck
There was
in my
also
head now,
red liquid
I'm gonna
identified. I believe indicated to be blood in the snow as well.
be in trouble.
I'm going to sustain that objection and strike the last part of it. There's no need to come to side part, right?
Just describe the color of what you saw rather than what it was.
There was red coloration in the snow.
And could you give us that date if it's different than February 3rd?
I thought that was February 3rd as well.
Is there a
Oh,
date on the
Malin, you're
photograph
going to be in trouble too.
No, I
Seriously.
don't see one.
Okay.
Song, every time I hear it, or even
Do you know
like
if those photos were taken
see
by
it in my
the police
head
department?
because someone puts the lyrics
Do you know when
in
exactly
my-
those photos were taken?
in my
No, except I haven't dated as February 3rd.
stuck in my
But I think that
head.
may just be the baseball hat photos.
Okay, can you continue?
Then we have photos of a broken glass surrounded by red marks in the snow.
Continue, please.
This, by the way, is the flagpole.
And that slide number, please, Dr.
Yes, ma'am. 129. Slide 130.
Yeah,
Can you enlarge that?
Joy,
Explain to us what that is.
I'm just talking over this a-hole, so I'll pause it for a second. Joy, I have Joy's phone number. We've been texting already. Malin just sent me her number. I have Hippie Chick's number. So what I'm going to do is start a group text with all three of you and go from there. And I will send you guys that start to the group text as soon as I'm done streaming.
Sure. So at the bottom, it indicates where it's from. So this was from a presentation I gave looking at pedestrian injury biomechanics back in 2005. And what it's showing is what are the most common injuries in pedestrian impacts. So what it shows is head injuries are the most common injury in pedestrian impacts. So on the right-hand side, it's all injuries. You can see of all the individual study, the highest prevalence or highest or most common injury was head injuries. In those that sustained severe life-threatening injuries, again, the highest was also head injuries. So head injuries are very commonly associated with pedestrian impacts. This is anatomical drawings just to help you understand the anatomy. The middle section here is from Mr. O'Keefe's autopsy report. The lower right diagram, the green line represents the fracture lines, predominantly here, at least in the base of the skull. So in the biomechanical and forensics just means the legal related scientific industry, there's something called hat brim line or hat line analysis. And what it is it's looking at where the hat line you can imagine is where the brim of a hat would be. And what it is, it's literature that's looking at where head injuries from falls commonly occur.
I'm going to strike that. I'm going to strike that. Yes, yes.
Thank you, Your Honor.
So that was slide 131.
No, that was 132.
Oh my God, so I can't wait to hear it. Oh, I'm so excited.
Do not take that into consideration.
So Joyce, when I strike something.
Cat says, don't group text. Tell him the guy never came in the house.
So I need to go past that slide.
Okay, let me go past it.
This is the next slide.
Okay, if you can continue.
Sure. So I provided peer-reviewed scientific literature that looked at a metric where they were publishing research trying to delineate falls versus blows or assaults. And so this metric is in that scientific literature. They looked at a total of 400 different events, 235 falls, 165 assaults. And so you can see where it says mandible. So mandible is your lower jaw.
Can you enlarge that a little bit, please?
Your Honor, pardon the interruption. I'm moving to strike.
Yeah, let's take that slide down. I'm going to see you inside, please.
Dr. Welcher, if you could return to slide 132. Actually, 133, Dr.
Welcher. Is that me or 132 or 133?
133, please. The next one after that.
So we did skip over 132.
We skipped over that one as well. Keep going. There we go. You can enlarge that just a little bit for us.
Sure.
Now you mentioned that there were studies that talk about guiding the difference between mental injuries.
Correct.
Explain that.
Sure. So I gave 3 papers and someone's dissertation on this issue. They were creating a analysis methodology to differentiate whether the nature and pattern of injuries are more consistent with a fall or more consistent with an assault, or they're calling it blows.
Could you walk us through this chart, please?
Sure. So this is their flow chart in terms of their assessment. So it starts at the very top. You can see they analyze a total of 400 events, 235 falls, 165 blows or assaults. So what you do is you ask yourself on the first set of arrows, you look at the mandible, the jaw. And MRS, as you can see at the bottom down here, refers to a simple fracture or multiple fractures. A is no fracture. Mr. O'Keefe has no mandible fracture. So that means we go down this row. It then looks at all facial fractures. So these are the bones that constitute the face. So if you have a facial fracture, you go to your left. If you have no facial fracture, you go to the right. So if you have some event, no mandible fracture, no facial fracture, what they've indicated that is predominantly associated with falls and not assaults.
Thank you.
You're welcome.
In addition, did you do any further study on the force of a person falling back and landing on their head?
Oops, I did. So what I did was I did what called drop test. I took an anthropomorphic test device, ATD, which is just a fancy name for a crash test dummy, and dropped it backwards onto a hard surface to look at what happens if you were to say fall backwards and hit your head onto a hard surface. So on this particular photograph of Mr. O'Keefe in the upper left, there's noted to be abrasions above the fracture line in the area. You can't see that at all. You can see noted to be abrasions right here. Your Honor, I thought a hat. That was the one I used in my testing. May I put it on and demonstrate something?
Can I put on the hat that I bought? That's exactly like Tom.
Okay. So I will show you the dummy test I did. Watch when the shoulders hit the ground and the head hits the ground. It creates kind of an arc path that will drag and slide objects up the head. So if you have something such as a baseball hat, it'll cause it to drag across the scalp, dragging it up to a similar location to where these abrasions are. So here's the testing. Again, this is a crash test dummy you see on television. This is myself. You're giving me similar instructions, telling me what we're going to do.
That's not going to happen.
So watch. Shoulders come in, then the head contacts the ground.
Great
what you see is if you fall backwards and land on a very hard surface or hard surface, you'll get extremely high loads on the head. If you compare that to data in the science, yeah. Oh, sure. This chart up here? Right. Absolutely. So this is actually kind of a famous study that was published, one of the first studies looking at head fracture or skull fracture tolerances. So what you see, the portion at the back of your skull is called the occiput bone. So that bone, if you put your hand in the back of your head, is your occiput. So we're looking at occiput impacts. And what you can see is that when they took cadaver skulls and dropped them from as low as 40 inches onto a hard surface, they were getting...
Oh my God, I do not remember that, okay? He has the word right there, occipital. It's not like it's not pronounced exactly like it looks. And most people don't even need to take a medical class to know that's your occipital bone, okay? And what did he just call it? Occipital? I'm sorry, but that right there just shows you this guy knows nothing about what he's talking about.
Linear fractures, and you can see even at 40 inches, there's called a stellate fracture. Stellate means star-like. You get a fracture that goes out like a star. So even at a 40-inch drop height, you have sufficient force when landing on a hard surface to cause skull fracture and a level 3 type skull fracture. So Mr. O'Keefe, again, is 73 inches tall. His occiput is about 4.6 inches down from the top of his skull. That means it would fall a total of about
occipital.
73 minus 5 would be 68.
Oh my God.
So just under 6 feet. So 72, 4 inches under, so 5 foot, 8 inches is the fall height. What is data showing that even at a fall height as low as 40 inches onto a hard surface, you can get fairly severe skull fractures.
Thank you, Dr. Welcher. Regarding your third part of your analysis, did you come to a conclusion to a reasonable degree of engineering uncertainty whether or not the defendant's Lexus collided with Mr. John O'Keefe on the evening of January 29th, 2022, around 12:32 a.m.?
Yes.
Before you give me your opinion, I'd like you to share with the jury what that opinion is based on.
Sure. So based on the 130 slides you've seen, based on my personal inspection of the Lexus, the correlation of the text stream data with the infotainment data, as well as Mr. O'Keefe's cell phone data, it's looking at, I guess, where the taillight wasn't broken.
We don't know
It's
nothing.
looking at the physical evidence at the scene in terms of taillight fragments, glass fragments, red color in the snow.
Good movie.
We have the cell phone data, the location and position of the arm lacerations, the air temperature at the time indicative of sufficient to freeze, the location of the fracture on the back of his head relative to the scientific literature, my testing of forces available falling onto a hard surface, published science on the fracture forces associated with falls. I'm sorry, I'm reading from the report. I'm reading from my report.
Can you answer without reading from the report?
Probably it's more complete if I read my report.
The objection, Mr.
That's
Wilson?
not the point.
This question, reading from a report to this question.
So,
You can't read from a report to answer the
Okay,
question.
Dr. Welcher, let me ask you again. Based on your analysis, data available reviews, study, based on the fact that you are an accident reconstructionist and a biomedical engineer, have you reached an opinion to a reasonable degree of engineering certainty whether the defendant's Lexus struck Mr. John O'Keefe on January 29th,
I find it
2022,
funny
around
that they have to
12:32
call it
a.m.?
engineering
Yes.
And could you
certainty, not
share the basis
scientific
of
certainty.
your opinion before I ask you your ultimate opinion?
I bet you that was
You've seen my slide presentation.
sidebars.
I've inspected the Lexus. I've looked at where it wasn't damaged. I've inspected the taillight. I got an exemplar Lexus. I ran lower speed contacts to verify that the injury pattern and location on the arm is consistent with the height and orientation of the taillight. I have looked at fracture tolerance data for falling backwards onto hard surfaces. I've looked at the metrics of where his injuries were and what injuries he didn't sustain. I've looked at the cell phone data, and then I've looked at Ms. Reed's interviews as well.
Based on all the evidence you considered,
We'll
could
send
you share
it
with the jury
back
what your
to
opinion is to a reasonable
the
degree of engineering
father-in-law,
certainty
Susan.
about whether the defendant's Lexus struck Mr. O'Keefe on January 29, 2022, around 12:32 a.m.?
Yes, based on the totality of the evidence, DNA, everything I talked about, that is consistent with that happening. With a reasonable degree of scientific certainty, that is what happened.
He said scientific. See, that had to have been discussed in sidebars. Especially how quickly Alan Jackson stood up or left.
Independent research or investigation into this case. If you happen to see, hear, or read anything about this case, please disregard it and let us know. We'll be very careful with social media.
Right. Dr. Welcher can step down. I know he has to come back and have his.
So just leave everything here.
And then you'll come back in 5 minutes. All right. Yes, please.
That's why they had to use the
All right. So, Mr. Leslie, I will hear you as to your objection.
engineering certainty instead of scientific.
Right there is fine, and let's try and wrap this all up by 4 because I've already heard you at sidebar. That means both of you will hear from within the next 5 minutes. Go ahead, Mr. Leslie.
Thank you, Your Honor. The point number 1 is the question of whether, based on each degree of scientific or certainty, he has an opinion whether a collision occurred. I'm going to give a dramatic and accurate example that happens in court all the time. So, by analogy, if the issue is whether or not a defendant has stabbed an individual and caused a certain death, that is the ultimate question for the jury. That question is never permissible in a trial. By analogy, this is the exact analogous situation. The question of whether there was a collision is the ultimate question for the jury. That is why we are having this trial. The defense strongly asserts there was no collision, and there is substantial evidence to that. We are going to cross-examine Dr. Welcher. We are going to put in our own strong case to demonstrate no collision occurred. That's no surprise. It was in our opening statement. This witness cannot, by precedent for years, opine on the ultimate question that is going to the jury. I accept, subject to evidentiary issues, the two questions that a biometricist always answers in these situations. Is the damage to the vehicle consistent with a pedestrian hitting the vehicle? And are the injuries to the individual consistent with being hit by a motor vehicle? Those are the questions that are permissible, not the collision question. It is resoundingly improper in this trial, in any trial, where that is the ultimate conclusion for the jury. Yes, an expert can offer,
but Hanky
but every
knew
expert
better
is
and
bounded
did it
by
anyway.
the extent of their opinion, and that opinion on whether there was a collision would invade the province of the jury and the whole purpose why we are here, Your Honor.
All right, Mr. Brennan.
So what Mr. Lisi is arguing is that in their opening statement, they repeatedly invaded the province of the jury because they must have asserted vehemently over and over again there was no collision, over and over and over again. And he just told you that when his expert case stands, they'll have abundant evidence that there was no collision. This case is about the collision, but that is not the ultimate issue. The ultimate issue is manslaughter or mens rea for second-degree murder, not collision. They don't get to define the prosecution's case. They do not get to define or limit the prosecution's opinions. They have no case law. They have no study. They have no jurisdiction or jurisprudence to say what we are limited to. He's entitled to an opinion. His opinion is not limited to whether or not the defendant struck Mr. O'Keefe. That evidence is obvious. It's not whether or not there's damage to the car or Lexus. That evidence is obvious. He also, as an enormous part of a biomedical engineer and accident reconstructionist, he studied the tech stream data. They didn't, he did. And he's entitled to give an opinion. The tech stream data, based on fact and science and data, tells us when, if you put it together with other evidence, and where, when you contribute it with other evidence, this collision actually occurred. We don't have to play peekaboo, close our eyes to the reality of the fact that the evidence supports the conclusion to a reasonable degree of engineering certainty that the defendant struck Mr. O'Keefe with her Lexus in front of Fairview Road. I am not interjecting the defendant. I always refer to her car, so it is sanitized, her Lexus. I've been careful about that. I don't have to, but I'm very careful about it. He is relying on the test stream data. The physical evidence is independent studies. He is allowed to have an opinion about whether the injuries are consistent with the damage to the car, whether the damage to the car is consistent with the injury to Mr. O'Keefe, and he's also allowed to answer, in his opinion, the issue of a collision. Putting aside the fact that that was emphasized and repeated in the opening statement, and it's going to happen again when other people testify. It's not our fault that ARCA didn't testify or look into the tech stream data, or they don't have an expert for it. It doesn't belittle or limit that evidence. We expect to ask Dr. Welcher, does he have an opinion to a reasonable degree of engineering certainty whether the defendant's Lexus collided with Mr. O'Keefe on January 29, 2022, around 12:32 a.m. That is one of the opinions we're going to ask him. Nothing to do with the ultimate opinion of guilt or innocence, or whether it's manslaughter or there's mens rea for second-degree murder.
And what was your second? You said that's one of the opinions you're going to ask him. What else?
I will also ask him about the consistent with, whether the injuries are consistent with.
Oh, Jeannie, I hate when that happens.
I'm going to ask him after this part about the difference between a clip or a side swipe as opposed to a full-on
lots of water and juice.
From a front or back of a bumper, and there are further slides to emphasize that point. And so there'll be an opinion regarding that as well.
And you
see with a side swipe or a clip.
Okay, so this is not the end of Dr. Welcher's testimony. It's just moving on to another area.
It's close, but it's not the end.
Okay, go ahead. Yeah.
Your Honor, here's the case. Attorney Brennan said the case here is Commonwealth v. Coleman, 366 Mass 705.
and it stands as a proposition exactly that I articulated. I won't repeat it. Secondly, Your Honor, we practice what we preach. I have the ARCA report right in front of me, and I have the report.
Is that a new one or is that
This is the new one.
Okay.
It's also, the old one is the same. So either one is the same. They do not, Mr. Brennan incorrectly said what our experts are going to do. I don't know why he did that, because he has these in writing. Neither Dr. Wolf or Dr. Rensler talk about a collision or conclusion. It's consistency. So there's two questions I said in sidebar. And for reference, Your Honor, the most recent is page 15. There is no.
I don't have that report, so I'd like a copy of that report.
I also, Your Honor, refer Your Honor to ARCA's existing report, which I'm going to do from memory. I think it's February of 2024 that was done for the U.S. Department of Justice and FBI, where they basically said they gave opinions on those two items I spoke to you in sidebar. So Attorney Brennan is incorrect when he says what our experts are going to say or not. We've already committed in writing to what they're going to say. We're consistent. We practice what we preach.
All right, so we will discuss this tomorrow before we start. I'll tell you my ruling tomorrow before we start. I need to go back and see what exactly came in to evidence today. All right, so I'll see you in the morning.
All right.
All right, guys. I want to just see before I end for today. I want to see, because I thought this was broken up by direct and read or cross-examination, which isn't. Hold on. So it looks like we got direct conclude. Okay, yeah, we got 16 minutes for the end of direct. So let's finish direct and we'll start tomorrow with cross-examination. So here we go.
All right. Good morning, everybody. All
All
right, so
I can't stand it too bad.
Dr. Welcher can testify that the data he downloaded and analyzed
hate
and the
buyers.
damage to the Lexus is consistent with Ms. Reed's vehicle being in a collision on January 29th at 12:32 a.m. because he's a qualified expert and his opinion is based on reliable methodology appropriately applied. In addition, Dr. Welcher can testify that Mr. O'Keefe's injuries are consistent with his having been struck by a Lexus that is physically identical to Ms. Reed's Lexus, because this opinion is based upon, among other things, his experimental work that came into evidence without objection as to scientific methodology and application. However, he may not testify that Ms. Reed's Lexus collided with Mr. O'Keefe because that conclusion is not based on the application of reliable scientific methodology. The problem here is not that the opinion concerns the ultimate issue, because in Massachusetts, that's not a bar to admissibility. Rather, it is that Dr. Welcher, the expert, is drawing an inference based upon more than scientific method. His opinions set the stage for argument and a permissible inference to be drawn by jurors through the application of their sound judgment to the opinions that they find credible. But the jurors are as well positioned to draw or reject the inference as is the expert. That is, the inference is not compelled by the application of any scientific method. So that's the ruling. All right, so the jurors are lining up. We should have them momentarily.
Thank you for the late compliment.
Okay.
I must have missed that. I don't remember seeing that part.
Morning, Dr. Welcher.
Good morning.
When we left off yesterday, I was asking you about some of your opinions. I'm going to ask you those questions again, but before we do, I'm going to ask you two other questions. The first is, I'd ask you to turn to your PowerPoint, slide 110.
You want me to display it?
Please.
That's a great
We'll ask you a question about
idea.
a series of your
Yeah,
slides
Randall?
regarding this effort. This is 110. Could you also follow through to 111, 12, 13, 14, 15?
You want me to play the videos?
You don't need to play the video. They just want to acquaint you for the question.
111,
12,
112, 113, 114, 115.
I'm
How many
always
times did
playing
you
on my
engage in
phone,
testing where
playing
your
games or something to keep
arm and
myself
forearm
busy when I'm
touched the
doing.
rear right of
I
the
love that idea.
exemplar Lexus?
3 times.
In any of those 3 times, did it ever leave any paint on the underside of your arm or forearm?
No.
If you could turn to slide 130, please. What? Could you go back one, please? Perhaps it's 131, Dr. Welcher. There we go. Could you explain the significance of this slide, please?
Your Honor, this is.
Oh, can you take that down, Dr. Welcher? We're going to move forward. Yesterday, when we left off, I'd asked you.
So we need to take this.
Card.
You can take the PowerPoint down,
That
please.
was in a different spot on this thing. Hold on a second.
Thank you. So I'd asked you yesterday about some of your opinions. I want to ask you about some of your opinions relative to that last effort that you made regarding testing between the Lexus and your arm.
Correct.
I didn't know
mentioned
you had
earlier
a
on in
channel
your
until
testimony
you
that you
told
reviewed
me, so I'm
a
going
number
to
of
put it up
pieces of
now.
information
Have you started
and offer
it
that
or
you
you're
rely on
going
some
to
of those
start
pieces for
it?
your opinion. Can you share with us, from this part of your analysis, what pieces of evidence or information did you rely on for the opinions I'm going to ask you?
Relative to the testing on the arm contact on the taillight?
Yes.
So it was the physical evidence at the scene, the photographs of Miss Reed's vehicle, to a certain extent, my analysis of the Ring doorbell and the One Meadows event, the nature and the no, I am counting on my finger. So I am counting on my finger. The Ring video doorbell, Mr. O'Keefe's height, the type of shoes he's wearing because I need the same type of shoes. My exemplar inspection where I matched up the heights, the locations of the lacerations,
Oh my
and then the
God.
text stream data as well.
That information that you considered, in addition to the text stream data you consider, considering both those areas of information, do you have an opinion to a reasonable degree of engineering certainty in whether the damage to the defendant's Lexus is consistent with a collision with Mr. John O'Keefe on January 29th, 2022 at around 12:32 a.m.?
So there's been two potential theories that I've seen on that issue. One is a glass was thrown at the rear of the vehicle and shattered it. The second one was an impact to the arm. If the impact is basically more than approximately 8 miles an hour, it will likely break the taillight lens.
And do you have an opinion whether, based on the data and based on the physical damage and your testing, whether that is consistent with a collision or an impact with Mr. John O'Keefe?
It is consistent with a collision as long as it's greater than approximately 8 miles an hour.
Do you have an opinion whether it's consistent with an impact or collision with Mr. John O'Keefe on January 29, 2022 at around 12:32 a.m.?
With that caveat, yes.
In your testing, did you consider, or do you have an opinion to a reasonable degree of engineering certainty,
And shattered his
whether
arm.
John O'Keefe's injuries on his arm, and that in the back of his head, are consistent with being struck by a Lexus identical to the defendant's Lexus on January 29, 2022?
Yes.
What's your opinion?
That it is. It is
No.
consistent with being struck by a Lexus and ultimately contacting a hard surface such as frozen ground.
This guy's such
And
a
is that specifically
moron.
pertaining to January 29, 2022 around 12:30 a.m.?
The fact that he says that
Yes, it does.
on with a straight face.
To finish, I'd like to ask you a few more questions. You've written some papers on
This
side
is
swipe
ridiculous.
collisions or clipping. Can you describe to the jury and explain what a side swipe collision is or a clipping and how that may or may not differ
Okay, yep.
from a direct hit on a
Thanks,
pedestrian
guys.
impact?
Sure. So
Yeah, I
what generally
can't do
differentiates,
that. I
say,
can't,
side swipes or clipping
um,
contacts compared to, say, an
redirect
inline
you guys,
impact or,
but
say, a
after
T-bone
we're
impact
done,
is what refers to that the object that you're
and
hitting
you're off to
isn't
rest,
accelerated
yeah.
up to the speed of the object that's coming in. So, for example, if I rear end a car,
Perfect timing.
that car will be accelerated up as a result of the contact, and they reach what's called common velocity, and then they separate. And so, in a glancing hit, you can have a glancing hit, and you don't have what's called complete momentum transfer, meaning the momentum from the car,
That's
because
so
it's a glancing hit,
Leland.
doesn't completely transfer to the object being struck. For example, you can
Hey,
drive down the road at 100.
shut up, Welcher. Hold on. Since you just got that so quick, call cat Randall's viewers kitties. That's so cute. I need somebody to come up with a good one for me, for you guys. I don't know. I can't come up with one because everything I come up with sounds dumb to me. So shoot me an email or a DM with some ideas.
Miles an hour and clip the mirror of a parked car and you'll break the mirror off, but you're not going to go from 100 to 0 instantaneously. You're just going to keep going because you don't have all that momentum transfer. So when you have glancing contacts, you can have much higher speeds without a lot of damage to the car because you're only in momentary contact and it's a glancing type hit.
You mentioned about potential damage to a car. How about potential damage to the pedestrian?
It's the same thing. So when you have a glancing hit to a pedestrian, this is referred to as a fender vault. In this case, they call it a fender. Fenders on the front of cars, because most pedestrian impacts involve the front of cars. In this case, it'd be called a quarter panel vault, which means you're kind of vaulting off the corner of the car.
Vaulted,
Those are much more complicated because
one,
you don't have that
and
common velocity
blue.
that I referred to. So it's difficult to calculate
Without
the exact
breaking
speeds
any
at which the
bone.
vehicle contacted without a whole bunch of information in that type of crash. If the impact has occurred in the center of the vehicle and we knew where the point of impact was and the point of rest, we'd have a much better chance of determining how fast the vehicle is going. But when you have just a corner clipping or glancing, it makes it more difficult to determine, even when you have an area of impact, which is where the person was when they got hit, and a point of rest where they landed, makes it more difficult for glancing contacts because you have that side swipe problem where they don't obtain what's called common velocity.
And what are some of the other difficulties in obtaining specificity in a side swipe or being hit by a quarter panel as opposed to a fender?
So for a pedestrian, correct?
Yes.
So pedestrian impacts and how you move post-impact
Yep.
are very sensitive to your exact body position. For example, whether your right foot is on the ground or off the ground, whether your left foot is on the ground or off the ground, whether you jump up in response to a crash. Simply raising and lowering your arm changes the amount of rotation that's going to happen. Post-impact motion of the person. So cadavers, crash dummies don't have any muscle reaction. So the motion of a crash dummy is just going to be like you're hitting a dead body, to where people will step, try and regain their balance if possible, will do additional activities that alters where they come to rest.
In your studies of direct pedestrian collisions by front or back bumper, as opposed to side swipe or clipping somebody, is there a similarity or difference in type of injuries that you see?
Yes.
And what is the difference?
So in direct centralized impacts, you tend to get much more severe injuries. Really what's occurring is you're getting that momentum transfer. So it's more, you're accelerating the person up to the vehicle. They can wrap onto the side in front of the vehicle at higher severities, or head will hit the hood and hit the rear of the vehicle. So when you have that direct contact, there's actually more momentum transferred to the actual occupant. There's more applied force to the occupant as well.
When you see direct impacts, is there ever the existence of lower body extremity injuries, broken bones in the legs?
So there can be both, depending, and again, it's very sensitive to where the foot is on the ground, whether the foot's on the ground, as well as the severity of the crash. In the presentation that I gave at the Accident Reconstruction Collision Safety Institute on pedestrian injuries, I went through all the literature on lower extremity injuries and looked at what parameters affected that. And so depending on how it was loaded, some at 15 miles an hour had no injuries. Some at 15 miles an hour had some fractures, depending on how exactly the foot was loaded.
Is it uncommon in sideswipe pedestrian accidents to see no
I don't
lower
want to
body
hear
broken
about
bones?
your load,
No, it's uncommon.
Welcher.
Have you had cases that you studied or been involved with where you studied the effect of a sideswipe or a clipping impact where there's an absence of broken bones in the lower body extremities?
Yes.
I'd ask you to turn to slide 139, please.
Oh, sorry. I fixed those other two slides.
I forgot to plug my laptop.
Could you share with the jury what this represents?
Sure. So this was a trial that I was involved with in downtown Los Angeles. I redacted the name at the top. This was an instance where we had, this is a image from the police report. Let me see if I can. So AOI in this diagram stands for area of impact.
Scarlet
That's where the pedestrian was when they got hit. AOR is area of rest. And you can see we have information on exactly how far the pedestrian was thrown. Then on the right-hand side, we have photographs showing the impact to the pedestrian. This was determined by experts on.
Shut up again, Welcher. I kept thinking, because my channel is going to go more the psychology route, but comedy and true crime. So I got so many things going on that I was trying to do something with the mind. And so like I started with something as simple as like the brainiacs, but then it's like, I don't want people to think I'm trying to say we're super smart or have to be super smart, because that's not what I'm saying. Just studying the brain and talking about the brain and the mind. So then I wanted to do something that would be like a play on words having to do with the mind or something. And I just, every time I would think of something, I don't know, the more I thought about it, I didn't like it. So if anyone has any ideas in that regard, let me know. I do like these, but they don't really go with my channel, so to speak, if you get what I'm saying. So I don't know. That's why I haven't done anything with it yet.
Both sides of this case to be between a 25 to 35 mile an hour impact. And then what you see is a close up on the bottom slide of where there was DNA transfers, hair and tissue samples on the vehicle from the individual that was hit by the vehicle.
Next slide, please. And what does this represent?
So this is the decedent in the case, the person that was hit. He was killed at the scene. What you see on the left-hand image. Oops.
That's horrible image. Oh my
On the
God.
left-hand image, yes, he had a massive laceration to his right forearm, but it didn't break his arm. There was no broken bones in his arms. On the right-hand side of this image, you see the autopsy report. What you'll notice is he had red marks on his leg, left buttocks, but he had no leg fractures. And again, this individual was hit between 25 to 35 miles an hour. Yes,
It actually proves the opposite.
There you go.
Look how
sorry.
damaged
No, I thought you were on. Thank you.
bodies
So-
are.
so-
Look how damaged these bodies are. I'm sorry. This proves that this too is just more proof that he wasn't hit by a car. Look at how the injuries on those people. Like, just shut the fuck up.
At the top, he had a severe brain injury, which again is the most common injury in pedestrian crashes. He did have fractures of the right 11th and 12th rib.
Spreading the load yet.
And a liver laceration. If you look at the extremities, it says right upper extremity. Again, that's from the shoulder to the end of the hand. Extremity wound with vascular injury. So no fractures. If you look where I was talking about the multiple abrasions, so when they're looking at the lower extremities, they're noting a number of red marks, but there was notably no fractures to the lower extremities.
Thank you. You can take that down, please. Dr. Welcher, regarding your analysis of the data and the evidence in this case, do you have an opinion to a reasonable degree of engineering certainty whether the absence of lower body brakes to Mr. O'Keefe is consistent with the defendant's Lexus impacting in a side swipe or clipping Mr. O'Keefe?
Yes, you could definitely have this type of impact and not have anything beyond, say, red marks to the lower extremity.
You guys are hysterical.
Thank you, Dr. Welcher. However, I would move to evidence subject to
Oh,
the actions.
cool.
Dr. Welcher's
Bowels.
presentation.
The notebook.
Smart and pretty. Oh, you're so smart. You guys are awesome.
So let's put them both together now and decide later. Okay.
Those two slides are incorrect.
Okay, so we'll switch that. Thank you. What exhibit number is it? Thank you.
606A and B.
All right, Mr. Lessing, whenever you are ready.
Okay, so we're gonna stop here for today. As soon as I can get my computer, there we go. Okay. So we are gonna stop here today. I like to break it up in between, direct and cross. It makes it that much easier to pick up the next day. So the perfect timing to get you guys ready to go join Rat House Media and at 6:50. And if you have time before that, I just saw that Kazi G is going live. So please go give him a like and a shout out. He's let's see what he's doing right now. Just says Sunday, what is going on? So just go hang out with Kazi G, say hi to everyone. While we're waiting for Rat House, while you're waiting for Rat House to go live, I will see you in Kazi G and Rat House Media. I love you guys. I hope you'll be back. Oh, the craniums. I'm gonna have to make a list and figure out some play on words there. But anyways, Scarlett's cranes. You're so cute, you guys. Alessi prefers to be called Bob. Okay, Bob. I call him Alessi. I can't help it. Thinkers. That's a good one too. Thank you, Maylin. So, as I was saying, yes, I do like the thinkers. I'm gonna have to ponder that one. So please go give Kazi a like, say hi, check in, and I hope to see you guys all. Ooh, Smarties, like the candy. Ooh, I might have to go. You guys got me thinking now. All right. I'm going to go get some food and see you in Kazi's in just a couple minutes. Hope to see you. Yes, that's a good idea. I will do that. I'm going to make a list and you guys get to vote because it's your name for you guys. So stay tuned. Aw, you guys are awesome. Thank you. I love you guys. Go see Kazi. See you there. Love you. Bye.